Everybody, good morning, Indiana. Welcome to special coverage of the Families First Day of Action. I am Scott Aaron Rogers. I'm at home here in Bloomington, and I will be anchoring all day whip-around coverage from around the state as we have groups of folks all over in locations across the state protesting massive Medicaid cuts and SNAP cuts and just the gutting of the social safety net all over the state, hurting Hoosiers in rural areas and urban areas and everywhere in between. I've got here with me on the line Michelle Higgs. Michelle, where are you at this morning?
So, hey, Scott, we are in Martinsville and we are actually at the Senior Day Center Adult Day Services, and they are one of the groups that's going to be significantly impacted by Medicaid cuts. And so, what we did was we joined here and we asked them what their wish list was for donations. And so, our team collected paper goods, and we've got Kleenex because we're all talking about we're going to be crying about the cuts, and toilet paper because that's kind of how we feel about the cuts. Uh, and to clean up the environmental mess. And then we decorated our vans and cars with motorcade for Medicaid and Medicaid cuts and attack on our communities. No cuts, no caps, save Medicaid. And then you'll also notice throughout we've got sunflowers, and that is because we are also part of the Summer of Solidarity with Organizing Indiana. And so the Indiana Rural Summit and Organizing Indiana are partnering with Hoosier Action and Families First for this Medicaid Day of Action today. And there we go, my niece and my daughter. And then there my hi. Yeah, so we're just getting ready to head out now to meet up with the Owen County Democrats at their headquarters. And so we will check in with you from there.
Absolutely, that sounds great. Everybody, give me a hi. Give me a good big cheer there. Fantastic, Michelle. How many vehicles you got sitting out there from Martinsville?
We've got 1, 2, 3, 4, 5, 6 from here.
That is lovely, and that is just the beginning of a long day for you, Michelle. And I will sort of go through the route here. I'm going to let you guys go ahead and start heading out, and I'm going to talk about the motorcade for Medicaid, what you're all up to today, and if you want to get back to me from in the car, if you got reception, I would love it. And or if you want to send somebody at Owen County or one of your future stops, if they've got something going on, if they're rallying, waiting for the rest of the group to get there, you have them get a hold of me, and I am streaming all day. Anybody can, with the link, can pop into the studio, and I will be glad to talk to them.
Awesome. Thanks so much, Scott.
Michelle. Thank you for what you're doing. We'll talk to you again later.
All right. Bye.
Thanks so much. So that was Michelle Higgs, one of the finest organizers I know, and she is with Indiana Rural Summit, Organizing Indiana, and every other organization I think you can think of. One of the greats, and so she is leading this motorcade for Medicaid this morning, all day rather, and this is part of the Families First Action Day, in which, excuse me, sorry, the Families First Action Day, in which, again, organizers from all over the state are leading rallies, marches, activities to protest social safety net cuts coming from the state and the federal level. This motorcade Medicaid is specific to Southern Indiana, and I want to show you guys here the route that they're going to be taking today. Let's see here. There we are. Now I don't know if you can see that terribly well, but as Michelle said, they are starting in Martinsville, and from Martinsville, These folks are going to travel to Owen County, meet folks in Owen County there. Let me see if I can pull up the whole route here. There we go. There we go. Yeah, so they're gonna start in Martinsville and Bloomington, and there you're gonna get a couple groups head together, and they're gonna stop in Spencer and connect with the Owen County Democrats there. From there, they're gonna travel to Clay County and meet up at the Ascension St. Vincent Hospital in Brazil, and that is one of several hospitals, at least 12 in the state of Indiana, that are at risk of closure because of these Medicaid cuts. You see, a lot of rural hospitals they heavily depend on Medicaid funding. A lot of folks dependent on Medicaid are out in the rural areas of the state, and hospitals like these are a lifeline for folks who maybe aren't in as populated an area. And so the owners of these hospitals are at risk of, losing money if the Medicaid funding isn't coming through, if less patients are able to get Medicaid from the state. That impacts these hospitals. Now, they're still obligated to treat people, but if there's no payment coming through, that's going to put these hospitals in serious financial risk. And I got to assume a lot of your owners, big hospital groups, IU Health, Ascension, Community Hospital, Franciscan, some of the larger hospital groups in the state, they say, well, there's another one 20, 30 minutes away. We're going to close this hospital because it's not staying afloat. Well, 20, 30 minutes might not seem like much, but if you're in the middle of a medical emergency, that could mean the difference between life and death. So, from Brazil, and where did I lose my? There we are. From Brazil, the caravan, the motorcade, is going to head to Sullivan and meet up at the Sullivan County Community Hospital there. Again, another one of these rural hospitals that is potentially due for closure. Excuse me. Sorry, I am flying solo here this morning and trying to coordinate texts with various guests, reading emails, got multiple screens open. Do apologize if I go dark for a second there while I'm trying to figure out 12 other screens. I am a producer, director, and talent all day today. So please bear with me. Now, we left off in Sullivan County, and from there, the motorcade will gather steam. We'll keep picking up Hoosiers all day as we go on. And from Sullivan County, they're going to move on to Daviess County Hospital in Washington. From there, this group is going to head to Salem, drive past my Congresswoman, Erin Houchin's office, and stop there in Salem for refreshments, discussion, and a rally and a press conference there. We will be there in Salem around 4 o'clock today, and I will have coverage of the event as it happens. Now, this is not the only leg of the motorcade for Medicaid. That is sort of the northwest route coming from up here in the Bloomington, Martinsville, Spencer area and moving through the state to Salem throughout the day. But there is another group starting in Warwick County and meeting at the Ascension St. Vincent Hospital in Boonville. And from there, moving on to Salem and Washington County. Finally, there is another group starting in the southeastern part of the state, traveling from Jennings County and meeting at the Ascension St. Vincent in North Vernon and moving to Salem from there. So all three of these groups are going to converge in Salem for a rally and press conference later today at 4 o'clock. Maybe we'll see our Congresswoman Erin Houchin there, but probably not. Again, Houchin, a rubber stamp for the Trump agenda, for the Republican agenda, voted for this big, terrible bill, and is responsible, along with many others, for making Hoosiers' lives worse. Let me go ahead and pull this down. I'm going to show you here the hospitals are at risk in Indiana. We talked about some of them there: Davies, North Vernon, Brazil, Salem, Sullivan. But right here in southern Indiana, we've also got Corydon is a hospital that is potentially set for closure, that is endangered by these cuts. That's down in Harrison County. While many of these hospitals are concentrated in the southern area of the state, you will see that it is not only southern Indiana that is due for some hurt. Memorial Hospital in Logansport in the north central area of the state, Community Hospital of Bremen, Ascension St. Vincent in Winchester, that's in the eastern part of the state. Let's see, Rensselaer, northwestern Indiana, they're the Franciscan Hospital, and Adams Memorial in Decatur. These hospitals are all at risk of closure. Now, I like to, well, it's not really a little game. It's not much fun. But what I do want to do is show you something that I like to do. And it is look at these hospitals. Let me see if I can bring up the old, there we are, the old Gmail here, the old Google Maps. And find this hospital. We're going to find one of our hospitals and play a little game. If I have a medical emergency right across the street from where this hospital is now, if it closes, how long is it going to take me to get to the nearest hospital? So, for example, let us there we go. I'm going to show this right here for you. And we're going to look up the first hospital on our list there, which was the, let's look at Brazil. That's where our Medicaid motorcade is going to start. It's the first hospital, rather, they're going to be hitting here today. So, Ascension St. Vincent in Brazil. Okay. Here is, I said, there we are. So here in the center of our screen, if you can see that, is Ascension St. Vincent in that's Ascension St. Vincent Clay in Brazil. And I like to do this little game here. We're going to look at for a hospital nearby here. And where are we? Where are we? So here are the nearest hospitals to that. Next one nearest to there, Terre Haute Regional. Wonderful. Okay, here we are. Fun game. Google Maps. Thanks to all thanks to them here. If we have a heart attack, stroke, pick your medical emergency. Cross the street from Ascension St. Vincent. That's a mouthful there. If we have a medical emergency across the street from Ascension St. Vincent in Brazil, and that is not an option, your nearest hospital is 28 minutes away in Terre Haute. Think about that. 28 minutes is a long time in a medical emergency. A minute could make a difference between life and death. And there you're looking at 28. So let's look again. Let's see where else. We could go to maybe Davies Community Hospital's the next one nearest there. No, that's an hour and a half away. So again, we're going to look at several of these hospitals throughout the day, hopefully with some guests, because good God, it is hard to carry this thing here by myself. There we are. We're back here. All right. So let's move on. We're gonna talk about why this Medicaid, motorcade, and this Families First Day of Action is taking place today. So the big beautiful bill, as President Trump named it, the Republican Reconciliation Plan, what it really is, cuts nearly $300 billion from the Supplemental Nutrition Assistance Program, SNAP, through 2034, and that's based on Congressional Budget Office estimates. This is by far the largest cut in SNAP history. SNAP, previously known as food stamps, this is food assistance for people who desperately need it. And that's just the SNAP. That's just the food assistance. So additionally, these Medicaid cuts, let's talk about them here, maybe. Here we go. This is from the Indy Star on June 20th. An article titled, Hoosiers Could Be Kicked Off Medicaid Under Trump's Big Beautiful Bill. What to know. Some Hoosiers could be kicked off Medicaid if President Donald Trump's One Big Beautiful Bill Act passes in its current form, as the state grapples with the revenue cuts that would come with it. This is from before the actual passage of the bill, which, as we know, did go through. So, language added to this legislation on June 16th caps the Medicaid provider tax, which is used to cover 90% of the state's portion of the costs for the Healthy Indiana plan at 3.5%. So what does that mean? The federal government has traditionally covered 90% of Medicaid, and the states pay 10%. Of that 10%, 90% of that has been paid for, typically by this provider tax. Now, Indiana uses a 6% provider tax. The legislation would cap this at 3.5%, meaning the change would decrease funding from the fee by nearly half. So think about that. That means states which, sorry, let's look at it this way. So, opponents of the provider tax view it as a loophole used by states to qualify for matching dollars from the federal government, which I said pays for 90% of the costs of the program without having to dedicate much of their own funds. The federal government is wanting the state to commit their own funds from their own, general fund and not through taxes on these providers. Back to the article quote, if passed as is, Indiana would not be able to afford the current costs of the Healthy Indiana plan. That is our name for our state Medicaid plan. That is the state's insurance program for low income people. This is according to Indiana Family and Social Services Administration Secretary Mitch Robb. He said this at a budget committee meeting on June 18th. Neither Rob nor Mike Braun are asking Congress to keep the full 6%. Instead, Rob said at the meeting that he wants Congress to add language that would give states flexibility to adapt. These changes would allow the state to enroll fewer Hoosiers in HIP. Right? What he's talking about, fewer Hoosiers in HIP, means fewer Hoosiers with access to health care. Fewer Hoosiers who have insurance coverage for emergencies, for preventative care, for mental health care, for all of the things folks need. And it's not like when our people get health insurance, get access to health care, it's not like a product you can hoard. The government isn't giving people free stuff, as it were. It's a service, it's care. And if we saw anything during the pandemic, it's that it's all related. You know, health is not an individual matter alone. It is a community thing. We're all interconnected. Public health is a thing. We depend on one another to stay healthy. Um, if I get sick, that can spread to my family, my friends, my neighbors, who can then pass it on. It is not an isolated incident when one of us falls ill, especially as we can see with things like communicable disease. So, even without all of that federal legislation, and that's something I do think we have to keep in mind as we go throughout this day, talking about the Medicaid cuts. A lot of these are not going to take effect until 2027, 2028. The Republicans in Congress and the Trump administration have done a very good job trying to kick the pain down the road a little bit so they can pin it on somebody else when it really hits. Now, that said, there are changes that make it more difficult for folks to qualify for assistance right now, right? That went into effect July 1, making it more difficult for Hoosiers to qualify for Medicaid. So, back to this Indy Star article, even without the added impact of the federal legislation, the state is making it more challenging to qualify for Medicaid. The latest version of HIP already includes more restrictions, such as work requirements for able-bodied recipients that passed the legislation this year. And I'm going to stop there again. The trope that able-bodied recipients are scamming Medicaid is a lie. The vast majority of Medicaid recipients in this state are disabled, suffer from chronic health conditions, are caring for somebody with said conditions, and various other extenuating circumstances. The target of Republican scorn currently is this mythical 29-year-old who sits in their mother's basement and plays video games all day, and is somehow scamming healthcare. I it's ridiculous. These people are few and far between, and the cost of employing folks and having all these paperwork checks and everything, it costs more to administer the means testing than you could ever possibly save if these people got care that they quote unquote don't deserve. And frankly, everybody deserves health care. It is a human right, and we shouldn't have to rely on scamming or jumping through hoops or means testing or whatever to deserve health care. Every every country in the industrialized world has figured out a way to do single payer or universal health care of some sort. Only in America do we have this ridiculous for profit model that squeezes folks at every opportunity. It does not serve the public well, it does not serve the health of our communities well, but it does serve stakeholders, or well, no, not stakeholders, shareholders. It serves shareholders well. It serves the ownership class. It serves the wealth class. It does not serve all of us. All these checks, all these hoops, serve as a place for somebody to say no. And when they say no, and you don't get the care you need, your life could be on the line, you know? I want to come back to this article. Um, this is a statement from Mike Braun on June 18th. Quote, flexibility in managing Indiana's HIP program will be essential for the state moving forward, especially if we are required to take on more of the financial obligation. This will require a hands-on approach to updating and maintaining Indiana's Medicaid system that only Hoosiers can provide. A lot of words saying nothing. He continues saying he would work to stretch the dollar for people with chronic diseases and those who really can't afford health care when speaking to reporters at the State House on June 19th. He continues, that's what I'd like to have it there for, not what it's expanded into with very lax supervision, pushed by the feds, and now with a bunch of begrudging state partners because it's been busting the budget. Look at the way Mike Braun so casually talks about human beings, Hoosiers, his constituents, like statistics. He's saying you don't deserve health care. Maybe I don't deserve health care. And really, if we all just pooled our resources and did this the same way the rest of the world does, it would be cheaper, it would be more efficient, and the only people that would suffer are Mike Braun's donors. So that's sort of the situation with Medicaid in the state currently. This will continue to get worse. I want to look at my very own article from yesterday at HoosLeft.us now. I spoke with Jennifer David. She is a disability advocate here in Southern Indiana, and we talked about the Medicaid cuts and the way they're going to hurt Hoosiers with disabilities. And I want to talk about some more of the changes that are going into effect right now in Indiana before these big, brutal bill cuts take effect. So, like we said, this summer, July 1st, some changes went into effect, and the law passed this spring was SEA 2, Senate Enrolled Act 2. So, because Medicaid is run jointly by both the state and federal government, Indiana needs permission from the feds to roll out some of the changes in the new law. So, some of these changes are not in effect yet. They will not go into effect until we have explicit approval from the Trump administration. Um, these are for work requirements. And if you listen to the interview I conducted with Jennifer, what it really comes down to is that the work requirements, and again, most people on Medicaid are either working or incapacitated in some way such that they deserve Medicaid. Um, these work requirements were waived by the Biden administration, and the Trump administration has not given approval for states to put these back in place. Let me quote here from my own article. So the Trump administration, the first Trump administration, encouraged and approved the use of these waivers, granting states the ability to condition Medicaid coverage on meeting work and reporting requirements. Okay, approving 13 such states for these waivers, including Indiana, before a federal court ruled the work requirement unlawful. So, first Trump administration tries to slap these work requirements again, which are mostly paperwork requirements designed to weed out deserving people, getting them stuck in red tape. So, the Biden administration withdrew the waivers in all the states that they had been approved, though a different federal judge then overturned that. And we could go off on a whole rant about the way the legal system works in this country, and the fact that you can never actually get anything through. You can't pass a law without it then being litigated in multiple courts. So the Supreme Court has never ruled on this issue. But I think it is safe to say that the current Trump regime will gleefully enact the more stringent requirements, and his packed, stolen, and corrupt Supreme Court will roll out the red carpet and allow these things to continue. So, the article that I cite in my comments here continues, quote, "We estimate that should this provision be implemented, hundreds of thousands, probably about 150,000 Hoosiers could lose their health care coverage simply because the process of reporting and demonstrating eligibility is very labor intensive and prone to error." End quote. That is Tracy Hutchings Getz with Hoosier Action, who hopefully we will be able to bring onto the stream here later today. In another part of the new law, Hutchings Getz has already been implemented are more frequent checks on eligibility. So, work requirements or not, this has gone into effect that instead of checking eligibility once a year, now recipients are going to have to refile every 6 months. And Hutchings Getz continues, quote, "What we have heard from members is a bunch of data on an individual might not always be accurate." She says that this could slow down the HIP approval process, leaving Hoosiers waiting for coverage. And really, that is the design. Again, we're not weeding out scammers people committing fraud, and freeloaders. We're taking people who need Medicaid and making them jump through hoops, making them navigate red tape, so they don't ever actually get to cash in on the care they need. They never, maybe they forego necessary care entirely because of the red tape, because of the frustration, and the ordeal, the process of filling out all the paperwork and jumping through the hoops is so time consuming and frustrating that a lot of folks just give up, and they forego necessary care. And maybe they get sick down the line, and they're sicker down the line, and they wind up in the emergency room without coverage, and then who pays for that? you know Taxpayers wind up paying for it on the back end when it's more expensive. The smart thing to do would be to give everybody coverage and invest more in preventative care and lifestyle changes and things like this, so our system isn't so expensive. Of course, the the wealth class doesn't want things to work that way. Our healthcare system might not work well for patients. It might not work well for doctors and nurses and care providers, but it works great for insurance companies and drug companies and uh, all these other folks who have designed a very profitable system that is not necessarily a very effective system. Um, Tracy Hutchings Getz said, 150,000 Hoosiers might lose their care. And, these folks are not statistics. These are real people who deserve health care because they are people. And that should be enough. Like I said, healthcare is a human right. And I think we in this country are very short sighted and really take this American exceptionalism thing seriously, and don't really look at the rest of the world and the way they do things, and if they may be more effective. And we're so outside of the global mainstream. And even with that, now, even with all of the Obamacare, the Affordable Care Act expansions of, wow, a decade plus ago now, um, got a lot more people insurance, expanded coverage to a lot of folks, and still we lag behind the rest of the world in covering our population. And now, you know, GOP lawmakers and the Trump administration keep finding new, innovative ways to make things worse. Excuse me one second. I am going to see if we can't bring Michelle back in here. I'm going to bring up this Medicaid map again for y'all to check that out. Bear with me while I send her an email so we can hopefully get some more folks in here. There it is. Oh, the live link. Sorry. There we are. View my channel. Hey, look, that Scott Rogers guy is live now. All right, fantastic. So, hopefully, we can get some more folks joining in here shortly. Now, oh, let's see. Let's see if we can't get Becky Hanscom in here from. All right, I'm back. Sorry about that. Just trying to pull some other folks here and into the stream, get some other speakers here that can join us. So we were talking about the 150,000 Hoosiers, that are not statistics here, real people who deserve healthcare because they are people. And let's see, what can I find out? There we go. That's what I wanted to bring up here. Maybe it's not. Okay, here we go. Got a little statistic here I wanted to show you folks. Got a little Medicaid fact sheet. Now, this is as of May 2025, just a couple months ago. In Indiana, we have over 1.8 million children and adults enrolled in the state. So, among all Medicaid enrollees in Indiana, almost 40% are children. 25%, almost 23. So about 1 in 4 live in a rural area, and 1 in 9 have 3 or more chronic conditions. A majority of Indiana adults on Medicaid, 72%, are working. 45% are working full time and still on Medicaid. Now, think about that and where those gaps are. That is folks who are working full time whose employers are not providing insurance coverage. We've got 27% of these folks still working part time, meaning 28% of adults receiving Medicaid in Indiana do not work. So already a small minority of folks on Medicaid are not working. And again, of those who are not working, these are folks with disabilities. These are folks that have chronic conditions. These are folks that are taking care of a loved one that has chronic conditions or a disability. Um, People are not taking advantage of this system. In Indiana, Medicaid covers over 40% of all births, almost 40% of all the children in the state are covered by Medicaid. 17% of adults 19 to 64. That's prime workforce age, I guess they would consider that. Only 17% of Hoosiers in that age use Medicaid. 44% of all working age adults with disabilities are covered by Medicaid. And 66% of nursing home residents are covered by Medicaid. And I want you to think about like what Medicaid cuts can mean for folks like that. Our nursing homes in this state are already terribly understaffed. These folks are oftentimes, the most vulnerable members of our population, and don't get adequate care, not because of anything their doctors or nurses or care teams are doing, just because there are not enough resources to go around. I want to continue to look at this fact sheet here. This is from Kaiser Family Foundation. A lot of great health data available from those folks. So, Medicaid spending in Indiana total $17.3 billion. Now, 33% of that, a third, is spent on long-term care, like we were talking about, nursing homes, etc. About 47% of that is managed care, meaning your, typical doctor's visits, preventative care, checkups, whatnot, and about 16% for acute care. Now, federal funding, according to this, is 75% of total Medicaid spending in Indiana. And I don't know exactly how that works because, because I was stating, Medicaid is typically covered about 90% of the program, with the state picking up the other 10%. So maybe somebody smarter than me will be able to help me sort of decipher that going on later here today. Most Americans hold a favorable view of Medicaid. Most Americans hold favorable views of Medicare, of our social safety net programs. 77% of Americans hold a favorable view of Medicaid. 87% of Democrats, 81% of independents, and even 63% of Republicans. Despite the hatred for Medicaid, it would seem, from their leadership, rank and file conservatives do see value in Medicaid, in taking care of our most vulnerable folks. Okay, I'm going to move on from that one. Let's see if we can't pop this back here. Hoping to hear from some more folks there throughout the state, calling in from your neck of the woods. I know it's several hours before a lot of these events get underway still, but we are looking at an event in Terre Haute this morning at the Vigo County Courthouse from 10 to 11. Indivisible Wabash Valley and a group called Network Lobby are co-hosting that event, hoping to maybe connect with some folks out there in Terre Haute today, see what's going on at the courthouse there in Vigo County, and talk about how these cuts will affect folks there in Western Indiana, excuse me. Also, later this morning, We've got stuff going on up in Northwest Indiana in Maryville. Pull this thing here down. There we are. Now I can see. In Maryville, the Northwest Indiana Interfaith Action and Everybody Counts and SEIU HCII are co-hosting that event starting at the entrance. Well, yeah, not starting at the entrance, but ending at the entrance to Methodist Hospital South Lake there in Maryville at 87th and Broadway. That is going to be starting here at 11:30 Central Time. That's Central Time up in Maryville. So 12:30 for the rest of the state. But Northwest Indiana, Maryville will be showing out today, starting at the Everybody Counts office in Maryville at 9111 Broadway. They are expecting some weather up there, maybe, perhaps. So if that happens, they'll be sticking around the Everybody Counts office there. But oh, hey, look at this. We've got someone here to join us. Good morning, Colin.
Can't hear you. Oh, let me if I turn my.
There we are. Streamlabs.
Hello.
Howdy.
Hey!
And hey, there's Michelle again. So let's see. Hey there, Colin. I see. You.
But I can't hear you.
No.
I don't know why.
Is your mic on?
My mic is on. The phone is turned up.
Well, maybe I can get back to you here shortly.
But no.
You have been unmuted.
Toggled that trying, but I can't hear him.
No? Is your volume up?
I can try to switch over onto mine.
Okay.
All right.
I'm going to need to charge those next off. Yes.
Colin, you there? Well, we lost Colin, but it looks like our motorcade there has caught up with Owen County Democrats there in Spencer, and they're going to be getting together, adding additional vehicles and additional people there to the motorcade before they head on off to Brazil. Let's see here. Sorry, folks. Working on sharing some things with people. Do not mind me. Hey there, Zach.
Hey, Scott, can you hear me?
I can. Can you hear me?
Alrighty. So,
fantastic.
We are in Spencer, in front of the Owen County Democratic headquarters. Just had the Morgan County crowned, and Michelle is here. And
that's fantastic. So hey,
Bill from Owen County.
Good to see you.
Hey there.
We're getting ready to go for a ride.
And
about to head out here shortly, yeah?
Yep, just a little pit stop, and people have been decorating their cars.
Awesome. How many vehicles we picking up there in Spencer today?
With the Morgan County crew, we're looking at, I think, a dozen cars.
Okay, so it looks like we've about doubled our caravan since Martinsville already, and that's just the first stop along the way. And I assume when you get to Brazil, you're going to pick up even more.
Yep.
So let me ask you, Zach, the folks there with you, what is bringing them out to get today? How are Medicaid cuts going to affect them and their personal lives?
So as I'm sure many of us are aware, the Medicaid cuts, it's not one-dimensional. It's going to hurt people from everything from their day-to-day medications for chronic or first distant conditions or their day-to-day hospital expenses all across the map. But basically everyone here has a direct connection or an immediate family member who is going to be seriously hurt by these cuts. And I can't remember the exact forecast, but we're looking at tens of thousands, if not a couple 100,000, couple different Indiana groups that are thinking that many people are going to be seriously adversely affected in the first year from the bill passing from the federal level. So it's all very personal for everybody. I mean, we also have an opioid crisis, and I'm sure we'll be picking up people in the Northwest who unfortunately have personal stories about that. It's long past time in our state. We had addiction recovery centers in every county, in every corner, and the clinical workers and caseworkers and specialists that have the experience and the empathy and the plans to help bring those people forward, to stop long waiting lists, because in many cases it can almost be the difference in life and death, and getting some of those people in to get that care they need. And Medicaid also helps in some of those cases with paying for that rehab for those people who need it.
Yeah, and I'll tell you what, it's kind of like this vicious circle too, because a lot of times if you don't have access to proper Medicare, if you're cut off from Medicaid or unable to get in to see somebody in the traditional way, that's why a lot of folks turn to illicit substances. They turn to heroin or fentanyl or whatever to and self-medicate because they are shut out of the system.
Yeah, absolutely.
So I gotta ask, what is the situation like for healthcare there in Owen County? I'm here in Bloomington. We've got a couple hospitals.
Right.
Do you have a hospital in Spencer in Owen County, or are you having to travel?
Do you want to answer that? Asking about hospital situation in Owen County.
Well, we don't have a hospital in Owen County. The closest hospital.
Did there used to be a hospital in Owen County?
There is a care center out on the west side, but it's not a living hospital.
And there's a care center in here. So
Yeah.
nursing homes, are going to be way affected by this. Yeah, they're going to be they're going to be way affected by this. So we've got a nursing home on the east side and a nursing home on the west side. And, a lot of people who are in there are from the more poverty stricken or poor families of the county and roundabout. And so, whether they know it or not, this is going to affect them a lot.
Yeah.
That's my
If you were to have an emergency right now, you're in Spencer, how long do you have to go to get to an emergency room?
It would be
half an hour.
Yeah, half hour, 30 minutes to Bloomington.
Yeah.
Yeah, and so that situation, that it sounds like you're in a sort of healthcare desert already there in Owen County, and that sort of thing is coming for more Hoosiers.
Yeah, I agree.
And there's also a IU doctor's offices on the west side, and another where am I? There I am. And another medical center on the west side. And so I feel like they're all going to be affected because the people who use those facilities are from poor families. This is just a lower economic county.
Yeah, absolutely.
Yeah.
So, and it's got to affect the overall public health in your county.
That's true. And all the counties. I know I was raised down near Washington, Indiana, and have relatives down there. And if that hospital closed, that's really a Sahara Desert area of
That's
healthcare.
one of the ones on the list, I believe, isn't it?
I think it is. Yeah.
Yeah, I think y'all are stopping there at some point.
Yeah, we are. My nephew and some friends of ours are going to join us in Washington. He owns a big trucking company, so I'm not, and he's also a drag racer, so who knows what he's going to drive.
Is that right? Well, I'll tell you what. You know, if those folks, if you all want to share the link with them, I'd be happy to talk to them while they're waiting for you to get there and see what they're doing down in Washington. Before the motorcade
we'll
meets up.
consider that. I'll see if I can figure out how to do that. JT Express is his trucking company, and he's probably busy as all get out. He'll take off and join our. He's going to join our. But he'll be joining us on the way.
Well, that's fantastic. It's unfortunate that we need to pick up all these folks and we need to do this, but it's good to see the solidarity across the whole state and see folks really coming together to work for each other's.
Well, you know, in Owen County, this has been a hardcore Republican county and for a long time, but we're getting large crowds. We had 100 people in Spencer for an hour-long protest on Highway 46. So we've had people stand in the rain for an hour protesting. You know, they've never seen this in Spencer before. So I think people are waking up.
Yeah, are folks changing their mind? Are they seeing that it is Republican policy that is hurting, or is it just government, right?
No, I think it's Republican. I know we were at the county fair, had a booth at the county fair a week or two ago. We gave out over 250 pocket constitutions, and I had several people who said, I voted Republican all my life, but not again. So I think they recognize this is a right-wing fascist party. Really, they don't use that term, but I do. And the Republican Party is what's killing their health care and threatening to, and just basically the Republican Party's for the rich.
Right, and it always has been. But
yeah, that's true.
It does seem like as the cuts are hitting closer and closer and closer to people's homes.
I think they've always been for the rich. I don't think they've always been totally fascist. And I think now the totally fascist party, that's exactly what Trump represents.
Absolutely. Well, but you know, some folks they think the fascism is just going to come for other people. And,
that's right.
And or maybe okay with that. You know, it's the classic case of I didn't think the leopards would eat my face, right? And now the leopards are eating a lot of Hoosier faces.
Yeah, and I think when people can't get somebody to roof their house, to do their landscaping, when they start realizing those are the people that are the immigrant community supports the whole community. And when they realize how bad this is going to hurt labor in the area, I think America has a chance of waking up and becoming a democracy.
You know, as we go back to the... Oh, sorry there?
I said, thanks for coming up, being on.
Oh, absolutely. Thank you for what you're doing out there. And we'll keep in touch throughout the day as y'all are on your way throughout the southern part of the state there.
We've got our own building here in Owen County that we own. It's an old church, and it's really nice to have our own meeting space.
Yes, absolutely. I bet. And just so important to have a toehold in a lot of these places. I know it's not always easy work out there in rural Indiana, being a Democrat and trying to organize as a Democrat, and maybe folks have the wrong idea about what we stand for. Yeah, but like you said, I think that's changing, and I want to thank you. Oh, well, it looks like we lost contact with Zach there and his folks out in Owen County, but we'll catch back up with them. I'm going to go ahead and take that off the stream here. All right. See if we can get other folks joining us again throughout the day. So we were talking about some of the other events that are going on throughout the day here, and I wanted to pull those back up if I could. Ha 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 ha. Nope. Oh, silly Scott. All right, let me see if I can't. Find this file that I wanted to share with you all. Okay, there we are. We were sort of talking about our timelines, stuff that was going on early this morning. So, yeah, we've got stuff going on in Terre Haute, which is underway now. If I understand correctly, we do have contacts out to the folks out there. Haven't heard back yet, but we'll send you out to Terre Haute if we can. Fort Wayne, they are going to have an event most of the day here from 12 to 7 at Headwaters Park. That's at 333 South Clinton in Fort Wayne. That's with the group Count Us In. They're going to be writing postcards and have a table there, I believe, that is at Fort Wayne Pride. So awesome stuff going on there. In conjunction with another major event. Starting here in the next 20 minutes in Greencastle. Looks like we have a rally at the courthouse square there in Greencastle. Later on this afternoon, we've got, here's one up in South Bend. It's from 12 to 1:30 Central, so 1 to 2:30 Eastern time at the State Highway 933 and Brother Andrew Drive intersection there in Notre Dame. That's the South Bend area. The Michiana Alliance for Democracy and We Make Indiana are holding a die-in there. Also this afternoon, starting at approximately 1 o'clock, a group of folks in Winchester are going to gather and then rally and caravan to Richmond. This is the Richmond Housing and Human Rights Coalition in conjunction with a group called the Nonviolent Medicaid Army. We are going to be talking to people out there in eastern Indiana later on today. I want to say Winchester. Yes, there is an Ascension St. Vincent hospital there in Randolph County in Winchester, which is potentially on the chopping block. So folks there at risk of losing their hospital. We talked about the motorcade for Medicaid, and they are winding their way through southwestern Indiana and meeting up with another group coming in from southeastern Indiana. They are coalescing in Salem at 407 North Main for a rally, press conference, and picnic. There at 4 o'clock, the Washington County Community Action group is leading that event right there, kitty corner from Aaron Houchin's office. So we were talking about the hundreds of thousands potentially of Hoosiers, children, seniors, people with disabilities that could be affected by gutting Medicaid. Now, like we said, nearly 2 million Hoosiers currently rely on Medicaid for their health care. I'm seeing statistics. Tracy Hutchings Getz said about 150,000 Hoosiers potentially could lose their health care with this round of cuts. The Congressional Budget Office, a nonpartisan group that calculates the financial, the budgetary effects and such of legislation that goes through Congress, they posted on the website of the Senate Committee on the Budget. This is from late June, so less than a month ago. The budgetary effects of an amendment to the Big Beautiful Bill Act. The CBO estimates up to 267,000 plus Hoosiers could lose their health care. So that is almost twice as many as Hutchings Getz suggested could lose their health care. And again, that's Tracy Hutchings Getz from Hoosier Action. She is going to be in Mitchell today, and we hope to get a chance to talk to her. Where did we say? Where's our fact sheet there? I wanted to see where they're at. Yes, Mitchell. That one's coming up at noon. That's at Friendship Park there in Mitchell, Southern Lawrence County, with the group Lawrence County Deserves Better. They're holding a rally and a community organizing meeting there in Mitchell from noon to 1:30 Eastern. If any of you are out there, out across Indiana, rallying today at one of these rallies, get a hold of me. We would like to hear from you. You can email me. I will have my email up on half the screen all day long, and I will send you a link so you can join me from where you are. My email is easy. It is scott@whosleft.us. Again, if you are at any of these events across the state today, from Maryville to South Bend and Fort Wayne, or down here from Terre Haute and Boonville to Salem, I want to hear from you. I want to see what you're seeing. I want to hear from the folks in your community who will be affected by these Medicaid cuts. Are you affected by these Medicaid cuts? I want to hear from you. Again, you can email me at scott@whosleft. I am here all day streaming live with whiparound coverage from across Indiana for this family's first day of action. Again, let me hear from you if you are out there. I want to talk about some of the other points that they sent me here. So it's not just Medicaid cuts, right? And we're going to spend a lot of today focusing on that. We're going to be talking about the rural hospitals in particular, and the way they are affected by these Medicaid cuts, the way rural Hoosiers in particular are going to suffer from this austerity being imposed on us from Indianapolis and Washington. But like I said, it's not just Medicaid, it's also SNAP, food assistance. So 128,000 people in Indiana can lose food assistance. Now, here we go. This is from the Center on Budget and Policy Priorities. Articles titled House Reconciliation Bill Proposes Deepest SNAP Cut in History, would take food assistance away from millions of low-income families. So, more than 2 million children live in households that would lose at least some SNAP benefits, and SNAP could end in some states entirely, which is insane. So this Republican reconciliation bill would cut nearly $300 billion from the Supplemental Nutritional Assistance Program through 2034. $300 billion worth of food out of people's mouths. So, as a result of these cuts and other policies, which are being used to pay partly for trillions in tax cuts for the wealthy. And, you know, this is something I really think we have to focus on, that we're not talking about enough, because these cuts are horrible enough in their own right. These cuts are terrible in their own right. But what are we doing with these supposed cost savings, right? Are we reinvesting them into our communities? Are we reinvesting them into our country? Are we spending this money on something productive for society? And the answer is no. We are spending these cost savings to pay partially, only partially, for trillions in tax cuts for the richest people among us who do not need it. And these cuts don't even offset the revenue from the tax cuts, increasing the national debt by at least $3 trillion over the course of the next 10 years. And this is again from the party who claims to care about the debt and the deficit. Now, listen, I will go on about this forever and ever. The debt and the deficit are largely meaningless. Find out more about modern monetary theory. Read Stephanie Kelton's The Deficit Myth. Look into economists like Warren Mosler or Randall Wray. These folks explain how money really works in a country like the United States with fiat currency, where we control our own money supply. The debt is just a number. Again, it is largely meaningless. We owe most of it to ourselves. Concerns about foreign countries holding vast amounts of debt, like Xi Jinping is going to show up at our house with a tire iron looking to collect. It doesn't work that way. These are all false choices. These are all false choices. We could cut billionaires' taxes and still fund our social safety nets, our Medicaid, our SNAP, all of these other programs that actually help people. We could do both. We don't have to choose. This is a choice. Republicans are choosing to hurt people seemingly out of spite. We have the resources. The rich do not need the tax cuts, but the reason to tax them isn't because the federal government actually needs their money. It's because having that much money makes these billionaires entirely too powerful, to the point that they can subvert democracy, as we're seeing, as we saw with Elon Musk the first several months of this administration. Do you trust that he's still not involved? Do you trust that his people aren't sprinkled throughout the government with access to everyone's data? President Donald Trump just continues to get richer and richer as he uses his office to grift across the world with his crypto scams and everything else. Jeff Bezos throwing $50 million and renting entire European cities for his rich guests. These are the things that we get for our money in this country, instead of a well-fed population, a healthy population, a population that is treated with dignity at the end of life. That's what we spend our money on. So this big, beautiful bill, I hate to use it. That's what they called it. That's its name. Stupid. This plan would cut SNAP, the nation's most important and effective anti-hunger program, by roughly 30%. So, as a share of the program, the cut would be about twice the size of the deep cuts to food assistance enacted in 1996. Democrats, I want you to remember that every time you think back wistfully about Bill Clinton. That happened on his watch. We should not forgive him for that. These extreme cuts are deeper than the $230 billion in cuts that the budget resolution called for, because the bill adds tens of billions of dollars in new spending for farm programs paid for by taking more food assistance away from people with low incomes. And geez, this is another one of these things. Look, it's food. We're talking about food. People are not hoarding these benefits. They're using them to eat. This is not inflationary. It's good for entire communities when children have full bellies. It's good for entire communities when people are not going hungry and begging. So this bill cuts SNAP by reducing the federal contribution to states' SNAP programs by as much as 25%, slashing the federal share of states' administrative costs in half, and shifting them onto already strained state budgets. Now, and I hate to go down into this rabbit hole again with an economic lesson, but the federal government, according to modern monetary theory, like I was just talking about, cannot run out of money. The federal government can fund these programs without problem. States can't print their own money. We do not control our own money supply. Lots of states rely on federal funding for huge, huge percentages of state budgets. If that goes away, states can't borrow. We are constitutionally mandated in Indiana, and I believe all the other states, or most of them, to run a balanced budget. The federal government doesn't have to run a balanced budget. In fact, contrary to what a lot of people think, it's actually probably good for the federal government to run a deficit a lot of the time, because the public sector's deficit is the private sector's asset. So, that money is going out to us, to people. The problem is when that money gets spent immediately, like it does with SNAP, like it does with assistance to people. People aren't hoarding. This money gets pumped right back into local economies immediately, especially with food. That goes, boom, to a grocery store immediately back into the economy. When you give tax cuts to the rich, that money doesn't go back into the economy. That stays with the rich. It goes into a bank, it collects interest, and it sits there, and it's not helping people. The government should worry far less about running deficits and far more about the velocity of money, about keeping money moving through the economy. And right now it is stagnant and the economy is top heavy. We've got to break open that billionaire piñata and get some of that stuff flowing again. I went down that rabbit hole to talk about how states can't run deficits. So when the federal government slashes their funding to the states do not have the ability to make it up. So when a state doesn't have sufficient revenues to backfill these large federal cuts, it will have to shift funds from other vital public services, choose how to cut SNAP benefits and restrict the number of people getting help, or opt out of having a SNAP program entirely. I'm quoting here again from this article from the Center on Budget and Policy Priorities. This plan walks away from the 50-year bipartisan commitment to ensure that low-income children, adults, and seniors get the help they need, regardless of where they live. The consequences of ending SNAP would be severe. Hunger, including childhood hunger, would soar despite the well-documented detrimental impacts of even short periods of food insecurity on children's health and cognitive development. Every dollar, listen to this statistic, every dollar invested in SNAP for children returns $62 in value over the long term. And I want to stop there and examine that. These cuts are incredibly short-sighted. Republican legislatures, the Trump administration, GOP, conservatives, they look at public spending as a sunk cost, as a line on a spreadsheet, right? As money that could be going to one of their billionaire donors. They don't look at it as a potential investment. Every $1 invested in SNAP for children returns $62 in value over the long term. Now, I don't know, man. I thought these conservative financial geniuses, these folks who are, got to be billionaires through their own brilliance, would understand investing. And if you framed this in a purely financial perspective, and don't talk about, feeding hungry children and the detrimental impacts on their life from food insecurity, let's frame this as an investment with a 62 times return on average. Now, I'm not a financial advisor. I am not a fiduciary, but it seems that if you had the opportunity to invest $1 and get back $62 over the long term, I mean, that's a no-brainer. That's a no-brainer. These guys will invest if they think they're going to get 15% back. That's 62,000%? How does that work? Back to the article here. So, expanding SNAP's harsh, ineffective, and red tape-laden work requirements to more SNAP recipients, including older adults and parents with children 7 and older, putting basic nutrition for millions of children at serious risk. It's the same technique as with the Medicaid, right? They're not trying to weed out people who don't deserve these things. They're trying to frustrate people from even going through with the paperwork, to get people caught up in red tape so they can't actually cash in on benefits they deserve. This provision, all this red tape, would take food assistance away from roughly 3 million adults in a typical month, including 1 million older adults, above age 55, and 800,000 parents of school-aged children. So, terminating SNAP for these 3.2 million adults would also dramatically cut food benefits for everyone who lives with them, right? Again, we don't necessarily always think about things this way. You've got extended families. You have multi-generational families living together. Sometimes folks need to pool resources together just to feed their family. So, as a result, again, this is the Center on Budget and Policy Priorities. They estimate that this would reduce food benefits for roughly 1 million children and 250,000 adults aged 65 and older, or who have a disability. Children, the elderly, and the disabled. This is who we are taking food from So billionaires can have more tax breaks. In addition, these cuts would permanently freeze the cost of the Thrifty Food Plan, TFP, outside of inflation adjustments, increases the paperwork burden there to get utility deductions, and removing internet costs as an eligible deduction. So, more cuts, more making things harder for people. It's going to increase child poverty. It's going to increase elderly poverty. It's going to make things harder for disabled people. It puts all children at risk of losing some or all of their benefits based on how states respond to this cut in federal funding. All of this, these cuts, taking people off Medicaid, taking people off SNAP, as we're running a severe risk of recession. The Trump tariffs are slowing the economy. A lot of economists think we're already in a recession, and we just haven't seen the numbers yet to back that up. Recessions are when people need more help, when people need more assistance. Back through a modern monetary lens theory, or modern monetary theory lens, when the economy is in a recession, when people are needy, when people need more assistance, that is precisely when governments should run deficits to keep their population stabilized, keep investing in people, and that's how you get out of recessions. So I want to come back to Medicaid. Actually, no, let's stay on food, because these cuts also can affect children who are on free and reduced lunch. Now, listen, if you look at a state very similar to Indiana, Minnesota has similar demographics in terms of race and class and rural urban divide and whatnot. In Minnesota, Governor Tim Walz had managed to expand free lunch to every student in the state. Here in Indiana, we're making it harder for kids to even get free lunch, even harder for kids to get free breakfast at school. There was a Sunbucks program that helped kids have food during the summer when they weren't in school, and the Braun administration stopped that. Why don't they want our kids to eat? As it is, almost half of children in the state of Indiana are on either free or reduced lunch. That tells you about the state of poverty, about the state of childhood poverty in Indiana, and what are we doing? We wonder why our best and brightest leave the state. We wonder why we have a hard time attracting talent from out of state to come work and settle in Indiana. We don't invest in our people. It's no man's land out here. We're really just hung out to dry. I do want to highlight some of the organizations who are working on today's events. One of the big ones, obviously, is Hoosier Action. And if you're not familiar with that group, one of the most important groups doing mobilization work here in the state. Here we go. I'll tell you about Hoosier Action. So, Hoosier Action is a homegrown community organization rooted in small town southern Indiana and led by members. And, they bring together Hoosiers from across their differences to win common sense Hoosier solutions that improve our lives. This is a nonpartisan organization. Um, too many of us have been left out and left behind by politics as usual in Indiana. Now, politics as usual in Indiana has been very Republican for the last 20 years in this state, at least. But by acting together, we can make Indiana a place where all Hoosiers, black, white, and brown, are able to shape the decisions that affect our life. Hoosier Action works toward care, freedom, and opportunity. These are like their three core values. Care. We all have bodies and we all get sick, which is why all Hoosiers deserve quality care we can afford, no matter how much money we have or where we live. And this really speaks to those Medicaid cuts, right? Whether we take care of our patients at the hospital or our kids at home, the contributions of Hoosier caregivers must make the future of our state. I think of AI and the coming AI revolution, and in many ways it's already here. But a lot of jobs that I think we count on now are not going to be here over the next several years. We've already seen it over the last several decades as jobs have been outsourced away from the United States to China, Mexico, elsewhere as capital looks for cheaper labor, So we've seen the job losses in those industries, right? But now it's coming for, what you would consider quote unquote white collar jobs. And vast swaths of the population are not going to have jobs like we have had or do have and have had till now. But you can't automate away the care economy. You can't hand nursing or mental health care or long-term health care or child care. You can't kick these things down to AI. The care economy is the future of the economy. Taking care of our children, taking care of our elders. This is the future of work. Things that can't be automated away. We have a desperate need for childcare workers. We have a desperate need for like healthcare workers, nurses, aides. My God. All right. I'm going to try and get somebody else in here really quick, and I'm going to take a short break, and I will be right back. All right, I'm back. Michelle Higgs, who is in the car?
Hey there, I've got me and an Ashley here with me, and my daughter Elizabeth, and my niece Melanie in the car, and then behind us are about 10 more cars, and we are on our way up to the
Having some technical difficulties there with Michelle. That's that classic Southern Indiana cell phone reception there. But there we are. Michelle should be coming on into Brazil here soon. Is that correct? If you can hear me. Yeah, looks like we got a little bit of lag there. Hey, Michelle, maybe we would have a better connection if you turned off the camera and went audio only. Maybe I'd get a better reception from you trying to send less data. Can you hear me?
I can hear you. Can you hear us?
I can hear you fine. Yeah, maybe didn't have enough internet juice there for audio and video. So where are you guys at right at the moment?
So we are about 18 minutes out from the hospital in Brazil. And again, driving through the rural parts, one of the things that we are counting are the number of dollar stores, Dollar Generals, and recognizing that there really isn't much beyond Dollar Generals, a gas station, and maybe a liquor store in some of these places. And when we talk about what employers are available in small towns in rural Indiana, healthcare is a big one. It's a big employer. So when we lose departments and hospitals, the economic
Yeah, Michelle's kind of dropping in and out there, but you know, she makes a really good point. In that a lot of these small towns, you know, hospitals, schools, are big employers, and these are in many places the only like real middle class sustaining jobs you can find. There is a lot of dollar stores out there, you know, not a whole lot of employment opportunity out in some of these small towns. And let's see if we got Michelle back in there. But yeah, Michelle, we were talking about how, you know, these hospitals and schools and things like that are, you know, some of the only like good jobs out in these communities. And you know, if those go away, it really sets off a sort of downward spiral. You know, you don't have good paying jobs in the community. You have capital outflow. You know, folks don't have money to spend into the economy, so small businesses go under. And then, you know, you don't have people who want to move into these communities because there are no amenities, and you just get this spiraling decay that happens to our communities. Hospitals, schools, things like these, they really are anchors, you know. Still with us there, Michelle?
It also contributes to brain drain. Can you hear me?
Yeah.
Can you hear me?
Yeah, go ahead. I can.
Yep. It also contributes to brain drain, because if there's no high end or you know, jobs that pay well that are actually skilled like that, then we lose the younger people who want to study in those fields and want to serve in their community. There's no opportunity for them.
Yeah, yeah, it really is. It's, we wonder, I think, a lot. If I remember, like, the governor's race last year, that was all the Republicans really talked about on their side was like, building back our small communities. Well, if you go enact policy that rips the anchors out of our small communities, what are you going to build around? Who's going to support Main Street, right?
Yeah, economic development like data centers, which might bring in, 25 to 50 jobs in an area. Um, those are probably largely going to be remote jobs, could be even done out of state. So
Yeah.
it's hard because people are not seeing themselves being thought of in the economy going forward.
Yeah, sort of losing you there, Michelle. But I'll tell you what, you're going to be there in Brazil very soon. So I'm gonna. Why don't we reconnect there when you get to Brazil? And in the meantime, I'm gonna talk about the community there a little bit and talk about that facility there, and again what it would mean if they lose it. I will talk to you again here in a few minutes when you got a more stable connection there, Michelle. That's Michelle Higgs, everybody, out in southwestern Indiana, currently on their way to Brazil. So let us again have a look at Ascension St. Vincent there in Brazil. So we've got this hospital here. Brazil's not a huge town. Let's look at some of the let's look at some of the statistics on Brazil, Indiana. Okay. Small town, a little over 8,000 people. This is the county seat of Clay County. We're near the Terre Haute area. So you can see me on the map if you're not familiar with the layout of all of Indiana, because we've got folks here all over the state watching us. So you can see Brazil there is about a half hour or so from Terre Haute. Now, if we go back to St. Vincent, to Ascension St. Vincent there, this is the game I like to play. It's a kind of morbid game, but we look at these hospitals in these communities that are out of, that might go under if all these cuts take effect in their full, their full scope. So here I am. I got our little pin there at Ascension St. Vincent Clay Hospital in Brazil, right? Now, if that hospital were to close, if I were to have a medical emergency, heart attack, stroke, go into labor. Actually, if I go into labor, we've got way bigger problems than if I'm having a heart attack or a stroke. But let's say I'm right across the street from Clay Hospital there in Brazil. It's gone under, and I'm having a medical emergency. Well, then what? I mean, let's zoom out. Where's the next hospital from there? Well, let's see what the car route is. There we go. 30-minute drive from Brazil to Union Hospital there in Terre Haute. About 27 minutes there. Terre Haute Regional, about 29 minutes. So we're looking at about 30 minutes, whichever way you go. Here's Union Hospital Clinton, 36 minutes there. what do we got? What do we got? Where's the nearest hospital? Outside of that, an hour away here in Bloomington. So if Ascension St. Vincent, Brazil, were to fail because of these Medicaid cuts, if it were to close because they were not being appropriately compensated by the state and federal government for services provided, people in that community are looking at 30 minutes in a medical emergency before they can get to Terre Haute for treatment. I mean, it takes a lot less time than that to be a matter of life and death. 30 minutes? Crazy. And then, now listen, and that's just if I'm standing right across the street from where this, hospital theoretically used to be. Well, what if you're out here in Cloverdale, right? And or Putnamville or Bowling Green out here, and that's your nearest hospital. Well, now it's not your nearest hospital. What if you're in Bowling Green? Let's see our nearest hospital nearby there. Right? You'd go to St. Vincent, you'd go to Clay. It's 22 minutes from there. But if that hospital's not there, 30 minutes to Terre Haute, 50 minutes to Clinton, 45 minutes to Sullivan, although Sullivan also potentially on the hospital or on the chopping block, 37 minutes to Greene County there. So it doesn't just affect those folks in Brazil. It doesn't just affect the folks there in Clay County. That hospital in Brazil is the nearest thing for miles around in many places. Cloverdale? I mean, where are you going from Cloverdale? You might be best served hopping on 70 and going up into Indianapolis at that point. This is not effective. This is not comprehensive healthcare in any way. And as long, I think, as we are living under a capitalist for-profit healthcare system, it will never properly serve rural communities well. I mean, capitalism depends on profit and making money per transaction. And you just have less transactions out in rural communities. You have less customers if you look at patients that way. Because we don't look at patients as patients in this country. We look at them like customers. Now, who do I have on the line here? Hello. Good morning. Welcome. Can you hear me okay? Is that Twyla?
Oh, I didn't know you were talking to me. Yes, it is. It's
I
Twyla.
sure am.
Hi.
How are you today? It's a pleasure to meet you.
And yes, I didn't know I was I just thought I was watching.
Oh, well, somebody sent you the join link. How are you today? Where are you at?
I'm very well. I'm in Indianapolis right this minute. I'm from Greenwood.
Okay.
Indiana.
So, what are you up to today? Where are you? Are you participating in these days, the day of action?
Right now, I just came out of a meeting, a breathwork meeting with the fire department, the Indianapolis Fire Department, doing special breathing for people with PTSD, like firefighters. So that was my day of action for the moment, because I was already committed to that, and I left that and came out to do this because Brandy had asked me about joining it and seeing what you were doing and giving my input.
Well, I appreciate Brandy for connecting us, and I appreciate you for doing what you're doing. That, you know what, that's kind of like off topic for what we've been talking about here today. But I'm very interested to hear about the this breathing thing you're doing with these firefighters.
Well, you know what? It is off topic as it is right now in the times we are in. I feel better with my glasses. In the times we are in, breathing is so important. When I get angry about some of the things that come across wherever I'm looking at the news, and I see something that's going to be taken away from our people, I get angry. And so I have to stop. I have to do my breathing. And yes, we always breathe, and some people know how to get down a little bit. I can go all the way away from it and turn it into a positive, the anger. And that's what my breath work does for me.
No, you mean like you make a really good point, just about like needing to be in a state of calm, in a state of awareness, being out of that that heightened state, out of that, fight or flight. Number one, yeah, that's, it's bad for our bodies, right? To be constantly.
It's the fight stage. I'm not about flighting anymore. It's all about, and I'm not talking physically. It just, when you get so angry inside your head about all of that, it takes you away from the really important things. I just retired. And so in that process, I have a whole life now. What do I do? And thank you, unfortunately, God, I have something I can do, whereas before I couldn't do any of this. And so I have became very active, and that's how I met Brandy, and she's just amazing. I love her to death. And I have 3 or 4 people that have motivated me to become active. And if I still have a daughter. I mean, she's not at home, obviously. I have 2 granddaughters. I have a son-in-law. I have friends. But if I get out of the good spot and the positive spot that I'm in to do the work that I'm going to have to do, what I call service work back to the community, if I take myself out of that spot and get angry every time something happens, then I'm doing disservice to everybody. So we have to keep it to our set, and it's really weird breathing. It's everything is through your mouth. You start out slow and give that about 5 minutes of the slow in and out, heavy, deep breaths. And then you go a little faster, and that just, some of it takes you even beyond, and it's to the point your hands and feet tingle. So I don't ever go that far, but I could be driving and a driver tick me off and just go into the, the deep breaths in through your nose, out through your mouth, or whatever.
Yeah.
But in these times right now, it's just difficult. You have to stay. If you're not positive, you're going to hurt our cause. If you're not out there, like one of the first rallies, I said, the guy flipped me off as I was standing there, and I said, "Back at you, buddy." And somebody said, "Twyla, we say we're doing this for you, or we love you too." Something positive back. But I'm an inner city girl, and if you flip me off, I'm going to say something. I'm surprised I didn't flip him. I used to do that to driving. Somebody flip me off, I'm going to flip him back. I wouldn't do that now for anything. I don't even give eye contact. But our country right now is in such a place that we have to be positive. We have to show that our children, our grandchildren, whatever, that we are going to help to fix this, or we're going to do our darndest doing it.
A Hoosier author who I really like and respect, Jared Yates Sexton, refers to authoritarianism as a kind of weaponized abuse, like a kind of, it's a collective trauma being imposed on a population in a way.
Yeah.
And yeah, it so if you are being inflicted with trauma, you have to understand how to have an appropriate sort of post-trauma response, how to handle that, and how to deal with that, how to come down out of that excited state, right? So you can breathe and make good decisions and stuff. And it really is. It's abuse. We're all being abused.
They talked about when I wanted to get divorced from my husband, they said, does he beat you? And I said, no. Does he do this? No. And nobody talked to me about the fact that he'd never said I was stupid. He never smacked me. He didn't say I was dirty or any of these things, but it was the way he said the things he said to take my self-worth away. And I know that now. I didn't then. I'm worth a lot more than what he thought. I didn't go to college. He graduated as a pharmacist. I had a better family than he did, but I don't know. It's all in the perspective, but it's taken me a lot of years to go back and heal that spot where I was belittled in his own way without making it look like he was doing. It's kind of like people who beat other people, supposedly spousal abuse. They know how to hit you so it's not visible. And that's kind of what this kind of thing is, what's going on right now. They are beating us, but nobody sees it. Unless we, the people who know, stand up and say, this is enough. This is enough, and it's got to stop. And I think more people than us, or just me and you or whoever in the state of Indiana, are going to have to do that.
Yeah. It really is going to take, collective action, all of us to come together. I think one of the evil, pernicious things about authoritarianism, about fascism, is that it kind of counts on us becoming inhuman in this way. It counts on us becoming as mean and traumatized and responding in violent and unpredictable ways the same way they do. It kind of counts on us falling into that and not healing ourselves and taking care of each other.
So how are you going to take care of us?
Well, you put me on the spot. That's really good. I did an interview with Gary Snyder a couple weeks ago, and he put one on me, and it is so weird to be on the other side of the questions. But I mean, number one, I try to keep myself busy, just doing stuff like this.
Stop. Okay, I got it.
No, and I'm trying to help by giving folks like you, like all the folks I'm going to be talking to throughout the day here across the state, giving them a place to tell their stories, to talk about the way, not just these Medicaid cuts and these SNAP cuts and everything else the Trump regime is doing, that just to tell our stories and realize we're all human, and there's a spot where we can all come together and support each other and just know that we're all people together in this. And as long as I have a place where I can sort of make that happen, I feel like I'm doing something.
I understand that 100%, because I can't, I could give money. That'd be great, but I don't have money. When I said I retired, I was terminated from my job that I'd had for 8 years that I wanted to stay at until I was 70. And I'm 67 now. So my plans were all just shot, and I have to decide what to do. Will I survive on my Social Security? Yes. I don't know how I can do that in an $1,100 a month apartment. And I'll tell you what, it's not extravagant. In the old days, if I said I lived in an apartment that was that expensive, it would have been a nice 2-bedroom apartment. And now it's an efficiency. We're all going to have to make adjustments. I am not, and I didn't have time to tell Brandy this, I'm not on Medicaid yet. They offered it to me, and I said no. It would have paid for my supplemental insurance, and I would have fallen into the category to do that. But I said no, because there are people out there that need stuff. If I need it, I will reach back out and ask for it, but I don't need it today. I'm sure that I would qualify for food stamps. I'm not going to ask for that either. I have been on both before. I lost my job in 2013 after having a hip and a knee replacement back to back. I had to move in with my daughter. I ended up with her for 2.5 years. So I had no way to get insurance. And that was before we got the, maybe it wasn't before. Anyway, I had to have insurance with all the stuff that I had go on. So I got on Medicaid, and my contribution to the house, since I couldn't work and nobody wanted to hire me, is I applied for food stamps for SNAP, and I got it. And I gave them or bought them whatever, for the household, because we had 2 babies and me that was under my son-in-law and daughter's payroll. And so that was the least I could do. And I even took some early retirement that I had from the Star and News. So I'm trying to be self-supporting, and that's kind of hard. So I don't know. I tried to contact a friend of mine who had a child with, I always say the first part of it, trisomy, in one of the numbers. He was born the year that I left my medical assistant job. And I don't think that they thought he was going to survive it. And now he's like, if that was 2013, that's a good bit. And he's still around, and he smiles and he gives kisses. And is he ever going to be normal? No, but I know they have to survive on Medicaid. So I wanted to talk to her, and maybe I can still get a hold of her and have her connect in and have her talk to you about what's going to happen, or what is possible is going to happen to her and her family, because she has to stay home and take care of him.
Right. No, this is exactly what they're talking about when they these able-bodied adults that are not working. Well, yeah, duh. Like, yeah, it's people like that who are caring for a loved one who needs full-time care, and yeah, I mean, yeah, absolutely, should qualify for this, but boy, she's going to get caught in a bunch of red tape, and that's what they do. They don't want to just like, oh, say you don't deserve it. They're going to make you jump through a bunch of hoops and really hope you get caught up in one of them.
Exactly, and that's life in general right now. I applied for unemployment, and I passed. You said, yes, we'll give her the money, or go on and give it to her, because I didn't do anything bad. It was a performance thing. She had been after me for 3 years, just dogging me, dogging. And I said, when I knew what she was doing, I said, they're going to have to fire me. I'm not quitting. You're going to have to fire me. And they did. I finally qualified. And then I got 2 actual checks, and I was terminated February 4th. I've had 2 checks from unemployment, and every other one they question. And I finally just quit applying, quit doing my weekly thing, because I wasn't getting through.
Yeah, this is
and
exactly
so
what
why is it there?
Yeah.
I had 8 years of good employment with IU. I think I would have qualified for 200 and some days worth of unemployment. I'm not going to take a job. I've already got a part-time job lined up, but it has to be a full-time job to collect unemployment.
That's ridiculous.
And I am 67 years old with 2 artificial knees and an artificial hip. I can't sit down all day for a job, and I can't stand up all day for a job. And there's not very many jobs that's going to be half and half.
Right. And even if, you could, a lot of places are like, well, she's 67, and, we want somebody who's going to be working longer than that. And I'll tell you what, Twyla, I'm going to bring in a couple more folks right now. I do want you to go ahead and hang on. If you want to keep, I'm going to send you backstage and take you off the screen, but we're still connected. Okay. Thank you for joining me here. All right, Michelle, are you with me there you're in Brazil now, yes?
Yep, I am. And I'm just trying to figure out my
Terre Haute too.
Hey, Terre Haute!
Hi, Brazil.
Oh, this is fantastic. Who am I speaking with here in Terre Haute?
This is
So yeah, we just arrived at the Clay County.
What kind of turnout you got there waiting for you there in Clay County, Michelle? You picking up some more vehicles there to head out on the road with you?
I think we've got our assembled group right now. And then let me see if I can pull that up so you can see all the cards. We're just having to touch up our marker because we hit a bit of rain coming out.
Oh, no.
And so, yeah, oops, I don't know how to do the back facing. So bear with
There
me
you
a
go.
second.
Yeah, there you go, Michelle. That's good.
Okay. Okay. Good. Okay. So yeah, this is all of our troop coming in from Monroe, Morgan, and Owen counties.
Right. I think we had
And
about a dozen vehicles going that way. Yeah.
Yep. And it was actually very interesting driving. At a certain point, we had an ambulance pass us, and I said, "We have an escort now headed to the hospital." So, but yeah, let me just show everybody. Say your name and where you're from.
I'm Stephanie. I'm from Owen County. Stephanie Barlow.
Bill Breeden, Owen County.
Colin Rotella, Owen County.
Zach Harrison, Bloomington, Monroe County.
Jim Grigg, Morgan County.
Beth O'Brien, Johnson County.
Becky McClung, Morgan County.
Lamar Griggs, Morgan County.
Carol Dunphy, Morgan County.
Stan Diamond, Morgan County.
Ashley Kierberg, Monroe.
And then me, Monroe.
Well, that's
So,
great. We
yeah.
got a great turnout. And so then you're meeting, you got people that who were already there in Brazil waiting to join up with you.
Yeah, and then we've got I don't know what that is. Here we go. We've got people that I know are going to meet us in Sullivan. And some people this will be their stop because they're going to have to go to other things. Well, and then I do know a lot of people are just going to even just go straight to Salem. So that's our big stop there for the press conference at 4. So
Fantastic. And let's hear from Terre Haute there.
Hi. Yeah, we had about 60 people out here with us today. The horror of losing access to life-saving medicine and medical attention will be made a reality for over 250,000 Hoosiers because of this big nasty bill, and we need cops on prescription drug costs and public pharmacy programs that would place the distribution, manufacturing into the hands of the public. The time is now ending in unity, showing up inside of our communities as we all have today here in Vigo County and in Brazil. And we are demanding that decision makers like Senator Todd Young prioritize public health instead of fascist greed. The people united will never be divided because we are all stronger together. And that's why we all came out here today. I'm actually going to pass you off to my friend Michael, who'd like to speak on it as well.
Absolutely. Thank you.
Hi, how you doing? I'm Michael.
And hello, Michael.
Yeah, I am here and live here in Terre Haute, Indiana, Vigo County. I'm on SSI and Social Security. I'm 65 years old, Medicare, Medicaid. I receive mental health services from Medicaid. My copay for my Medicare is paid for by my Medicaid, which would be $180 if Medicaid wasn't paying for it.
Wow.
But the story I'll just share is the story about my sister, who several years ago when Mitch Daniels brought these cuts to the state and was guaranteed that people who really actually needed it would not be cut. My sister had meningitis at 18 weeks old, was fully dependent on caregivers for the rest of her life. I was fortunate enough to be her caregiver for the last 17 years of her life. And it was a joyous thing that I thank God every day for, that I was able to have that opportunity. But when those cuts came through on December 31st, 2011, her budgets for her home health care were cut by 70%. 70.
Oh, jeez.
She went from 24-hour a day availability of care to 5.5 hours. And the state tried to put her in a group home. They looked at me and said, well, we have these group homes that you might want to consider. And I said, what do you mean a group home? They're like, well, you're going to be here every day. You're only going to have 5.5 hours of care a day. You're going to be here all the time. You're not going to, you won't be able to, and she goes, you won't be able to do it. And I said, well, I think I can handle that. And the lady from the state at that time looked me dead in the eye and said, I don't think you can. And I just dared her. I said, okay, well, just watch me. And we went sailed on, and we made a way. We found a way. And over time, a little more came into the budget from little different ways. We finally wound up with about 8 hours a day of care. But still, I mean, they did not. They lied, and they're going to lie. They're lying about it again when they say that people who really depend on it are going to get the cuts. I might lose Medicaid. I might lose my mental health care. I live in public housing. I receive SNAP benefits. I'll probably lose the SNAP benefits. Who knows when they're going to go after public housing next? So that was my story about why we need to contact our senators, contact our congressmen, tell them we will vote them out. We will start this fix in 2026, and we will flip every hill in this country blue if we have to make this thing right again.
Yeah, Michael, that's a lovely story, and like it really touches me. My son needed round the clock care. He passed away a couple of years ago, and we had to navigate the Medicaid hoops with him, and it sounds just like with your sister. Um, did you get assistance taking care of her from the state? I know, like the last couple of years, they've been helping pay for family who have been the primary caregivers because there aren't enough caregivers out there, and they're going to be taking that away now.
Yeah, well, at the time, when I was taking care of my sister, when I was her guardian and caregiver, they had that available. But if I was to take that payment to be her paid caregiver, I would lose my services from other agencies. So that was the thing I was up against. Was it would just be me and her, and I would have to use that money to pay for somebody to come and sit with her to even go grocery shopping and stuff, because she could not be left alone. But, she could not dial the phone. She could not do any of those things. She was like an adult child, joyful child,
Yeah.
happy child, loved everybody, loved everything. But yeah, she needed somebody there in the house all the time with her. So this is, and they really wanted to put her in a home. Actually, the agency that we had at the time worked hard to try to say I was unfit, and kept trying to put her in a home. Yeah, they actually filed false reports with the adult protection services about things that were going on at the house that just were not true. And I won that, thank God. I finally, the last that was the third time they were seeing us, and I told my IMPG coordinator that I said, this meeting must be at this house where she lives at. I'm not going to go to no more meetings about her care at an office. They got to come here, adult services. They got to come here. They got to see this home and see how she lives, and we got to get this thing squashed once and for all. And that's what did it. You know what I'm saying? So I mean, I was a good advocate for her. I really got things done.
But you know what? Like, government, if it works well, should have been there to help you. Should have been there to make things easier for you. And it sounds like, they just made it more difficult every step of the way, and put more red tape in your way, and made you jump through more hoops to get the care that your sister needed. And now, they're doing the same thing to you.
Right. Yeah. And I live in a place where there's other people on Section 8 housing, and there's very many people there with a lot worse health problems than me, who depend on Medicaid to pay their Medicare premium. And this is gonna crush people. I mean, there's some people there. I because of the situation where I was watching my sister for so long, when I finally had to get disability, I hadn't worked for so long because of being a caregiver for my sister. I only qualified for the minimum, so I take in less than $1,000 a month. I've got car insurance to pay for. I got rent. I got groceries. I got expenses. That's not a lot of money for a month long, So,
Man, and this is ridiculous. All these are false choices. We have the resources to take care of our people. We choose not to, as a society. Our government keeps us split, so we don't see the need to help each other. We don't see each other as neighbors. We see each other as enemies. And
yeah.
I do think, when it comes down to it, most people are good, decent people, and they want to take care of people, and they want to take care of their neighbors. And boy, that's what government should be for, is situations like yours. And all the hoops and all the red tape. We waste our money on that stuff when it would just be easier to tear all that down and provide people what they need.
Well, at one time, this country had the money for these things because the Republican Party had some sense, and they taxed the billionaires and they taxed their corporations, and they used that money in good ways. We had great schools. We had #1 highways. We were the biggest. We expanded the middle class more than at any other time in the 1950s. And then when the things were built, it seemed like when Johnson came in and they decided to take that same tax money that everybody been taxed and use it to help poor people. That's when, oh my God, well, we got to stop this. It was great. We could use the money to build things, but if we're going to use the money to help poor people, well, that's got to stop. We got to figure out how to get out of this. And that's when they started coming in with the tax cuts and the trickle down, which is pissed down my back theory, so. And everything's been going downhill since all that started. They've been giving more tax breaks to the wealthy. And the reality is that the wealthy, the people who are billionaires, made their wealth off of the labor, off of the opportunities, and off of the consumerism of our country, of our people. And they don't want to pay their fair share back for the opportunities that they were given. And they can still be billionaires. We just need to tax them more fairly. We don't want to take away their billions. Let them have that carrot on a stick, so people want to succeed, because that's what you need for a successful democratic socialist economic system. So anyway, you know what I'm talking about. I'm not sure. Is there somebody else want to talk here today on this? But that's my story. So I'm going to give you back to Janet here now.
Hello. So, is it okay if I tell my fears about the Medicaid, Medicare, medical cuts? Yeah. Okay. Awesome. So, hold on. Can you hear me? Okay. Oh, it's weird. I can't hear you. I wonder if we hit a button.
I can't either. I don't either.
Oh, okay. So maybe he's.
Oh yeah, it's because I'm a schmuck and I muted myself when I took a drink. Yeah. Sorry about that. Please go ahead. Tell us your story.
So, and I have been a caregiver for my mom. She just turned 75 this week. She was in a
Happy
car.
birthday.
I will tell her. She was in a car accident that did some. There was a traumatic brain injury and some other things before I was born. And because of that, she struggled to live on her own. And so she had moved in with me. We were able to make it work at that time because she had fallen, but she did her exercises, did her physical therapy. But it was very rough on me physically because I am only 5 foot tall. And my mom is 5'9" and 180 pounds. And she needed a lot of physical help. And
yeah.
How am I supposed to do that? And we made it work. She was with us about a year in our house, then was able to move into assisted living. But after a couple of falls there, she ended up going the nursing home route. And I'm really worried about what the extra paperwork that I've been hearing about will do, because I am also a homesteader. I own my own business, and the idea of her care being at risk anyway, but also they talked about having to do paperwork more frequently. And for me, that's a really serious concern, because if I have to do that quarterly, that's a lot. And the chances of something falling through a crack and her
Mm-hmm.
losing the care is way too real of a possibility. And also, if she loses the care, like I said, we're homesteaders. We don't have a home that is safe for an elderly person to try and navigate.
Yeah.
Physically, I can't care for her now. Her mobility's gone down more with increased age and increased access to snacks. um, she's living her best life with another resident that he's able to walk and go buy snacks and bring them back. They eat all the things. But I'm really worried about her because, if my house isn't safe and set up for somebody that, has mobility issues, um, and we're a substantial time away from it being like that level of complete, and I don't know what's going to happen to her if the cuts continue and she's not able to stay in the nursing home. There's not really a place for her to go.
It's got to cause worry. It's got to just like put you in a constant state of anxiety. Twyla was telling us before you came on that she helps people with breathing techniques for PTSD, and I imagine it's traumatic in a way to have to worry about your loved one all the time, whether they're gonna lose care.
Right. Yeah, where are they going to go? If who's going to take care of them? I physically can't make this work. And I don't know, right now she's good for a while, but the more laws and more cuts and more paperwork and increased regulations, every time you turn around, they're making the situation worse. They're proposing a new piece of legislation to cut this or that, and it's just an impossible situation for a lot of families.
It really is. There's so many, Hoosiers across the state who are in that same boat as you are. I was telling Mike a little bit, who came on before you, about my son, and it reminds me of your story. I'm a decently strong, able-bodied, like, adult man. Okay, like, my son needed help with his transitions in and out of the car, in and out of the bathroom and stuff. I would take him everywhere and help him with everything he needed to do. Well, I can do that. I'm a grown ass man.
Right.
Like, not, a little 5-foot woman like you can't do all that stuff. And that's why we count on.
Then I need care. Because if I continue to stretch and do things that are really physically unwise,
right,
then my need for medical coverage increases and my ability to work decreases. And then the cycle just keeps continuing. And I know a lot of parents with special needs kids, as their kids grow physically larger, become as well. Because, if you have a teenage male son that needs that level of care as he gets taller and starts to match you and then possibly outgrow you, it's going to be a lot on you physically. And then suddenly it's you and him that need care.
Yeah. And that's how I wound up as my son's primary caregiver. He was a mama's boy, and he, liked to spend most of his time with his mom. But after a while, he got too big for her to handle.
Right.
So, it becomes dad's job, and that's fine. I loved all that time I got to spend with him. But it causes strain on the caregivers too, and it's precisely like folks like you that that are in a position where you're caring for somebody full time, they say, "Well, you're able-bodied. Why aren't you working?" And they don't want to give you any Medicaid. Like,
Supposed to work. My mom had the starts of dementia, and I was trying to run a business, but if I left the room, she'd forget why I left. How do you run a business? How do you focus on a task?
right? And boy, you think the time, the effort, the people, man hours, the money that go into checking up on people to make sure they crossed their T's and dotted their I's. If instead, like, those jobs shouldn't even exist. Just like these people should be like in the "what do you need? How can we help you?" business, not
Right.
in the "how can we find an excuse to take your care away" business.
Right. And there are whole businesses that I don't know if you've ran into them yet, but there are whole businesses that have been created to help people that are going into a nursing home. There are whole businesses created to help the families successfully navigate the system to get everything in to Medicaid.
Right. And I
Why
understand it.
is cost effective for Americans to have the system so complicated that it requires a professional to navigate?
We yeah, well, like every checkpoint, every artificial checkpoint is like, number one, it's like a toll booth for some private actor to come in and take their cut. But
That
also, it is an unnecessary roadblock to efficiency. We've seen everywhere else in the world knows how to do universal health care somehow better with less resources than we have. And it's because of this jerry-rigged duct tape bubblegum system that we have. It's this patchwork of for-profit, non-profit,
uh,
this
but
insurance, that insurance, part A, part D. Like,
yeah, funneling all
none of that is productive, I think. Like, the people doing that, like, it's some person's job to be an insurance adjuster and tell people no, you can't have care all day long. Like, how is that a productive use of that person's time? They probably feel like shit at the end of the day.
yeah.
Or if they don't, that's a problem too. Um,
Ever watched the movie The Incredibles?
it's been a long time.
Mr. Incredible's day job was exactly that, telling people, no, you don't qualify for this thing that you actually do qualify for. It makes me think of that every time. He almost, I think, almost lost his job because he helped a little old lady navigate the system.
Yeah, right.
Like there's a whole
That's
industry made where people have a job of just finding all those ways to say no. And how do they sleep at night? They
right.
need
So yeah, we have so both of these things. We have that, right? We have the person like telling you how to say no. So then you also have this pop-up other job that is navigating through the system that keeps telling you how to say no. Like,
right. And
again, these are
those
not productive things to have to do in society. Like, there are things that we need. Like, we need a lot more early child care, and we need a lot more teachers, and we need a lot more elder care and nurses aides and things like that. And yet we have people sitting in offices, or maybe not even in offices anymore, like sitting in front of a computer, looking at a spreadsheet, telling people no, when they should be, like, I don't know, caring for our children and our elders.
Yeah. And we're paying them to tell us no, because those costs are always passed on to consumers. So
Yeah. And then one guy at the top gets all the little differences that make up from all of those no's.
Right. Yeah, we pay them. We pay one person to tell us no and another person to find a way around the no. Why is that money not going to care?
Yeah, if you were building things from scratch, you would not do things this way. Um,
Oh, it's horribly convoluted.
and you know, there have been efforts that like the thing we're talking about today, right? Mostly is Medicaid, right? Again, you know, it's a box, it's its own program that has to be administered with this paperwork and that paperwork and everything. And Medicare is its own program and everything. And then you've got all your private and you know all these artificial walls. Like
Right.
if this just all went into one big pool, that
Mhm.
would be the most efficient way to do things. That would be the
Right.
most cost effective way to do things.
But then the billionaires would lose out on profits.
100 years of billionaire propaganda has taught us that it's better to pay like $10,000 a year per person on below average healthcare outcomes
It's
than it would be to pay $4,000 in taxes for better healthcare coverage. But
right.
that's socialism, right?
Yes, actually thinking that we should get health care for our money that we pay into the government. Yes. Clearly that's a far-fetched idea.
And it's insane that we even have these discussions. We've tried to have these discussions. You know, after World War II, Truman tried to get some sort of universal health insurance program through, and that got crushed. When I mean Medicare and Medicaid, which we love now, right? They're incredibly popular programs. The people that have them like them. They do a great job. Received like a ton of pushback. A ton of pushback. You can find
Public library. Kind of same.
Yeah. You can find like LP records from like the early 1960s of Ronald Reagan, the actor, and a salesman, you know, Chesterfield pitchman and GE pitchman, right? It was Reagan, you know, a full LP of an anti-Medicare speech. And they, you know, they sent these around. You know, it was full court media blitz as far as you know they would do in 1964
Right.
or whenever it was.
Yeah.
And that's why, you know, even what they did get through is limited in scope to seniors and you know, people in extreme poverty and whatnot. You know, we could have gone big. We could have done universal health care then. And now that we're, you know, 100 years into this kind of patchwork private system, and all of these special interests that come with it, all of the people who own those artificial toll booths have a vested interest in keeping it the way it is.
Exactly. And are fighting tooth and nail to stop anything that actually benefits the people.
And I've got to think a lot of people in Indiana maybe voted for Donald Trump. Maybe,
Yeah.
you know, he said, no, well, we're not going to touch Medicaid. You know, we're not going to touch your Medicare. I mean, we know the guy's a serial liar and has been his entire career, but a lot of people believe that
as well. Medicaid and Medicare. Elderly people were already starting, some of them were already starting to feel the impacts during his first term. And we did it again? Really?
Yeah, and well, it's because he played the part of you know, a populist, of someone that's for the people, but he's always been of and for the billionaire class. He
Absolutely.
is he's one of the artificial toll booth owners. You know,
He's not going to actually improve anything that's going to take away profits from him and his friends.
right. These are his donors, these are his you know, friends, these are his uh club members at Mar-a-Lago. You know, these are his people. The insurance executives, the kind of people that
The kind of people that
benefit
financial
from, yeah, who take the extra, yeah, the surplus value out of the system for themselves. And so, yeah, here we are on this beautiful Saturday in July. It's a little toasty out there, but you know, here we are out here all across the state of Indiana having to beg for scraps.
Yeah, exactly. Exactly. So where's the Medicaid train, the Medicaid caravan at now? They were in Brazil.
They were just in Brazil, and by my clock, they're going to be in transit for a little bit and should be getting to Sullivan about 1:45.
I think some of our members may be going to join in the train, to join the caravan.
Oh, that's fantastic. So I don't know if I caught your name.
So my name is Janet Wallmeyers, and I am the woman who wears multiple hats. So in Terre Haute, I am with two other leaders with Indivisible of the Wabash Valley. We did a rally today. And then in Indianapolis, I'm one of the leaders of 5051. So
Okay. I feel like your face is very familiar. I've probably seen you at a thing before. And listen, folks like you wearing these multiple hats really make days like today happen. You make things go. You know, the work you're doing here, the work you're doing for community, you know, the work you're doing for your family. This is all like incredibly important stuff. I don't know when you sleep or where you get the energy.
there are so many people whose faces you don't see that are pulling huge amounts of weight for the movements. They don't want to be on the camera. I'm looking at one of them right now that doesn't want to be on the camera.
If they want to talk without being on the camera, we can do that. If you can shut the camera off and just go audio only if they'd like. But
I think one might be willing to do that. Hey,
yeah, absolutely.
is in the chat. Hey, Ouija girl, do you want to hop in and come on camera? I'm asking like it's my show and not yours.
No, well, so I would love to hear about Ouija Girl. If if you would like to share your story on hi, yes, hi, hello, we see you in the chats over there on YouTube. Thanks for watching. But I'd love to hear your story if you'd like to. Is at work. Well,
Ouija Girl's always at work.
Well, I bet it sounds like, you know, you've got a family that, you know, needs people working. And well, listen, I want to thank you for what you do, Ouija Girl, and like give your family our love. I know that's a tough situation, and if anybody, if you in your family wants to tell their story or something, Scott at HoosLeft.us, you know, I'm available. We can always set something up, and you know,
second and ask a couple of people here if they want to speak. I will.
Absolutely. All right. So, Janet there in Terre Haute doing the Lord's work for sure. And
So we've got a speaker. I'm going to stop the camera and then
okay,
he will be on. 1 second.
thank you.
Okay, camera's off.
Thank you. Hello,
Hello, hi. Who am I speaking with?
my name's Hannah.
Hannah, nice to meet you. I'm Scott. So tell us what brought you out to rally in Terre Haute today.
Various causes. Today with the Family First, my son, he has been diagnosed with autism, and it took a really long time for me to get him insurance, over a year for me to be able to get him his Medicaid. I had to jump through a lot of hoops.
Yeah.
Over 6 months for him to be able to get into speech therapy. And then after he got into speech, he was dropped on his insurance, and it was $300 for a copay.
Oh my.
Yeah, so that's a lot. And then now we, in the climate we are facing with children who have autism, I'm scared of him losing his Medicaid. I'm also scared of me losing my Medicaid. He has 20 hours plus a week in therapy with OT, ABA, and speech. So I stay at home with him and his little sister. So the requirements for Medicaid and the change.
Yeah.
So yeah.
Yeah. How old is your son?
He is 3. He's about to be 4. So just a
Oh,
little.
what?
Just now
Sorry,
started.
what?
He just now started talking. He had been nonverbal up until he was in his speech therapy.
Yeah.
He's now been in speech for about 3 months.
Okay. Yeah. So I was going to ask about the speech. You said that without the insurance, there was that like $300 copay. Did you get the insurance straightened out? Like you're not having to pay that out of pocket, are you?
I had to search around Terre Haute. That was through Union Hospital at first. And then I found a different facility, and they had a lot cheaper rates. And so we went there and paid out of pocket, and it was like 120 for 2 sessions a week, which is way better.
Yeah, but still,
Yeah, we did pay out of pocket for the first while, but now he has insurance. It's covered. I pay, but I still have to pay monthly for his insurance.
okay. And who's your insurance with? Is it a private provider, or is this like through the Indiana one of the plans?
One of the plans, yes. I think it's
Okay. Is that CHIP?
Yeah.
Okay. So yeah, and you said that you stay home and take care of that. I mean, it sounds like, he's probably got a lot of needs, a lot of appointments to get to. And just with all that, it would be impossible for you to work. Is that right?
Yeah. He's gonna
Yeah.
have 20 hours of just ABA therapy. And then he has about an hour because he has 2 sessions of speech, and then they want him to go to OT therapy also. But they're going to co-treat with occupational therapy and speech, so hopefully that'll be a little.
Oh yeah. You can do sort of work on both at the same time, and yeah, the way they can integrate that. You know what? My son had to do some of those, the OT and the PT and the speech, and he always hated to have to go to all the appointments, and so whenever you can combine them, I bet that helps a lot.
Yeah, but we have a younger daughter. She is 2, so a lot there. But with what's going on, I'm sorry, what?
Showed me having integrity, and yes, that was a problem because.
Are you there?
Okay. Yeah. So, but so you get Medicaid too, now, and you're worried about losing that because it sounds like with these the cuts, the big talking point on the right is, these able-bodied adults who aren't working, and
Yeah.
like, well, yeah, technically you fit that bill, but like I mean, come on, you got an autistic kid here, you got a 2-year-old, you got a kid with a million appointments to go to. What do they expect you to do?
Yeah, I also worry about like with what's happening with RFK Jr. and what he's saying around autism and like, you know, the causes and the database and wanting to use the Medicaid database to find the cause of autism.
Yeah. He has some very eugenics sounding views on autism, and there's some real slippery slope language that those folks are using.
It just feels very scary as a parent of a child who has been diagnosed.
I've got to imagine. So what if you had a Republican legislator or legislator in front of you right now? Who's your congressman? Are you in Jim Baird's district, or are you in Messmer's district?
Mesmer.
A couple of real winners, by the way. But if you had Mark in front of you right now, what would you tell him?
That there's nothing wrong with my son, and that he's just different. I guess I don't that I need to be at home with him, and that he needs his therapy, and that they don't need to cut fundings for children who need to go to behavioral and who need assistance in speech, and that IEPs are important in school, and that teachers should have to follow IEPs. I mean, not that they're not going to follow IEPs, but I do think that inclusion is very important. Not only in school, but
Yeah. Like, disabled people are people who deserve all the same opportunities to learn as anybody. And we're getting to a point with our schools too, like you said, with the on the IEP topic, where they're taking all this money out of public schools and giving it to private schools and charter schools, such that like the only kids that are going to be left in public schools are going to be like kids who can't afford to go somewhere else. And it's like they're trying to turn these things into a collection of just like
she was going to try and
like a holding places for kids on IEPs, and it's not fair and it's not right.
And in Terre Haute right now, with the schools consolidating and getting bigger, the classroom sizes are going to get bigger, and then these children who need those IEPs and don't have them, they're going to fall through the cracks. And we're like, with the homelessness and stuff like that, children who don't have the same opportunities tend to, if you don't have access to resources, then I can't find the right word. It frustrates me.
Yeah, no, it's just the way they treat every kid as like a bag of money that goes from here to there or here to there. And like, it is true that the special needs kids require more care. They require more one-on-one attention. Maybe are more expensive in pure financial terms to take care of. And when you suck money out of the public schools like they're doing, it leaves them less able to care for the students that need.
Yeah.
special assistance,
Using the Medicaid, they also won't have access to the things they need at home, because things that children need with this, like children who have disabilities, the things they need and they won't have access to, like safe sleeping, or like alarms on their doors, or like locks, or like certain, not locks on their doors, but locks on the house, because kids alone.
Yeah. Medical devices, assistive devices,
All of that, because
things like this. Yeah, a lot of people don't think of it. And that stuff is expensive. I mean, my son used a wheelchair. That thing was incredibly expensive. He took formula to eat, so we'd get that shipped from like a home health provider, and that stuff out of pocket, just completely unaffordable. So it really is life saving.
yeah,
Medicaid is.
it is, and I do think that what Ouija Girl said, autism is diagnosed more because of more research, also because parents and the stigma behind autism is being removed. We're not afraid of reaching out for help, mental health, and just diagnosing your child with, like, going and receiving the help, or I wish my parents would have looked for help for me at a younger age for mental health.
Yeah, no, we are like there's a very much a phenomena of adults like learning that, oh yeah, I've kind of been autistic the whole time and we didn't really know it or have a way to describe it. Yeah, and Ouija Girl says autism is not an epidemic, and it's not like it's always been there. It's neurodivergence. It's a different way people's brains work, and people have always been that way, and we didn't have the language to describe it. We didn't have the knowledge of the way the human brain works. We're still I think in the infancy of learning about a lot of this stuff. And you're talking about RFK. He has a very narrow view, I think, of what autism is.
Yeah, I agree. I think that the human mind is something that we won't completely understand anyway, because no two humans will ever be exactly the same. The inputs and experiences that each person has will always be different.
Right. And yeah, Ouija Girl makes another good point here that, like, yeah, we're more seen because, a lot of times they would lock people up in institutions.
Yes.
And I don't think anybody wants to go back to that.
We're seeing that, like,
Although, some of those folks wouldn't surprise me if they did want to go back to that.
yeah.
Trump talks like that.
Yeah, we just saw that language coming out again with homelessness and mental health in Trump's new executive order.
Yeah, this is just the other day, basically commanding localities to crack down on homelessness and treat it as a crime.
Yep,
just
and
to not have a home, like, and yet we do nothing to solve the affordable home crisis. We don't provide services for these folks. I mean, hell, I was just talking with Janet about how hard it is to navigate the paperwork for Medicaid, and seeing your doctor and getting your medication and what all you need. I couldn't imagine like knowing where to begin or how to navigate that if you're out on the streets, if you maybe have a mental illness of some sort.
When you encounter homelessness, you have to find a phone to get a job, and to have a job you have to have an address, and then to have an address you have to figure out how to, like, get a PO box or ask a friend, and it really is just the giant hoops that you have to jump through in order to do that.
And it's just beyond unfair.
For my son, one of the times that because they gave him Medicaid and then they kicked him off, and it was because the document wasn't processed, and it wasn't even on my end because I kept track of everything, and I'd go into the office, have it faxed, keep it in a filing cabinet. Well, when I called, they said that it was never processed on their end, and it had been like 3 months. So like even when you're doing it right, it's still not even being done right.
My son had a lapse in his Medicaid because they kept sending the renewal forms to my ex's old address where she hadn't lived for years. And then you have to initiate the call and figure out where they messed up along the line, and yeah, it really does. It puts the onus on the individual.
Yeah. And I just think that healthcare and existing as a person should be a human right.
Exactly.
Be able to have help.
Well, Hannah, did you have anything else you wanted to holler out to the people in Indiana today, or wherever else they may be watching or listening?
Thank you for listening. Appreciate it. That's about it, and hopefully we can change some things.
I hope so too, for you, for your son, for everybody out there. We all deserve better than what we're getting right now.
Yes, thank you, Scott.
Thank you. All right. Twyla, you back with me there? How you doing? Oh, you're muted. I can't hear you.
Watch your shirts.
Oh, is that you? No. No dice there. How about now? No? Why don't you reload and try and come back in? We'll see if we can't get a hold of you there. All right. So that was from Terre Haute. We met some great people out there, heard some harrowing stories, really. Geez, if we ran our country in a more humane way, days like today wouldn't be necessary. I should be out mowing my lawn. It's incredibly overgrown at this point, but I think it's important to be here with all you to help you share your stories about how these Medicaid cuts, how these rural hospital closures, how SNAP cuts, how these things would affect you, your children, your family. And if we just ran our society on a more human level, we wouldn't need to beg for scraps on days like today. And you wouldn't need to tell your stories to some guy to put all over the internet, because we would just take care of each other. We would just do the right thing. And I'm a guy who believes in big, like, fundamental change. I think we need some major reforms overall with our way of our form of government entirely. But with all that said, like, we don't need to reinvent the wheel. We've seen our government be able to do good work to build institutions for helping people, for making people's lives better. And when we did that, we taxed the rich, and we invested in our people, and it was never perfect, and always had a
Can you
lot
hear
of growth
me?
to do. I can, Twyla. Welcome back.
Can you hear me now?
I can. Can you hear me?
Probably hear me say shit, then hear me say anything else.
I got you, Twyla.
Can you hear me, Scott?
Can you hear me?
Yeah,
Can you hear
good.
me?
Now you're muted. Okay. I spoke with my friend who has the child that has the trisomy. I'm guessing he's probably about 12 or 13 now.
Yeah.
So she has what they call a Medicaid waiver. Are you
Yes,
familiar with that?
I am.
A Medicaid waiver?
Yeah. So the waiver is
I
basically.
can't hear you.
Oh well.
Are you muted?
No. Can you hear me now?
Okay. She has a Medicaid waiver. Though we left and by
No,
myself.
I'm
We're
back.
gonna try it this way.
We'll see if
It's
that
raining.
works.
I'm sitting in the rain doing this. In the sun. I'm gonna get a rainbow. Okay. You just nod if you hear me. Do you hear me? Okay.
Yeah.
Do you know what a Medicaid waiver is? That's what she has. So it pays what her insurance, and her insurance is, or his, it's under her husband or the father, is $900 a month through his employer. $900 a month. And then Medicaid will pay anything that they don't like. If they have to redo the house to accommodate Adam, Medicaid would step in and do that. But they have to, how much red tape they have to go through when something like that happens is enormous. And they keep changing the provider. Somebody will come out every 6 months and examine the house, examine her, take notes on all of his conditions if they've gained, and they've really not. I mean, he still can't walk. He can't have a conversation. There's a lot of things he can't do. But right now she's grateful, but she belongs to a group with mothers for children with disabilities. And she is unable to work because she takes care of him. And he can't walk, so he requires being lifted. A 12-year-old boy, he's not the normal size, he is smaller, but still, I couldn't do it. As a grandmother, I would be able to assist. And so, but in this group, they've talked about, well, they're going to do this and they're going to do that. I'm figuring what it is half the group, because we live in Johnson County. And Johnson County is very, very, very red. It's like most of the United States right now. We're all in the closet. I did a protest, and all of the horns that went by and honked. And I said, my gosh, I didn't realize there were that many Democrats. And one of the girls who is running for Secretary of State, she said, Twyla, she said, most of them are in the closet because they're afraid to not be. So, but our county is very red. So I'm going to guess that group is probably half and half, if not less on the D side, Democrat, or whatever it is other than Republican. And so she's hearing their side of it. Oh, nothing's going to happen. They would never touch that for a child. Oh, they're cutting away the waste that happens. Like the people, how are they going to find out who is not? They're going to throw everybody off and let the beggars come back in. So she's kind of not that way. And I said, not to offend, but I said, you have to look back at what happened the last time. And I'm going to take Medicaid out of it. They talked about he was going to lower the taxes. And everybody was going to get something. I've never seen anything on my check when I was still working, did not see a penny. And she said, we didn't either. We didn't either. And these are people that have had to sell their house and have moved into apartments were really probably more expensive than the house. So it's ridiculous in the big picture. And then to have to worry about and concerns about how he's doing and what he does. He has PT, he has OT, he has all kinds of T's, all kinds of therapies. And he has a class that he goes to, and they taught him how to walk in one of those walker things where he moves his feet and makes it go. It's exorbitant. And if they start cutting those costs away from this one family, that's one family that I know of, and I know of others, but she was my example. And she would talk, but they're on the road going to Ohio. But anyway, so I told her I would share her story, and that was the best I could. But when we as a civilization stop caring for the people who are underneath us financially, then we aren't a society. We aren't doing, I'm going to say, the Lord's work. Because from what I understand, out of what little of the Bible I read, which I've read the New Testament, we're about helping people. You know, when I was naked, you clothed me. When I was starved, you fed me. When I was whatever, you know, that's what we're to do. No matter what color you wear, no matter if you are gay or straight, no matter if you, in this thing on vaccinations, when you said something about RFK, you were being too nice. Too nice. And luckily I breathe. I said, okay, Twilight, you can't say it. And I don't know how to text because I was going to put something in the, but yeah, that you were being nice. His dad is upstairs rolling in his grave, and his uncle. These are people who taught us once again in our society, how to be nice to people no matter what.
Yeah.
And this guy's come along and trying to take it away. Why? Does it make him feel that much better when he helps people who are rich and have already, I heard him say, and somebody calculated, if you took Elon Musk's money alone, how much he could feed the world, you know, or the country. All of these things that are out there, he could take care of. Not that I want him to, but don't take what little help we do get. And it is very little. You know, yes, when in the big picture, it's a lot, but you know what? You can't work. It's like with the protests and things like that. And I say, everybody has to have their feet on the ground. And I said, and I always add, not physically, because not everybody can put their feet on the ground. My feet don't work well on the ground. I have artificial knees. I have an artificial hip. I got a bunch of titanium. Do I walk? I walk a little. And I carry my sign, or I'll sit with my sign, or I'll holler at the cars. You know, I do all the things. I donate a little bit to the local people. I don't donate big anymore. I donate here locally. And if we change local, then we can change the hires. But we got to get this fixed. We've just got to. For health reasons, for morale reasons, we have no morale left. And what he's saying and doing is teaching the people how to have no values. And when we don't have values, we're done. We don't have hope, we're done. So I want to tell everybody that's out there, just keep the hope up, because I think 2026 is going to be amazing. It is going to be freaking amazing, and we're going to get her done. You can go to Bobby.
Yeah.
Take it to Bobby. Leave me alone.
Bobby Lee here just joined us. Hello. Where are you at, Bobby?
Hello. I am in Nineveh.
I can't hear anybody.
Indiana.
Oh, well, no, we're good. Bobby Lee, I hear you.
Oh.
They hear me. Twyla, is your volume up? But yeah, we're good, Bobby Lee. So you said you're in Nineveh.
Yep, I am.
That is in is that in Brown County or
Johnson? It's
Johnson.
Nineveh,
Okay.
Trafalgar, Franklin. It's Johnson. It's just right after Franklin. It's a little bitty town. But
so,
hi.
Tell us a bit about yourself.
Oh, I don't know. I'm Bobby Lee. I am a tie-dye artist. Used to, for 15 years, flip houses. I don't know what to say, really. I'm sorry. I have never been on a live, so I'm not sure what I'm supposed to.
You're doing fine.
Sorry.
Well, so no, listen. What brings you out today? We're talking about these Medicaid cuts. You know, that have gone into effect. Some in the beginning of July here. Some more on the way, and then some more after that, a couple years down the road, the big Trump cuts, which will really hurt a lot of people. You know, it's going to hurt a lot of rural hospitals. It's going to hurt a lot of individuals. It's especially going to hurt people with disabilities.
That is very true. So Brandy said to come and talk about what is going on, what the cuts would do to me and my family specifically.
Yeah.
And with that would be a whole lot. I have a trans daughter. She is on Medicaid, and that would mean that would do so much trauma to an already traumatized child. Not to mention I'm on Medicaid too, because you just can't afford it any other way. I don't make a whole lot of money. I'm an artist. My child in the young 20s and bouncing every which direction, trying to stable her footing out. And that would just like, there's lives that will be lost with this, a lot of them. I'm not even sure how to go about this. A little quicker than I thought.
No, you're doing great. Tell us about your daughter. How old is she?
She is 23.
23.
She
You don't look
is,
old enough to have a 23-year-old.
yeah. Her early start, early finish. But she is a performer. She does fire staff. She works with the festival scenes and helps organize that, and a promoter.
Okay.
So her income is very seasonal, really. And what? Oh shit. So that's what I got. I'm sorry.
No. You're doing fine.
But I do know that all of the cuts are gonna, like, even my mom, who's a VA veteran, and my father, who just passed, who's a veteran. It was already hard enough to get anybody seen with that shit.
Yeah.
Now it's like impossible. So that list of nightmares is continuing in my household and my daily life
Yeah. Well, yeah.
as
That's when
well.
we haven't come across that yet today, because there's also a bunch of changes at the VA. Um, that have been affecting your parents, and that all came from the Trump first administration, I believe, when they did a lot of VA cuts. But there have been more just this year. Yeah.
Yeah, there has, and it's been on my doorstep all the time. Between that and the medical cuts, I don't even know how to start. I've started looking at all of the natural remedies for everything and doing all of my own math, my own homework to find ways to put together outside of the system, because it's just not going to be there. And as this regime keeps going, there's going to be more and more cuts all the way till we just don't have any money for it whatsoever. Y'all sink or swim.
Yeah. Completely privatized everything. Pay as you go is kind of their dream, their motivating principle there. Is your daughter's gender affirming care covered by Medicaid?
It is right now. It has not stopped. It is right now. But she has been seen, because she's had a lot, but this is it was a long road, and yeah, it is covered. So her care is covered through it, and I am very afraid for her. I'm just at loss of words. I can deal with my issues outside. I've old enough, I'm grown, and I don't need constant medication. But that is not the same to be said about my daughter, my sister, my mother, and just about everybody I know. And all my family are all veterans, and they still depend on the VA and the Medicaid care. And this is just too much. They're all, you can't afford it privately, but it is life or death for so many people. And I don't know more to say about that, other than to try to get the right people in play that understand the entire picture and stop trying to take what the people have away, because they don't have shit in the first place. And that's the only solution I can even think of, other than still coming up and fighting and calling and doing all of the things and then trying to learn how to be a nurse and a doctor and a chemist all at the same time, just to make sure when nobody has nothing. So it's very scary.
Yeah, no, you make so many good points. It really just the the last 50 years of uh trickle down economics has kind of sucked the working class dry, and like these cuts are coming from where? It's like trying to bleed a stone. Where are
Might
they
have better
getting
luck.
things from?
And it's true. And most people that are even considered middle class are still so struggling. I mean, they unless it's planned like a year in advance, there's no way anybody can do anything or budget anything in there with everything bouncing too. And here, I'm pretty sure, because we're out here, I don't know if the hospitals out here are going to close, but I know that a couple of clinics have already closed, and that leaves us with, even less access, especially if you're not, because I don't know if the funding for the rides for our elderly or people that need to get to the doctors, I don't know if that's still going to be here, because I mean, like me, I do live out in Nineveh, out in a rural place, and there are a lot of people that do not have vehicles and can't get to there, and they have to have that medical insurance to come pick them up and bring them. And if they get rid of the local clinics and stop funding certain doctors' offices, then they close. And now it's another problem about getting out there.
So yeah, like are any of the hospitals in your area on the chopping block? Or
I don't think so. I do not think so.
But even
I
then,
know I looked, but I don't remember what the maps were. I don't remember what was closing and what wasn't. It's been 2 days since I've seen it. Too fast the news moves.
yeah, well, no, but like even then, if your local hospital is safe, however close it is, you're still finding that the clinics or the little offices are closing. So I mean,
Yes, I've
you're
seen two
still
that
not
closed.
being
But
served well either way. Brandy, are you there? Can you hear me?
it's true, and it was hard enough to get it before before Trump came in and Doge and all of the things. Before all of the things, it was already hard through any of it, and they were already overworked. And this just makes it so. I mean, it just is. It's a lot. I'm not quite sure, but yes, it is more difficult to find them, and then find ones that are actually taking new patients as people come up and they come of age and are looking for a doctor and things of all of the things and all of the such. You still can't find like anywhere that takes new patients anymore. So that's another part, that they're already overbooked, overworked, overstaffed, or understaffed. Sorry.
Yeah, this
So
is
you
one of
can't find anywhere there.
it sounds like the sort of slick way that they also do these cuts is they make it harder to just get the services you need. So yeah,
Yes.
okay, maybe they don't close, shut down your hospital. Maybe they don't cut your Medicaid. You're still covered, but it's more inconvenient for you to access medical care. Well, then they reap savings that way. You don't go to a visit. That's money they don't pay out. You don't go to the clinic. You're like, I'm going to tough it out. I'm not going to be
Oh,
inconvenienced
that
by.
is so sneaky. You are on it. That is sneaky. I was just thinking about all the services that people have talked to me about, because I know a lot of people and help, just because I do, call me and be like, hey, this ride share, whatever, can't come get me right now. You can help me, da 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 da. So that's why it was in my mind, because it popped up. So, and they're like, hey, can you help me get a ride here to there, to there, to there? So that's the only reason that one popped in my head.
Well, yeah.
But that,
Tell me more about your daughter. When did she start like receiving gender affirming care, were there hurdles to
I
getting
believe it's
that?
been a couple of years. Well, she has been doing her own internal self work for a very long time. So she's been in and out of counseling for a long time and has been very aware of her surroundings and everything else. And she had gone with her and her counselors went through a long road of things and to try and to work on and all of that. And when it came down to the end of the day, she's been on it for 2 years. I think I'm bad at all the things, all the remembering the dates and shit. But I believe she's been on it for 2 years. And the hurdle, because they came at a plan, her and her therapist group came up with a plan and they stepped through it. So again, they would not have had that, and my child would not be with us today if they had not been able to do that and have that umbrella for her. Because it wasn't just, hey, I want this, and the doctor goes, yes, this is what you get. No, they went through years, and I'm not talking just jump the hoop. It wasn't something that was a fad. It wasn't any of that. Like, I'm very big on homework, and so is her dad, and all of the research, all of the homework, go through your normal things. So she had an entire team that walked her through this. So the hoops were already, I think their team and the way it came together was able to walk through it and do things healthy, and they are checking on her, and it's a constant thing. And I'm just terrified if she loses that network of humans that help her grow and be a successful human. So yeah, that as far as obstacles, there wasn't really that for her because of the system that was in play.
Yeah, and like here in Indiana, and several other states in just the last couple of years, they've banned gender affirming care for minors. Now, that's just the way in, though, right? Like they're coming for trans care for adults next. Like a lot of these folks, they don't think
I absolutely
being
believe that. Yes,
transgender is a thing.
yes, I
Yeah.
absolutely believe that. So no, I 100% believe that is all just opening the doors and seeing how far we can push, because there is an opening in our very tight knit left world through difference of opinion for people, and that was
Yeah.
one of those very few openings that we have correlations with ourselves over that particular topic, and ours are more academic and not try to use that as a leverage to get in and start just tearing it all apart. So you're correct there, they do use that.
Yeah. Oh, yeah, it's like I think on the left generally, trust what science says, and actual medical doctors and people who study gender and sex, they all attest to the validity of transness, and we don't.
And it's not a new thing. It's not even been in the closet. I mean, it's really not new at all. We have it all over the place, from circuses, anything and everything. It is not a new thing, and them coming after it is not a new thing at all. Their butthurtness about it becoming more mainstream with television and networking and internet. Now that everybody can come together and be them and shine, they are seeing the light shined, not on them or not on themselves and on somebody else, and that's not okay. Whoa, you're not in our Bible Belt. We're not going to have that.
Right.
So yeah,
but these folks always existed. Trans folks have always existed. It's not something new. Just like we were talking about autism a few minutes ago, and RFK is like, oh, it's epidemic of autism. Like, no, man, like neurodivergent people have always been around, just like trans people have always been around. And like just in the last several years, we're learning more about how these things actually work. Trans people actually like maybe felt comfortable to be themselves for the first time, and then the backlash.
But also with like autism, you're going to look at a lot of your mental diseases. Oh, I don't even know what you call them, neurodivergencies. Oh, that is what you call them. They have always been there.
Yeah.
But people had given him different names. Oh, she's quirky. Oh, she's this. Oh, he's that. He's got his things. It's just his thing. Don't worry about it. Like women have been easier to accept that they have a diagnosis that was unlabeled before. But the men are having a hard time with that. Now it's, no, that shit just doesn't exist. And I'm like, okay, it's always existed. Just because science finally gave it a name, isolated these characteristics as this particular thing, it doesn't mean that just because it has a name and a spotlight on it for 2 seconds, that it doesn't exist or it's made up. I mean, as we get better technology, like with the Webb telescope, we can see further. We can do better. And I don't think it's called the Webb, that was the other one. Anyway, as we get better technology and we get better information and things come and grow, and that's what science is about, it's stacking. It's just starting here, and the more you learn, the more you look, the more you know. And it is always building. So to say things just appear out of nowhere, that person needs to go back to school. And I very much would like you to keep the funding so that can happen, because this is insanity. I wasn't even like the top of my class or anything. And just the common sense shit that we learned in school, people act like they have no concept of the things that I'm saying as like 1 + 1 = 2. And they're like, what? Since when? Anyway, vent about that.
It's ridiculous. So listen, I know you said you also use Medicaid. There in Nineveh, are there even like jobs that offer insurance? I mean, I think I've driven through Nineveh. There's like a dollar store there. And
okay, so if you got to the dollar store, right? Then you were in the backwoods. Because the Nineveh is really that's a 4-way stop. It's got a bakery. It's got a little building that is, I want to say they are not insurance, but they sell houses. That's what they do. But they have an Apple on it. And we just got a very fancy BP station and a hardware store. That hardware store better be there forever. It's old school. It's wonderful. You got a back room to get your chain link. It's nostalgic as hell. I love it.
Oh yeah, listen, I'm a contractor. That's what I do during the day, and I love a good little local hardware store. The kind where you don't know where anything is, and you got to.
That's what I used to do, or I started doing the art in the bubbles.
That's in the third bucket on the right, like in that aisle over there behind the bathroom. You know, like love it. It's great stuff.
And it has, that's exactly it. Doesn't do tape measures. It has tape on the ground. And that's how they're like, measure it from this. It's hilarious. But no, there's nothing really here in these little, so we have to go outside. There's a couple doctor's offices in Trafalgar, and then there's Franklin, which again, everything from here is just about 30 minutes away. So no matter which way you go, you're going, like I'm gonna say 20 minutes because we got a couple of little spots, but if you're going to Franklin, that's 30, 35, 40 minutes away. If you're going to Columbus, it's the same. So all the way around here is just houses and fields and cows and corn. God, there's a lot of corn.
And it is corn sweat season right now. How's the humidity right there? Is it ridiculous today?
It is, but I had to come and bring like fans, and I have this wall of fans sitting here right now. But it was better than trying to clean up a blank spot in my very tiny house. I had like stacks of tie-dyes and things and art and everything all over the place. And I was like, yeah, it's going to be easier just to put a fan outside. But I am going to have to be getting off here and getting running. But well, I did want to come in and
thank you. I appreciate you for being here. I appreciate you for telling your story. Give your family our regards. Everybody deserves health care. You do, your daughter does, people do, just because they're people, because they're humans. and we shouldn't have to beg like this. You know,
It's not a privilege. It should be a right. It's not a privilege to have health care and medical. It should be a right.
yes, it
So
should.
yeah, but thank you so much for having me on, and thank you for everything you're doing, especially after working on houses all damn day. And you guys
Thank
have
you,
a
Bobby.
wonderful day.
Thanks for talking to us. I
Bye.
appreciate it. Bye-bye. All right, there. Twyla's back.
She is. I had to go off so I could talk to my firemen. I like
How
fire.
are they doing? They need some like
Probably
after
test.
school session with the
I
breathing.
think, yes,
yeah.
they. How did you know? I tried to give that one mouth to mouth, and he said they didn't do it that way anymore. Anyway, I was asking him how his breath work went because it's very intense. And for people who have PTSD, sometimes when you go to the deep place, those are revealed to you, the things that are inside of you that hurt so bad that you don't know are there. And I think he's afraid to let it happen, but he said he wants to keep doing it.
Yeah.
So and I try to stay away from the political side with them. So he had no clue. So go to the next person. Just let me sit here and nod my head. That helps.
Well, we're going to see if we can get the next person on there. Brandy, can you hear me? Can I hear you?
I can hear you. Can you hear me?
I can hear you. Yes, I can. Are you intending to not have your camera on? Because that's fine.
No, I was turning it on, but I don't know what's going on.
I want to see your pretty face, Brandy.
I don't know why it's not turning on here. I'm having technical difficulties. I've had them all day, so that's where I'm at.
Yeah. I mean, we've been trying to get Brandy on here for a hot minute.
Yeah, it's been rough.
I love Brandy.
Oh, I love you too. Hey, thank you guys so much for what you're doing and for stepping up and being vulnerable and sharing your stories, because, you know, this is not easy. It's not easy to be vulnerable and put yourself out there.
None of this stuff is easy, is it?
No, it's not. It's really
Did you see where I said I get to go to DC?
No, I haven't even had a chance to look yet. I
get to go to DC this weekend.
I've been plagued with problems. That's amazing.
I know. It's from one of the 50501 people. I'm going to ride with them.
Heck yeah. I'm so proud.
The old lady has never done anything.
I'm so proud to see so many of my 50501 folks up there. You know, I've told my story a few times about what's going on or what happened, what I went through with my grandmother, taking care of her. I took care of her for several years, very long time. And at the end, it got really difficult, and we had to really start reaching out to nursing homes, and we'd have to put her in for a week or two at a time because she would get super sick, and then we would need some rehab. And then, you know, 1 week turned into 2 weeks, turned into 3 weeks, and then we would try to bring her home again, and we, you know, it was bounce right back. But the reason that we would have to bounce back so much is that Medicare would only pay for so much of the nursing home stays.
Yep.
And they would basically only allow her to stay a week or two at a time. And they said that since she had family, since there was basically people at home with beating hearts, that she was safe to go home. And she was a bigger lady, and, you know, I'm not that big, and it was very difficult to help with transitions, and she would oftentimes get stuck on the commode even and not be able to get up, you know, and it was tough. But we were able to get her Medicaid to help supplement with the Medicare, and that did eventually help, and we were able to keep her, but it was truly only like a week by week situation that they would approve for her to stay. So every week we had to go through the whole process to find out if she was going to get to stay another week. And mind you, I was still there every day because she was a handful, maybe 2 handfuls. So we still had to be at the nursing home, like, you know, she would do things like call 911 from the room and say that they're being mean to her. And, you know, we had to eventually take her phone away because it was such a nuisance. But it was tough, you know, and then she very quickly went downhill, and we had to get hospice involved. And had it not been for Medicaid, we would not have been able to do that. And even with the help of everything that we had, it was still such a difficult process to go through. And I know I've been watching you all day and seen folks talk about being caregivers, and it's a difficult position to be in, especially if you're in this sandwich generation where you have kids at home and you're taking care of an adult, or, you know, a grandparent, mother, father, whatever. It mentally broke me for a little bit, and physically. I mean, I developed back problems, but I mentally walked into the fire station and had a conversation with them, and they were able to get me connected with some mental help because it was just too much for one person to handle. And without the help of Medicaid, I don't know what kind of situation I would have been in. You know, I truly, because if you're being a caregiver, you can't work full time. That's not a thing. So I don't know what I would have done. And Medicaid surely has a lot of improvements that needs to happen. And there's a lot of red tape that needs to be calmed down and chilled out. And instead they're adding more, which is just, it's never been proven that any of these extra steps actually help. It doesn't, you know, it really, technically, with all of the research that's been done, I know Shelley Yoder spoke about this and she knows way better than I do, but there's no evidence that this additional work requirements and paperwork actually improves anything or helps with any kind of fraud relief or anything like that. It's just making it more difficult so people give up and they don't end up renewing their Medicaid. They're just kicking people off, just in a different kind of a way, you know?
Yeah, like in the sleaziest way possible.
Yeah.
Like, yeah, it's just by denying people that actually deserve care, the care they need. Yeah, by making it difficult, by making it frustrating, by placing a bunch of hoops in front of people and making you cut through a bunch of red tape. It's ironic that, you know, this is the government, and the Republicans have been talking about this for years and years and years, about, you know, cutting red tape and making government more efficient and all this. And they are the people who put the red tape
created
there.
It. Yeah.
It is their favorite tool to, you know, to cut waste, right? They say to cut wasteful spending.
Absolutely.
Because, you know, spending money on us is wasteful to them.
I like the quote where, and I can't take ownership of it because I wasn't smart enough to come up with it, but how, you know, the Republican Party would rather starve 100 people so that one doesn't accidentally fraud the system rather than feed 100 people. You know what I mean? It's just like the numbers are so skewed. What's actually fraud is so few. I don't know if anybody out there, if you've never been on Medicaid, let me tell you how difficult it is. You have to be smart to figure out the system. I'm not saying people don't work the system, but those are smart folks because you have to go through a lot of steps to be able to get through that process and stay on that process.
Yeah. Oh, the fraud isn't coming from the individual Medicaid recipient, right? The fraud is coming from
billing,
the providers. It's coming from
billing,
hospitals and providers overcharging Medicaid.
Absolutely.
Amen, Scott. Amen.
And it's those are the people who are the big donors to the Republicans who write the laws. So they're going to be fine. It is individuals like us who are going to suffer.
I'm pretty terrified that, you know, my mother is getting up in age, and she and her partner of 25 years depend on their Social Security. And with this big, beautiful bill, there's some sort of rule that kicks in that's going to make Social Security payments limited, because it can't go over a certain threshold. So I seen a report yesterday that said that there was going to be a decreased payment within the next 7 years. Have you seen that, Scott? Have you seen that study come out?
Yeah, well, it's like I don't know which study specifically you're referring to, but I think you're referring to the Medicare or the Social Security Trust Fund, which
Yes.
would theoretically run low enough that they have to start cutting benefits in something like 7 years, which they could fix this tomorrow by raising the cap on Social Security income. Because they only tax the first something like $160,000 of your income towards Social Security. And, you know, Elon Musk is done paying his at like 12:01 on New Year's Day.
Right.
Hey, Michelle Higgs is back, and they must be at the top. Michelle, are you guys in Sullivan?
We are now in Sullivan, and I'm going to try to change my video settings, so bear with me 1 second. I just need my back camera. There we go. So this is the Sullivan Hospital, and we've picked up a few people from this way. There's Michelle. Introduce yourself and where you're from.
Michelle Demery, Greene County. You.
And then we got some people from Wabash Valley here. Do you want to introduce yourselves?
We just want to see the dog. No, I'm kidding. Yeah, there we go. Yeah,
Puggles.
everybody likes the dog.
Puggles. Yeah. So yeah, let me have you talk with Michelle. Real quick, my other Michelle here. Can you explain this is Scott and HoosLeft, and explain a little bit about you can hold this, that you were talking with the people coming in.
Okay, I've been. It's a video. I have been talking to the people coming in here. This is a beautiful setting here, Sullivan Hospital. Just a new building opened up over there for treatments. I've been talking about the cuts and how this hospital's on the chopping block, and nobody seems to know about it. Not some of the staff members here. One nurse knew about it and said administration had sent a letter to Congress requesting not to close this hospital. And most of the people coming in and out of the hospital are not aware of anything happening. They're completely in the dark.
How sad. How sad.
Well, yeah, and that's how it's going to work. Like, I think that, you know, the Trump administration kind of plans this so it doesn't all happen at once. It's like, you know, we got some cuts going in July 1st this year. We've got the work requirements. You know, they're still waiting to phase those in. Then that happens, and you know, the big Trump Medicaid cuts don't take place until like 2027, 2028. He's on his way out the door by then. Somebody's going to inherit a mess and get blamed for it. And in the meantime, people are going to suffer.
He blames everything that happens now to Biden.
So we're gonna take our photo, and then we're gonna hit the road, and we're headed to Davies County. So, and we'll check with you guys in a few minutes.
All right, thanks, Michelle. Good seeing you. You guys be safe out there. All right, that was Michelle Higgs.
That is so crazy. I love it. I love it.
Yeah. All right, now who is?
I'm still here. I'm trying to figure out this technical difficulty still.
I'm just glad I remember what you look like.
How do we stream without hearing the podcast? It disrupts our meeting. Um,
What's that?
sorry. You know what, Brandy, you were telling a story there when we invited Michelle in.
Oh no, you're fine. I was just saying that I worry about the fact that my mother and her spouse are getting older, and she's got back issues that, lucky for me, she gave me as well by inheriting it. And I'm terrified that I'm going to have to go through being a caregiver again. You know, I mean, I especially with not even the support that I had the last time that I had to do it, because we don't have any other extended family here. So it's all going to, once again, fall on me. And, you know, I've got 5 kids. Granted, 4 of them are adults, very young adults, but they're adults. And, you know, it's like you can't prepare for that. You can't prepare enough to be able to set up your life to be able to be a caregiver.
I know that's what my daughter is concerned about, Brandy, with my age and my mobility issues. She's always afraid I'm going to fall.
Yeah.
And I did. I went through a lot of falling when I was off of my medication for my rheumatoid, because it took me 3 months to get on Medicare. And so I could not afford all my medications. And I started falling. Luckily, it was in the grass most of the time. One time it was in gravel rock. That was kind of painful. But I've not broke anything, so that's a blessing. But I am 67 years old. My mom started into her dementia at my age. And so I do things to make sure that I'm not going to get it, or try. I test my brain and I work on my brain. But I know she's concerned about it because she has children too.
Yeah.
But I don't know. I don't know what's going to happen. All I know is that I'm fearful for everybody out there. I'm afraid for, you know, the young kids that have diabetes. I've seen several, you know, stories on that where they have diabetes. One kid ended up in a hospital that I had seen where and it showed pictures of him in the hospital. And then it showed him talking about it with his mother, because he knew that they couldn't afford what his insulin. And he started using his insulin only every 2 days. And he had a pump, but he just wouldn't put it in. And for a diabetic, that is so dangerous.
Yeah.
Especially a type 1 diabetic. I'm type 2, and so I can take care of it. What's going to happen when I can't, when I don't remember to check my sugar? You know, what's my daughter going to do? I don't know. It's a bad world we live in.
The preventative care is so much cheaper. The maintenance is so much cheaper than dealing with the emergency. You know, what's going to happen is people don't realize that when you take people off of Medicaid, it's going to cause people to wait until there's emergencies, and they're going to wind up in the ER with a much worse situation than what they could have taken care of. And you think, well, that doesn't affect me. That's not my problem, right? Because I have private insurance, so it's not going to affect me. But what's going to happen if those hospitals have to treat the patients, and they do, folks, they have to treat those patients, and they go into debt because they've got, you know, 20% of people who are on Medicaid now just showing up at their hospitals. They are not going to eat that cost. They are going to raise their prices on everyone else to cover their bottoms and not have to be out that money. So they will get their money.
And
through us.
And it's going to hit our credit reports too. I've got some medical from like 4 years ago. I've got a student loan from 13 years ago. 13?
Well,
I don't
know. Biden had taken that off of made it mandatory that you didn't have that on your credit for medical, I believe. But
he did.
And that was canceled. Yeah. Yeah.
By an executive order. He just stopped it. So all my medical is showing up on there. And I told Scott, I have 2 fake knees, a fake hip, and titanium in my back. plus all of my stuff that I've had to do for my diabetes. I took one medication that when I tried to get it when I had no insurance, it was $1,800 for a month.
Yeah. And you know, a lot of these folks are like, I work hard. I'm a blue collar worker. You know, I feel like in our area, I live in Morgan County. I feel like we have a lot of Republicans who have that mentality of pull yourself up by the bootstraps. I work 40, 50, 60 hours a week with my hands out in the weather. Those are going to be the folks that are going to need this safety net more than these wealthy people that are sitting in temperature controlled offices working on computers. They're at risk to have back problems and migraines. The blue collar workers are at risk to have all kinds of issues because of the physical work that they're doing with their bodies. Yep. And you're not guaranteed, you know, everybody's one broken leg away from being homeless, you know?
Exactly.
And I don't know if a lot of your viewers know, I know that you do, Scott, because you stay up on the news really well. And she does as well. Twyla does as well. She's as bad as me, I think, with being addicted to politics. Yeah. But that new executive order just dropped about if you are homeless, if you have a drug problem, or if you have a mental illness, that you can be institutionalized in a nice way to put it, and all it would take was a judge to determine whether or not you were deemed like you couldn't take care of yourself. If you are a harm to yourself or others, which could just be a, you know, maybe you did have, you know, suicidal ideations because you have PTSD. Maybe you're homeless and somebody says, well, you can't shower every day or every other day, so you can't take care of yourself. There's really no spelled out guidelines in there's no definition of what that truly means. This is going to be left up to a judge to decide. And that's terrifying because most of us have some sort of mental illness.
Well, and if you didn't before, living in this timeline will give you one.
Exactly.
Yeah.
Exactly. I want to talk about the homeless thing for just a second, Brandy. You're probably too young, but you might. In Indianapolis, Central State was here. Do you remember Central State?
Yes, I do.
When I worked downtown at the Indianapolis Star and News when they closed it. Mm-hmm. And we went from having just a couple homeless people that walked around. One guy was there as long as I can remember. My dad retired from there, so I had been down there since I was a young child. He wore like 5 coats year round because that was all he had. Mm. And he would have that on hot days like today because he had no place to leave them. Having said that, when they opened those doors of Central State, you know what they did? They didn't send them to their families. They set them out on the street with nothing.
Yeah, I remember.
On the street with nothing. And that was when our homeless population in Indianapolis was overwhelming. I mean, women were afraid. And afraid, sometimes our fear is just of the unknown. And they weren't out there to hurt anybody. I feel when I go back down a street now and I see somebody sleeping under all these blankets in the wintertime and it's freezing cold and they're on the concrete, you know, they can't be warm.
Right.
And we have got places that are, there's a hospital down on 135, which if you live in Morgan, you probably come that way sometimes. There is a hospital that they built it's in Parkersville, and it's an Ascension. So that's St. Francis.
Mm-hmm. It went bankrupt, right?
I don't know, but it's empty.
Yeah, it went bankrupt. It never actually opened.
Never. Ridiculous. They would keep saying this, it's going to be open. It's going to be open. And they still have the lights on in there. They still have lights on. And how many? There's a marsh up the road. We've got all these empty places that the state of Indiana, because I have lived here all my life, except when I moved away for a while, that we have always had a abundance of money on the side that we've got. And they could help this instead of hurting it. Instead of being a Trump bootlicker, let's do this. Let's take care of the state of Indiana. I don't care if it turns blue. Let's just use our hearts. Let's use our hearts.
Look at how fast they got that alligator Alcatraz going. You know,
exactly.
They can do that in that short of time. Think what they could do if they really made a plan, a solid plan to actually house people safely and let people get back on their feet. You know, I mean, it's hard to get a job if you don't have an address. It's hard to get a job if you don't have an ID. It's hard to get an ID if you don't have a social security card. You know, these things are taken for granted often. But I mean, I don't know, Twyla, you probably don't know a lot about my personal story, but one of the reasons I'm concerned with my mom getting older is because we didn't have the typical traditional relationship. My grandma actually raised me. I was one of many kids that was born into a very crappy situation. My mom was 15 when she had me. She obviously was on Medicaid. She had gotten pregnant by the boy next door who happened to be 18 or 19. Turns out he ended up being a very, very, very bad guy. Very bad, like Indiana top 10 most wanted kind of a guy.
Oh my.
Yeah. So I was the child of a man that was in prison my entire life, and my mom turned to addiction problems. So I was left to be raised by my grandma. So for me, those food stamps and that Medicaid that got me through my dentist appointments, my doctor's appointments, and put some food in my belly, my grandma may not have been able to afford to do what she did by raising me, and I feel so bad for kids out there who, to no fault of their own, are going to lose benefits because their parents are classified able working body. You know what? Even if they are abusing the system like my mom was, and I say this having been a person who actually called and turned my mom in for food stamp fraud. She still holds that over my head to this day. I was a teenager and I called, and they had a hotline, and I just had to leave a recording, and I wasn't happy with that. So I called. I think I was 16 at the time, maybe. I called and called and called until I got some secretary, and I told her my story, and I said, my mom is using this for nefarious reasons, and the cops won't do anything about it. And she's going to lose her life if she doesn't quit her habit, and this is helping her support her habit. So I've seen the fraud in action, and I know
there is fraud.
It is fraud, but I also got some of that money to put food in my belly. So yes, it was fraud, and yes, it was terrible that she kept half of it. But kids like me, it wasn't my fault, I mean, these kids are going to be punished for something that's not their fault.
And if you have, my son-in-law has an aunt who is my age, so 60, I think she's a year younger, 66. And she has a daughter that had a child by a bad man who went to prison for something. I don't know what he went to, but he got the daughter hooked on drugs, meth, not just pot where they can set it down, but meth. And she's ended up in prison. And guess who has the child? Grandma.
Yep.
And in order to keep the daughter out of it, because she would come and try to be a part of it, and she would be high and loaded and throwing up. And so Aunt Trish took the baby and adopted her. The mom said it was okay. Dad was in prison. He really didn't have a lot of rights. So now grandma has her at my age.
Yeah.
And is raising her. And she's on Medicaid. Because it's not, when you adopt and it's a family member like that, it's kind of a little, I don't know if it's different or what.
It is different, yeah.
But she is on Medicaid. Great. I'm glad. I'm happy. Yeah. Because at least she's not in the system getting bounced around the houses that want to abuse her sexually and use her as a slave or whatever. So she's got somebody who loves her with all of her heart. But when it comes to medical, what's going to happen? Aunt Trish can't eat that. I mean, when you're our age.
But God forbid Aunt Trish lose her any portion of her benefits. God forbid she lose the opportunity to get her full Social Security check. Because like you said, my mother lives in a little efficiency apartment, and it's over $1,000 a month, and her spouse together only make a little, I think it's $2,400 a month total for both of them.
Mine is $1,100 a month, my apartment, and I make $1,900 a month. Well, actually I make like $1,680 something after they take out the cost for my Medicare.
It's just not a livable amount, not even working full time. I've got triplet teenagers and a 26-year-old and a almost 6-year-old. I've got all range ages of kids. And just for our car insurance alone, it's over $500 a month just for the car insurance. Like, that's not even counting cell phones. Like, how do people...
I was going to say, you add my cell phone in there, my bill, and my my car. Let's see, cell phone, electric, car. I put cable into or internet onto my cell phone. And that's what I pay. All my money's gone. Thank God I eat at my daughter's a lot, and I don't don't eat out a lot.
Well, and I know this is a little tiny bit off topic, but I've talked with Sarah Blessing before on Project Next. We did a podcast with regards to what's happening in my town. It's Jackson Township specifically, but Morgantown, Indiana. And they raised our property taxes for our township portion 540%. Overnight, kind of in the dark of night, where not a lot of the citizens knew what was going on. And what ended up happening is, with the increased property assessments that are already happening and have been happening for the past 3-4 years, with that happening and the property taxes going up, my house payment for July 1st just went up $257 a month. And we live in the exact same house. Nothing changed. I've talked to a lot of folks.
And you're not getting anything else.
No.
For the additional cost.
Nothing.
Right? You're just paying more for the same, probably subpar services in your community.
Yeah, because they're not doing things for any.
Well, and then I've got people. I've started a Facebook page, and I've caused a ruckus, and I'm certainly not popular with some folks in town, and other folks were like, heck yeah, let's do something, let's stop this. But a lot of older people have reached out to me and shared their stories that I bought this house 10 years ago, and I bought it because I knew that I could afford this house, and I had my retirement in mind, and this is what I budgeted for, and now my house payment's gone up $150 a month, and everything else is going up too. How am I going to afford to stay here? And to move out, I can't afford that either, because apartments are even more expensive. So what am I supposed to do?
I just told him I had a friend who had a house that has a special an all-purpose needs. I don't know. The child can't do anything for themselves, so he's going to be with them forever. Probably about 12. Their medical bills under Medicaid is just totally outrageous. His insurance is under his dad, and then Medicaid steps in. But they lived in a house when he was born, and I said, "Oh, so you're still in the same place?" No, we're in an apartment now. And they've changed apartments a couple times because they keep putting the rent up. And so they'll go find something else. Who can keep doing that? Mine is $1,100 a month, Brittany. But anyways, mine is $1,100 a month. And I have an efficiency, 1 bedroom, a kitchen, and a little living room and a bathroom. It's $1,100.
It's crazy.
It's crazy. It's like, these are people who theoretically, had done the right thing, lived the American dream, had their house, had their little piece of the pie, and had a little wealth. I mean, people's primary source of wealth is their home, and then they price you out of that and put you into a situation where you're paying rent to some landlord who keeps getting richer while you're paying more for something you're getting no equity in, and just this keeps happening at scale all across. It's like they're trying to depopulate the rural areas, in a way.
Yep.
I mean, directly. And really.
And how is Morgantown like building all these fancy subdivisions?
No.
Oh my God! You should see Bargersville.
Yeah, Bargersville's definitely popping up, but no, not Morgantown yet.
Oh, it is unbelievable. It is unbelievable. And the prices of these homes. Oh my gosh. There's one that is set empty and I love it. The guy flipped it. And it's just one of those little bitty square houses, the kind of, might have 4 rooms. Jackie said there's 3 bedrooms in there. She used to do photography for the realtors around here. So she has her access to get in and look further on things. And I think the house. My Jackie.
Okay.
And she, my Jackie is a teacher at Center Grove High School. And she does photography on the side because that's what she teaches. Anyway, this house is like $400,000.
Jeez.
I know. It's crazy. It is crazy. And it's sat there like this for 3 years.
Well, private equity, people with money, people that have that money, that cash flow, will go and buy up those houses and flip them. And if you have so many people doing that in an area, it raises the prices on everybody, because when you're doing the market assessment, I used to work in real estate. When you're doing that market assessment, they take into account what the houses next to you, nearby you, and similar to you sell. So the more they raise and drive the prices up on those flipped houses that, you know, some business corporation owns, then it raises the cost on everybody kind of artificially, because nothing's really changed, you know?
Exactly.
Or they rent them out.
But there are so many neighborhoods now that are not letting people rent in the neighborhood. It's in their HOA or whatever you call that thing, where they rule your life. You can't paint it pink if you wanted to. Definitely we couldn't do pride stuff in the front yard.
Oh yeah.
Man.
We have a friend I was talking about, my Jackie. Twyla's met her. She's quite the fireball. But
she's wonderful.
I met her at a Chick-fil-A standing in line, and we got to small talking, and she said something, or maybe I said something about the economy, and we were just ordering our food, and it was so busy. And I told Riker, I'm not sure if we can do the Playland, buddy, because there's no tables over there. So when I got out of line, this lady said, I saved you guys a table and I ordered my food to go because I seen that there wasn't any tables. And I said, well, why don't you have lunch with us? And so she did. And we sat there for an hour and a half and talked about politics.
Really?
And I invited her to a 50501 event. She came. She's not connected with the internet or Google Maps or any of that because she's a little older, and she just doesn't. She's disconnected from, a lot of folks. So she feels really alienated. And boy, when she got to that first 50501 event, her and Miss Twyla both went and talked to the media that were there.
Oh, was that who you were talking about?
Yeah.
I didn't know that. I didn't know your story behind her.
Yeah. We text often because she's lost a lot of her friends because they've all turned to MAGA. She lost her church because the church encouraged people to vote for Trump. And she's she's not a wealthy person. She's, very average, lives in a house that she can barely afford. And she's scared. She has medicine that she depends on, and she's really scared of losing her benefits.
She was very afraid of ending up needing assistance. And what is going to help her when she needs assistance if it's not going to be there? What will she do? And that's her fear. And I said, well, we can't worry about what's going to happen to me 10 years from now. We have to worry about what's happening right this minute. No, it's not impacted you. And that was my point that I was trying to make to her. We're fighting for the future, but really we're fighting for right this minute, because right this minute when people are being affected. And if we don't take care of this minute, we definitely can't take care of the future.
I think she's a really good representative of a lot of the older folks that are, and so many are connected. Do not get me wrong. So many are totally connected with the internet and all the resources. But a lot of folks that are older are not. They're not comfortable using the internet. They're not comfortable being in these spaces and having support like we have, I work with the Michelle Higgs campaign, and, I have that community there. I've worked with the 50501 and the leadership there, and I have that community. So I can't imagine not having that and going through this dystopian nightmare every day,
I can't either. If I didn't have this, because Jackie won't talk to me about it because it impacts her mentally.
Yeah.
Because she is a teacher and she has to deal with all these people, because Center Grove is red. I am talking crimson red. And she graduated from school there. We built our home there so she could go to Center Grove, because back then it was such an amazing school system. And it still is.
Yeah.
But they're changing it. They are changing it so drastically. And so she can't get involved. And so sometimes she'll come to me and say, Mom, and we'll talk about it, because she knows I am deep into it. But other times she'll say, I can't talk about it right now. I can't. And that's okay too. So she gives me my support when I need it. But it's on everybody's mind. It is on everybody's mind. And the people, I talked to my sister-in-law the other day. My brother passed away April 12th. And that he and his wife had been married 60 some years. And she is in a house, a big house down on a lake in Georgia. Good for her. They've got a lot of money. And she doesn't do anything. She's always been a reader, so she's always been a stay-at-home. I just read. And I asked her the other day, I called on my brother's birthday to see how she was doing and how she was holding up during it. And none of the kids, he only has one child, but he has bukus of grandchildren. And I said, did anybody come see you? No. She said, I don't do anything. And I said, you don't do anything? She said, well, I still read. But she said, I just spend most of my time watching Fox News.
Oh.
It'll rot your brain.
Just, and she gives me my space because she now says, I know we aren't politically on the same side. No, we're not. We're not even close.
Or ethically or morally or.
Yeah. I don't know that they have any morally involved in their life. And I don't know that I would, were it not for AA, getting sober and all that stuff, because I finally believed in a God or something. I think it might be this duck on my windshield, but but she has nothing but Fox News. Can you imagine? I mean, even when I was watching Fox just so I would hear how bad it was, I became stupid.
It does. It makes you angry. I talked to Jen Senko last year, and she's the director who and screenwriter who did Brainwashing of My Dad as a documentary. And,
I need to see that.
Yeah, it came out about 10 years ago. But it's even more relevant now than it was when it came out, I think.
Probably.
And it talks about how Fox, like her dad got into that pipeline through right-wing talk radio, right? Rush Limbaugh.
Yeah, oh my gosh.
Same way, same thing. And he doesn't watch Fox News now. And but the way it works is it gets you into a heightened emotional state. It gets you to it gets you to be scared, right? It puts you in that fight, flight, or freeze response.
Yep.
And so it works you up. It gets you scared, and scared people are
dangerous.
Easier to turn rightward.
I will tell you that during COVID, when he was running for the second term, I was stuck at home. I did not live in the same apartment. I lived in a little bitty, it was a 1-bedroom, but it had a little bitty living room. The whole house was paneled. It was like a big house that had been turned into 3 apartments. Anyway, all I had was this paneled dark room. I had to sit on a computer all day and do nothing. So in my spare time, which was when I was sitting on the computer, not having a job because I was a receptionist, I started listening to what Trump said, in the fact that he said, nobody listens to me. Nobody knows what I really say. So I started following him on Twitter day and night. I am talking day and night. Everybody that would talk about Trump, I would follow that person day and night. Now, it did not change my mind. It just filled me full of more hatred and all of that. And I went stupid. My doctor called it a nervous breakdown. I quit taking all medications, not intentionally, just because I was so engrossed in what I was seeing. I was on it. I had to watch everything, or I missed that one thing he said nobody listens to. And I couldn't stop. And one day I was at my daughter's house with my computer. They made me do a Zoom call with my boss, and she said I needed to have my mental help. She thought I was having some issues. I don't, first of all, they can't say that to you. That's against the law. But second of all, she was right, though. And so I was crying, and my granddaughter, the oldest one, said, Mina, why are you crying? And I said, I don't know, Adeline. Well, I'm going to tell Mom. And my exact words were, do you tell your mom every time I fart? And she goes, yes. And I go, thank you very much. And she says, well, Mom told me to. And that's how close my mom watches me, because I've had I never had a nervous breakdown. I was never that bad. But I have get to the point where I don't forget anything now. But so number one, when you have diabetes and your whole system is messed up and you don't take that medication, it's not that you're going to die immediately. It's that your brain goes stupid and you start forgetting things and you start acting different and you start crying, and then you're not taking your antidepressant or whatever, your blood pressure. I wasn't taking anything. And so I said, please don't tell your mom. I'll tell her when she gets home. And I did. And she said, Mom, you've got to get to the doctor and you've got to get in quick. And she called, they got me in quick and they put me back. I was off work when it was time to go back. So this must have been 2021 by the time I was diagnosed. And I think he let me go. He wouldn't let me go back to work until I had my vaccinations, which was fine because they weren't out yet for me. But he said, as soon as they hit the market, I will give you a vaccination and you can go back. And that's all I wanted, because number one, I was way too deep in politics. But number two, I didn't have my other medication other than the ones I ingest orally. I didn't have my people.
Yeah.
I didn't have the people in my building. I didn't have the people that come up and hug me or that just, come in and smile every day. Every day they'll smile and say, hi, good morning, Miss Twyla, or whatever. And so I was lacking a very important medication as well as my oral ones. But what Jackie said is, Mom, you've got to get away from this Twitter. You've got to give Trump up. You've got to stop. Yes, you can dislike him. Yes, you can try. Yes, you can talk to people, but you have got to quit watching him day and night. And I did. I've never joined X or whatever they call the new one. I've never joined any of this stuff. I'm not on his truths, whatever he lied about. And I don't do it. Do I pay attention to what he says? You bet your butt I do. You bet your butt I do. I know. I'd already heard about that executive order on the homeless people. Now, where are they going to put them? Because we don't have any place, because they're taking over Atterbury for detention centers.
I think they're going to
they'll just throw them in there too.
I think that they're going to be setting up something like Alligator Alcatraz. I mean, I don't know what this
alligator
looks like.
The man needs to be thrown out because he's letting people sell merchandise outside and people taking photos of themselves in front of Alligator Alcatraz. And what's her name saying that, they'll get, at least the alligators will be fed well. Who says shit like, I'm sorry.
Yeah, no, it's true. It's disgusting. Just like the desire to hurt people and cause other people harm. And yeah, just really not thinking of others as people, as valuable members of our society. And then it does. It all comes right back to this Medicaid and everything we're talking about, because there is no help. There is only punishment. That's all they believe it. That's all they think government is for.
What did the girl I told you about with the child, what did she ever do to deserve the treatment that they're going to get? That baby didn't do anything. He was born and it was some kind of I don't know what. I don't even know if they know what gene causes it, but there's like numbers after each form of trisomy or however you say it. And I don't know which one he's gotten all that, but his father has worked every day since I've known them. And I've known them probably 20 years, every single day. What did they do to deserve having their medications and things and their livelihood for that child and his well-being taken away from them? What did I do? Because I don't know that they're getting in there, but I hear that it's in the bill for Medicare, that there are things coming out of Medicare. Now, I've had Republicans say, oh, no, you're just listening to the wrong person. Maybe I am. Okay.
No.
Am I afraid? You bet. Because I have nothing. If he started dipping into Social Security, they would have to put me in Alligator Atterbury, and I would go down.
I think where we're messing up is as a society, we've been somehow trained to think that people need to do something to earn their health care or to be worth having health care, when it should just be a basic right.
I have paid for health care my entire life.
We're a civilized situation. We're a civilized country. We have the resources to be able to provide healthcare to everyone. It's at this point, it's a choice not to do that. It's just them choosing to not do that and to capitalize off of sick people. There's no other way to see it.
Okay, here. And we were talking about whether this thing will affect Medicare too, and well, I just pulled this up while you're
It
talking
will.
there. So, this is from the Center for American Progress. The One Big Beautiful Bill Act prohibits the implementation of two finalized rules until October of 2034.
I'll be
The
dead by
rules
then.
would have
Okay.
made it easier for very low income Medicare enrollees to access Medicare savings programs, which will oh,
I lost
everybody.
it.
Yeah, everybody glitched
That was
away
weird.
there. I was
To
so I don't
access
know.
Medicare savings programs.
Yeah, okay, great. Yes, so those help cover premiums and cost sharing for the Medicare benefits. This will disproportionately affect disabled people as they are more likely to have lower incomes than non-disabled people. Okay, and second, the bill eliminates Medicare eligibility for people with lawful immigration status who have already paid into the program. And finally, according to the Congressional Budget Office, absent further congressional action, this bill will trigger $490 billion in cuts to Medicare from 2027 to 34 due to the statutory Pay As You Go Act of
That
2010.
one.
Yeah, that's what you're talking about.
Yep,
So,
that one.
yeah, basically, this bill blows such a hole in the budget that it's going to invoke this Pay As You Go thing. I don't know exactly how it works, but it's basically they're going to have to. It triggers automatic cuts in Medicare, not directly but indirectly.
I hope his ankles swell a lot while he's in Scotland. Is all I can say.
Yeah.
I could wish worse than that.
Listen, even everybody deserves health care, even the worst people in the world.
That's true. That's true, and he'll get it. So you know.
Yeah,
Yes,
all of the government, they get their free health care is what I'm under the impression of, because they said if they're going to cut things for Medicaid and things like that, they need to cut theirs. They need to cut months vacations, especially when they just don't want to work. There's a lot of things they need to cut and we could save money on. This is a bunch, him taking a trip so he can open 3 golf courses. Oh, we're going to talk too. Crap.
Yeah. And well, the the grift with some of these people, yeah, they're happy to take away your care and your access to, you know, the things you need to survive. That they're always going to do fine. You know, they're going to do just great.
I would bet every penny I've gotten. So nobody take the bet because it's not very much. It's not like you're going to get much. But I would bet every penny I've got that if you went to Mar-a-Lago, he has got immigrants down there working. I bet every penny.
Well,
on every place, and I don't care. But you can't pick and choose which immigrant you're going to take. We're going to keep the ones that I use, but nobody else can have any. Like we can't have them that come over and make money for their families in our country, but you can let them do that down there. That's bullshit. Which causes our prices to go up.
And there's, you know, this conflicting stuff because Trump said, oh, you know, we have to protect the farms and the restaurants and the hotels, and yet, like, he's like, we're only going to get the criminals and whatnot, and yet they're sitting outside Home Depots, right?
They went into Subaru of Indiana. It's today's Saturday, must have been Tuesday, I think, into Subaru in Lafayette, Indiana, and removed 74 people this week.
Oh wow, I hadn't heard about that.
Avon, it was in the Fox 59 paper on Avon. They did traffic stops. Now
that one I saw.
Is that freaking amazing? Oh, there was no, profiling done. Isn't it odd that you had 20 stops that you made of people who were a different color and that you arrested? I call bullshit.
Yeah, that seems targeted. And Unfortunately, like some of our local police are way too happy to play along with that. Now, I'm fortunate. I live down in here, and well, I'm fortunate because I'm a, straight white American man, and I've got all the privilege in the world. But what I mean is, people here in Bloomington are fortunate that we've sort of
you're
pulled
liberal
our.
down in Bloomington, aren't you?
Yeah, we actually have fairly good local government around here. It's quite nice. I recommend it for the rest of Indiana. You should try it.
That's close enough. I could still come see Jackie because they won't move, so that would be okay.
We do have our problems. It's very expensive around here. But what I'm saying is, in our community, our police and sheriff are basically hands off with ICE. They are not going to help you. They're gonna follow the book. They're going to do what they have to do, but they're not playing along because we, the people in Monroe County, don't want them to play along. We love our neighbors.
Well, you said something about them protecting the farm workers and the hotel workers and, to protect those industries. But what that protection looks like is nothing short of slavery, because in what he said to protect them, he wants to make the owners of whatever said company or farm then responsible for those immigrants. And there's never a path to citizenship. And they would be paying taxes, which, newsflash, they already are paying taxes.
They're not
getting the benefit back. So, it's nothing short of slavery. It's scary.
You know what it reminds me of? It's like the Gulf states dictatorship model of labor. And Trump loves those guys. Big fans of like the Saudis and the Emiratis and Omanis. Loves the way they do things over there. And that, remember a few years ago, the soccer World Cup was in Qatar, and they managed to like build all these stadiums really fast in a country that has like, only a few thousand people. Really, it's not very big, and yet they, have this massive event, and they put these stadiums up really quick with what was basically slave labor. I want to say, imported from Southeast Asia. And they treat these people terribly. Tons of people die on the job, and they basically belong to whoever's building the thing. It's disgusting. I thought we put this thing to bed, centuries ago, but
I was thinking the same thing you were, Twyla.
Yeah.
Back like
Egyptian days. I watched the 10 Commandments every day of the Easter month. I don't know why. I've been trying to get closer to God. And so that was my way of, seeing and just seeing all of it, and them beating the woman and all of those things. And she's stomping it and doing whatever she did. And how awful that, but that's what I'm seeing. I'm seeing us going backward, and I don't want your children, anybody's children, my grandchildren. I don't want them to have to see this. I do not. It's bad enough and I don't want them taken out of the books, because I believe firmly that if we take things out, if we remove our history, it is sure to be repeated. And if we have that history in front of us, they're going to go, ooh, no. But if they can't see it, if they can't be taught about the Holocaust, if they can't be taught about slavery days and the Civil War, then that can happen again. And I don't want my grandchildren to see that. And I want them to be able to pass down to my other grandchildren, their children and their children and theirs. We had this grandma, her name was Grandma Twyla. And Grandma Twyla, or Mina, whatever they call me, she went out at 67 and she started putting her feet on the ground. She started trying to make a difference. And before long, this is what happened, or this is what happened. Was it because of her? Maybe not. But she went out and talked people in to make changing their minds. And I have changed a couple.
And I encourage everyone. The way I met Twyla was at a town hall. I kind of
my first town hall, my first one.
I kind of talked to them. I kind of like made them plug the 50501 event that was the next day. And when I say that, I literally put the event on the phone screen and walked it up there because I was already sitting in the front row, and gave it to Shelly Yoder and was like, will you tell everybody about this tomorrow? And so they passed it along to Karen Talion, and she kind of looked at it and passed it along. And whoever the gentleman speaking was plugged it for us. And some people had questions. And so I spoke on the 50501 event. It was a picnic. It was our first like family style picnic at Garfield Park. And Twyla came up to me afterwards and said, can you tell me more? And I was like, absolutely. And the next day she showed up. And the only reason I tell that story is because if we tell people that we think even might be like-minded, then we join the voices together and we have a much larger movement.
Have a louder voice.
And
louder.
Like you said, for me, I got stuck in the doom scrolling and being addicted to politics and being too deep in it. Absolutely, totally did. The only thing that got me out of that was activism. It's the only thing that I could funnel what I was doing. And you know what? Protesting isn't going to fix it. We all know that. Everybody that goes out there and protests knows that that's not the only thing. But
you have to do a lot.
The people that you meet while you're protesting, you form a community. And when you form that community and make those connections, you start getting involved in other things. I'm not saying you're going to accidentally end up as part of Michelle Higgs' campaign, but you might. You might. So I just encourage people, you don't have to know a lot about politics. You don't have to just sit at home and be afraid.
No.
That certainly doesn't have to be 50501. There's Indivisible. There's a lot of
I'm in a bunch of them. I'm in all of them.
Yeah. So just,
if you don't have something going on today, then somebody does.
That's right.
And Twyla can be busy. Twyla can be with her voice. And that's all I've got to give to this is my voice.
It feels so much better once you do, though,
It is made, and it's like-minded.
Yeah.
Because I'm comfortable when I'm with like-minded. And I knew the day that I went to that picnic, I was afraid. I was afraid to go because I didn't know anybody.
I was so
and
happy to see you.
How soon did I know somebody?
Yep.
I met Amy on her birthday.
Yep.
Hallelujah. Hallelujah. I met several people that I've now talked to. And then we went from there to something else, and we did something else. And I have a family now. That family I lost down at IU, I've got now. And I love it. And I love this guy that's getting ready to come up to my window. That is my fireman. He's the one who got involved in the fire department years ago. And he is a red hat. And we love each other. We love each other. He accepts mine. Yes, I know. I'm not gonna change his mind. And that's okay. Because he loves me for who I am, and he says, go, Twyla, do what you gotta do. Do it, do it, do it. And he does his thing.
I say you be there. Yeah. You be there and let Trump change his mind. And when he does, then you'll be there.
Exactly.
That's so important.
I love this man with all my heart, and will always. But I've got people I've lost in my life because of it.
Which also happens. Yeah. Well, like I was talking about with Jen Senko and her documentary, her father was pretty insufferable for a while, but she never really fully cut him off. You sort of have to keep lines of communication open just enough with some people that they have a way out of the rabbit hole, and it's so important to remember that people are people. And a lot of times, folks have their political beliefs because they've been manipulated, depending on what media they consume, depending on who else is in their life, we're shaped by forces outside of us all the time in that way. And, it doesn't make you at your core a bad person. And they'll when folks get radicalized, I think is because they're alone and someone is there to offer community, very much the same way that it works in our direction too. You feel alone, feel helpless, and you get together with other people, and then you've got a community.
And it's kind of like AA. People will turn their backs on somebody who goes out and falls off the wagon, as they call it. And I talk to everybody, and if somebody has fallen off and they feel so bad and they can't come back to a meeting or whatever, why? You need to come back. We don't care. We don't care. We're glad you went out. Because when you going out and coming back and saying how bad it was, reminds us that we can't do it. It's not going to work. I've kept almost 41 years of sobriety that way.
That's amazing.
And I have never, ever told somebody that was a mistake, you can't come back. Our door is open for everybody.
It's part of the process, right? Part of the process.
And this is the same way. This is the same way. They have their own opinions. They're going to have to live in that life. They're going to have to find a bottom. And when their bottom is here, we will be there for them, regardless. And if Jared gets a bottom in this, because, I mean, yeah, I'll be here for him. Or if I hit a bottom, he would be there for me.
Yeah,
and that's what
we need to move forward with the message. And Sarah Blessing she talks about this every single time she speaks. What can we do bipartisan together to move forward? Let's stop talking about all the things that we disagree, because there's a lot of things we agree on. Let's start there. And I would urge Karen Talion, I'm sure she's watching this live. It would be amazing if she was. I urge her to make that our message. Let's start with what we agree with, and let's make some steps.
What do we agree on?
Common ground. We agree that money needs to come out of politics. Everybody agrees on reversing Citizens United. Nobody disagrees with that. Most people agree, like for Indiana, most people agree that we should be able to put issues on the ballot directly to vote for.
Right.
Indiana doesn't do that. Why won't they listen to the people? Let's start in places where we can find agreement, and then let's move forward from there.
Right. We have to have an actual, platform of things we talk about, and it turns out, on the left, that most of our positions are the popular ones, but we need to talk about them more, and not just, hey, these guys suck and they're mean, and they are, but that's not enough for a lot of people. Some people think mean gets stuff done. And it does, but it doesn't get done very nice things. Like,
has anybody seen the video of the people who lived here in the States? I think they came from Texas, and they just didn't like how it was because they thought they needed more government.
Yes, Russia. Yes, they went to Russia.
He's fighting in the Ukraine military now, or Russia against Ukraine.
Yeah, he got drafted into the Russian military.
I'm going to step away for a minute.
Absolutely. Thank you, Twyla. Well, I'm going to send you away, and she can come back whenever she's ready. Brandy, I think that, boy, you guys hit on so much there.
We're a lot. We're a handful. I apologize.
Well, no. It's good, but really, it all comes back to these cuts and what we think government is for, whether it's a thing we should even have or do. And I think a lot of folks like her friend there, maybe have been told by a lot of people that government is bad. It's the bad guy, or maybe it's it's a good idea, but it's ineffective, and there's too much power in it, and we should let the private sector handle more stuff. And I think they're going to see, as these cuts come to fruition, that maybe that's not the case. So a lot of Republican policy, ironically, hurts Republican voters first.
Absolutely.
It hits rural voters first. Because, you know, being rah, rah, yay markets, yay capitalism doesn't serve rural people well. Rural life is inefficient, and I mean that the best way possible, right? Like it's analog.
Mm-hmm.
It's, you know, everything, it's spread out. Everything's not right on top of each other. Capitalism wants, you know, everything in a tight, dense box. It's easier to deal with that way, man. Rural life, it's hard to serve because it is so vast and people are so spread out. And the market leaves rural areas out to dry first.
Absolutely. And you know, I think that my novice beginnings in politics and the fact that I really didn't know a lot about politics is what makes me an effective communicator, or people seem to be complimenting me on how I communicate through my videos and things like that on TikTok. But I think the reason is because I struggle to learn the information and I struggle to understand government and politics and the way everything works, but I also want to learn. So when I figure it out with the help of Chat GPT and talking to people who are way smarter than myself, like yourself, then I try to digest that and give it back in a much more simple way. That way it's not so over people's heads, because a lot of us, me included, once the big terms start coming out, we just kind of shut down because we don't understand it and we feel like that maybe is not for us, which I think is overall the Democratic Party does this really, they do it a lot, you know, they talk over people's heads.
I tell people, anybody who's running for office in the Democratic Party, I've sort of begun telling them in the last couple of years, when you're talking to voters, you don't want to like do an Obama impression, you know, the soaring rhetoric and the beautiful speech and hitting all the notes and just like, I mean, listen, well done.
Yeah.
I mean, amazing stuff. The man could deliver a damn good speech, but like that moment, it's not that moment now. People don't want that. They want like Stone Cold Steve Austin or The Rock. They want that speech. They want, I'm going to go out there and I'm going to whoop the bad guy, and they deserve it and they suck and you mock them, and it's professional wrestling. And I really think, if you're trying to nail down your stump speech, you don't want to like go back and rewatch Obama speeches or Kennedy speeches. You want to watch like Monday Night Raw.
I could not agree more. I like, everybody needs to channel Jasmine Crockett energy right now. And I think one positive point to our party, and maybe it's negative too, is that we can criticize our own party. I think we're sometimes too good at criticizing our own party, and we have a lot of infighting because of that. However, you know, also I think that there's an opportunity there to be able to grow. I talked to Karen Talion and I told her that, you know, we need everyone to give the Jasmine Crockett and AOC energy right now, because that's our power right now, is our voice. And if we don't use that and we don't have every single person in the party doing their most right now, we are not going to move forward. We're just not, because they're drowning us out. So everybody needs to channel that energy and be real and be raw. Yeah. Don't try to make it perfect. If anybody's out there is, even if you have the heart for politics and if you think that you have the heart to help your community, that's all the qualification you need to run for office. And if you don't believe me, look at Trump. You don't need to know. I was just
gonna say,
yeah,
like the guy's got a like 4th grade speech level, but he's very good at like getting people emotional. It's on playing people's emotion, getting them worked up, creating that us and them. Us and them politics is dangerous, but effective. And, I think because it's dangerous, Democrats don't want to play it. We want to hold hands and sing kumbaya and shit. But like, sometimes you need an enemy, and billionaires make a good enemy.
Yeah.
Everybody sees it. Everybody knows what the problem is. And when we talk to people, right? When we talk to people on a real level, like we're talking about, I think it turns out that we all kind of want the same things out of life. We all really do kind of agree on most of the big core issues. And we're made to focus on the things we disagree on, but also the critique might come from a different direction. But I think in the end, what both the left and the right are mad about is the unequalizing effects of capitalism.
Which is why we need to, first off, learn what a mixed economy looks like and stop being afraid of these trigger words. Because if anything looks like socialism or anything of the such, they go straight to that extreme when people don't realize that places, what they say, like the Netherlands has like a fantastic balance of the way that they run things. We can have capitalism, but that doesn't have to be to the extreme that it is now. There's some countries that have socialized their oil profits. And again, I might sound stupid while I'm saying this because I don't fully understand it, but I do know enough to know, I think it's China that sells their oil to benefit their country, their people in their country. They don't have a homeless problem. They used that to help everyone, not just these big oil executives.
Right.
So to me, that just is common sense. If we could all truly learn about how other countries do it and stop being afraid of other countries, like China bad. Anything China does is bad.
Yeah.
Let's take the good from them and let's implement it. And let's look at other countries and take the good and let's have a mixed economy to where it works for everyone.
Well, and like, listen, our economy is a mixed economy. It's just like way out of balance. It's
Exactly.
like,
Exactly.
it's all capitalism with a drop of, chemical X. But we really, liberals have spent the last 80 years running away from anything like socialism.
Yep.
They don't want to be associated with socialism. It's a bad word. You don't want to say it. You don't want to admit to being any kind of it. And so socialism's got a bad brand in America, even though what socialism we do have in this country, Medicare, Medicaid, Social Security, programs like that, very popular. When you talk about, do people want Medicare for all? Yeah. Very popular. Well, guess what? I mean, like when the right says, yeah, that's socialism, you could say, yeah, a little bit.
The good part. It's the good part of socialism.
Social Security is socialism. So, Medicare is socialism. Medicaid is socialism. Yeah, a little bit. And that's okay. We can have both.
Yeah.
Capitalism is like immense horsepower. It is a stampeding herd of wild horses, right? Capable of producing tremendous power. But you want to harness that power to pull for you. You don't want the horses to decide where to go. The horses will trample you.
It's a good way to to explain it. See, we need more of that. What office are you running for, sir?
I'm running for the office of guy who talks to the other candidates for office.
No, and I love what you guys do. I really do. I think that this is important work. I aspire to have the great conversations. I'm just barely tipping my toes into having, live conversations on. We had a protest in Martinsville last week against the data center. Against the data center in Martinsville, the one that they're putting in that's going to use 5 million gallons of water a day. That the folks are going to be paying for the infrastructure for the electricity in advance for them to build up the electricity structures to be able to support this huge data center that's going to employ 20 or 30 people, and there's no guarantee that they'll even be local people because they can work remote from what the type of work that will be done. So we were out there, and there wasn't a lot of us, but it was important work, and it's the first of what's going to be many. But it's conversations that are teaching me about what this looks like and how this work is done, how they get this kind of thing to pass in the dark of night, and the citizens don't get anything out of it. We're simply trying to, forward on that information so that other people can understand it and learn too. So the gentleman that arranged it, very smart kid, very, very smart. He's young. He's got a passion for growing food in a community garden. Like, he's just a young man that has a free 501c community garden, and he's just trying to help better his community. And he's really concerned that this is going to drop well water levels. So it's going to affect his garden. He says that well water is magic for gardens, and he's truly concerned. If anybody wants to look him up, it's Backyards. It's on Facebook, Backyard Farm Collective. This young man is going places. He's something else. And his name is Jonathan, I believe. But I was able to interview him, and I had been on TikTok live. And again, I don't know what I'm doing. I have 10,000 followers because of an accidental political viral video. And I follow everybody that's in Indiana and try to get them to follow me back just so we're all in the know about what's happening local. And I mic'd him up, and I looked at the camera, and I said, just to let you know, I was just giving him the heads up. Hey, we're live on TikTok, just so you know where you're talking. And we've got 55 people watching. And he was like, okay. Like, I didn't expect it either. I didn't expect there to be 55 people watching. To me, that's a ton. Yeah. I'm sure it's not to a lot of people, but to me, that's a lot of people. And he gave a fantastic speech that I'm hoping to edit and be able to clip that portion so that folks can see that there are young, energized people that are doing the work. And we just need more. We just need more of those people to show up. Just if you have the heart to serve your community, a lot of people are religious, and they want to do the outreach at churches. I know, because that was my passion. I didn't so much enjoy the church and the religion part, but I loved the outreach, so much so that I actually worked for the church for the outreach department. But if you have that kind of heart, you're meant for politics. There are low-level positions,
Yeah, Brandy, I'm going to interrupt you for just a
You're
second. Looks like we
fine.
got somebody else
joining us?
in the waiting room here. I'm going to see if this works. Darian, you there? Can you hear me? Because I cannot hear you, nor can I see you, but I see that you're here.
Darian, you may have to put your camera permission on, or your mic permission, if you can hear.
Was there a permission? I think I didn't. There he left.
Yeah, well, all right. We'll try that again. We hope we can get Darian in here. I would like to hear what they've got to say. So anyway, Brandy, I'm sorry.
No,
you
you're
were talking,
fine.
Yeah, but just having that passion to get involved. I think a lot of people right now have this anxiety. We were talking about it earlier, and Twyla fell into her Twitter hole, and you want to stay on top of things. You want to know what's going on. It's important to be aware of what's around you. But then you you get sucked into it, and it makes you anxious, and you have this nervous energy, and you feel like you need to do something, and a lot of folks don't know what to do with that energy, like where to put it.
Well, you don't put it in your house with the door shut.
Yeah, you don't put it there. That's true. That's a bad place to put it.
And if you can't walk, you can write. If you can't walk, you can call.
Absolutely.
There are people who are physically not able that I have seen at rallies so many times.
I've offered to carry chairs for folks. I make my videos advertising for the protest, and if you have a hard time getting there, I will take you. If you have a hard time walking, that's fine. I'll bring a chair for you and get you right up front so you can listen to all the speeches. And when it's time to walk, you can sit there and watch all of us walk around we just circle around the State House. So we can make accommodations for anything.
That's what I did both times. I just sat there and held I walked around the people and did the
Well, now she says live, and the thing that was on there is now gone.
Oh,
Hey, now we've definitely got somebody back on the other line. It's not who I was expecting, but that's Trish Whitcomb.
Hey, Scott. Hey.
Hello.
Say hi to everybody. Here we are in beautiful Jennings County. Great turnout.
Fantastic. All
Yes,
right. Wow,
yes.
you got a good little crowd there.
Yes, we do. And we have some stories. We have some first-person stories, and we'll share them very quickly if that's okay.
Yes, please. I would love to hear that.
All right. Thanks. Lois, say your name.
My name's Lois Keller. And 54 years ago, when we were trying to get a community hospital here in North Vernon, I was 11 years old, and I and 3 of my friends got together, and we did a little carnival in my front.
Oh, no.
Oh, we lost her sweet carnival story.
I bet it was going to be good, too, because back then we did great things.
Oh, man. That darn spotty cell coverage.
North Vernon is down there, too.
Scott, still there? Did you get
Yes, we are, Trish.
Huh?
No, we. Oh.
Sorry, somebody was calling me. Did you get Lois's story?
No,
we did not. We would hear all of her story that we heard that she was setting up a carnival in her front yard, and that's about as far as we got.
Okay, so with that carnival, my friends and I, we raised $22.65 and donated it to the hospital fund so that we could have a hospital here in North Vernon. And so I really do not want to see this hospital close.
Wow, that very hospital is the one you built with your $22 with your fair
yes.
Yay!
I hope you at least got a brick.
And you're still fighting, though. How amazing.
Still fighting for it, yes.
Okay, we have another story. Hold on a minute.
Hi, I'm Mary Austin. I work for a nonprofit in Indiana, and we have a statewide program where we help people who survived a brain injury access different resources. So naturally, and there are people who are looking to get back into being more self-sufficient and getting a job. But needless to say, a lot of people are on Medicaid, and they use their local hospitals, of course. And so it really terrifies me on what this is going to do to me emotionally, watching my clients struggle to get their benefits back.
Yeah. Oh my God. I mean, obviously those folks, they're going to be harmed, but like you got to feel helpless in that situation where, like you've spent your life and time trying to help these people, and it's like you can't help them anymore.
That's correct. And like I said, it scares me to death. And I'm hoping there'll be things to step in and fill that gap. Thank you.
Thank you. Thank you for telling your story.
Introduce yourself.
Hi, my name is Jane Cockrell, and I live in North Vernon, Indiana. I have a niece who is on a Medicaid waiver. She has multiple sclerosis, MS, and she is fully dependent on that Medicaid waiver because she is a quadriplegic at this time. She's 63. She's had MS for 10 years. She worked at Crane, which is a a military facility down in
Yeah,
southern
yeah.
Indiana. She was very productive, paid taxes, but she worries every day about her waiver services. And those are some of the services that are on the chopping block at this point. She's totally dependent on her caregivers for everything.
May I ask who cares for her? Does she have like professional help, or is it someone in
She
the family?
does. She has nursing services, and she has people who come in and clean her home and prepare her meals. She gets delivered meals from Mom's Meals, as many people do. And right now, she's going through a process where her services are going to end August the 1st, but everyone is trying to get them restarted this coming week because everything keeps changing to different insurance pockets or plans. So I'm on call to go see her next Sunday if her services end on Saturday, and she lives 2 hours from me, and I'm
Yeah.
old.
Oh,
So, but
Where does she live at?
Linton, Indiana.
How far is that from Greenwood? Any idea?
Yeah, Linton's way down there.
Hour and a
It's
Is
half,
way
it? So it'd be far
maybe.
2 hours. I was gonna say if she was closer this way, I could pick it up. And I'm
okay.
willing to do that for anybody that needs it.
Okay. She is dealing with an agency that has just, what's your agency?
I'm not in an agency. I'm just
Okay.
retired and
You're
willing to
just a
help
person.
anybody.
Yeah,
I am a
she,
person
okay,
with a big
okay,
heart.
okay,
I do have
okay,
medical background though.
okay, okay. She can't private pay. She doesn't have the money to private pay.
No, I'm just saying until something goes in, if she were
Oh, okay,
close, I would help
okay,
with food and meals and stuff.
okay, okay. Well, you get in touch with Trish and Trish can get in touch with me for my information.
Okay.
Does that sound okay?
Yep.
Okay, thank
But it
you.
doesn't seem like it's
Oh.
close, so I don't think my car would go that far.
Probably not.
maybe that's something we ought to think about organizing through the Rural Summit or, Hoosier Action or some of the coalitions that are participating in our Medicaid motorcade, because
Right.
this is a statewide issue.
Yep.
Yeah, and people are gonna fall through the cracks. I mean, that's the point of all these cuts is making people
Sure.
fall through the cracks, and they can't fit through all the hoops that you got to jump through. And
Push them to the
when
rest.
we do, yeah, we need to like build mutual aid and solidarity to help these people.
I will just take a little bit more of the podcast time, but I do want you to see some of these signs because they're very, very creative. And I think this one says so much. Can you read it? It says, God bless and preserve our rural hospitals. Trump and Braun won't. So,
Yep.
yep.
Very good.
Yeah.
Save our hospitals. And then, of course, the American flag.
Scott McCain, you're Cartersville class of 73, huh?
No, this is,
Oh,
do you know him?
Tastefully
Oh,
named
yeah.
Scott. Yes.
One big, beautiful mess. And then we have, oh, yes. When injustice becomes law, resistance becomes duty.
That's my
That
favorite.
is correct.
Yeah, oh, we should have had an applause
RPG.
meter. And then rural hospitals save lives. So thanks for giving us a chance to participate in the podcast. We've got a great bunch of people here who are highly spirited and dedicated to making sure that Indiana doesn't fall through the cracks or isn't even pushed through all the cracks. So thanks a lot, you guys.
Thank you, Trish.
Oh yeah, Salem is next.
Yeah, we will see you down in Salem. And hey, Michelle Higgs
All
is
right,
here with us.
thank
You two are going to
you.
be meeting each other soon.
Thanks, Trish.
All right, guys, take care. Bye-bye.
Hello there, Michelle.
Hey, we are here now in Davies County. And there we go, Davies County Hospital. And this is our team here. Everybody that showed up. Say hi to Who's Left. Say hi.
Oh, and
Oh.
hey, but let the parade continue
Oh,
because
here we go.
we got some people on the Winchester to Richmond caravan here with us.
Hello, hello.
Hey, y'all, who am I talking to?
Hey, what's up, y'all? Can you hear me well? Hey, what you doing?
How are you guys doing today?
Oh man, so we just wrapped up at the Shalom Center, which is the food pantry for Randolph County, and it's built right on the site with St. Vincent Ascension Randolph, the hospital. And as folks know, that's one of 16 hospitals that are on the chopping block. And so we had a great turnout of both folks from Wayne County as well as Randolph County coming together. We had about 50 people come together, and now we've got a big old caravan. Actually, we're in the front door. Hey,
that's awesome.
So we're heading back down. Yeah, we got about 20 cars. We're riding down Highway 27 and on our way to Richmond. Most of us are from Richmond, and we're going to go past Reed Hospital, and then we're going to gather at Middle Fork Reservoir. And folks are sharing stories and their concerns, and we're educating ourselves about what the impact of these cuts to Medicaid and SNAP are going to be. So it's good to be here with y'all.
Yeah,
that's awesome.
You
so
guys
we got
are
one
amazing.
motorcade going from Winchester to Richmond. We got Michelle. Michelle, where are you at again?
So we're in Davies County at the community hospital here. And here's everybody again. My phone died, so I'm using somebody else's. And we are on our way. After this, we're headed to Salem, and we're going to kind of caravan around Representative Aaron Houchin's congressional office. And then we're going to go visit the hospital there. And then but we're also having a press conference there. So everybody that's on the southern part, if they want to converge into Salem for a 4 p.m. press conference, we'd love to see you.
Whoa,
awesome.
That's great.
Yeah, we just talked to Trish in North Vernon, and she'll be seeing you down there.
Cool. So talk with you guys later. Thanks.
Thanks, Michelle, for the update. Y'all be safe. All right. Back to the road somewhere between Winchester and Richmond. So
you guys are amazing for doing this.
Hey, thank you. You guys are amazing for doing what you're doing. So I got to ask, you're going to Richmond, you're going to, excuse me, I've been like talking for 5 hours straight. But you're headed to Richmond. You're going to hear some stories from folks tell you about how these cuts will affect them. And I'm interested to check in when you guys are doing that and hear from some folks there if you'd like. But is there anybody in the car with you right now who might be affected by cuts to Medicaid or SNAP?
Yeah, go for it. Who's up?
I mean, I can tell you a little bit about my story. So, to introduce,
who are you, man?
So I'm Jimmy, right? And I'm coming from Wayne County, where Richmond is. But I was actually born in Randolph County at Ascension St. Vincent's Randolph, right where we're coming from. So I'm representing the Richmond Housing and Human Rights Coalition, and I'm also a lifelong Medicaid and SNAP recipient. But that's the hospital where I was born. Actually, my siblings were born there as well. And all of us probably know by now that these rural hospitals like St. Vincent's rely very heavily on Medicaid dollars to keep their doors open. According to the Shepp Center for Health Services Research, it's one of 16 rural hospitals in Indiana at risk of closure because of the so-called Big Beautiful Bill for billionaires. But my whole quip with this is, just how deep the rabbit hole goes. Our first impulse is to think, millions are going to get cut off of Medicaid. Millions of individuals, they're going to lose their access to potentially life-saving medications like insulin, for example. But that's only the beginning. That's very important, but the rabbit hole goes deep. If that hospital, that rural hospital in St. Vincent's Randolph shuts down, the people of Winchester will have to drive over 30 miles just to reach the nearest hospital. I spoke to a gentleman who runs a community health center in Richmond, funded almost entirely by Medicaid, 100,000 patients or so. Medicaid goes under, the funding vanishes, so does the care. There's 100,000 lives left hanging. I met a young audiologist at Reed, like a hearing doctor. She told me that without Medicaid, her patients will no longer be able to access hearing aids or essential technology that can restore their ability to connect to the world. And I mean, the last example I'll share is, and I mean, this is quite crazy if you ask me, but it just
I think
shows.
some of these folks are on from Salem, so yeah.
Oh, really? Yeah. Washington County?
Yeah,
Washington County, they're thinking of restricting ambulance services between the hours of 2 a.m. and 6 a.m. Let me say that again.
That's when we get sick.
Say again?
That's when they get sick. Elderly people between
Right.
those hours. I was an EMT. That's when it happens.
Right, and
We
you
just
get
wait until
sick
there's
during
an
that time.
ambulance.
You don't have transportation. You can't drive yourself to the hospital. What happens?
You die.
You die,
Yeah.
exactly.
Yeah.
So, you know, I've been booted off of Medicaid before for, I think, arbitrary reasons. You know, mail comes in late, and I mean, it sucked. But I'm really concerned about just the gravity and the scope of these cuts and just how many different things it affects. This hospital we just came from, there's a food pantry next to it. The hospital charges them only $1 a year to be on that property. That hospital goes under, who knows what's going to happen to the food pantry. So that's my rant. But yeah.
Sir, would you mind sharing your social or the organization that you work with again? Because you are amazing.
Yeah.
Well, thank you. Yeah, so I'm with the Richmond Housing and Human Rights Coalition, and you can find us on Facebook under that name. It's Richmond, Indiana, to be specific. Well, I mean, of course, y'all know that. And then we're also with the Nonviolent Medicaid Army chapter of Indiana. You can find them on Facebook too. Maybe, I mean, there's a chat here, right? I can maybe drop some links or something.
Oh, it looks like he just threw it up.
Yeah, I got
there we
your
go. Yeah.
looks like your website up here. Yeah.
Yes, that's our website, and you got the social media handles right up there. So we have an Instagram too, HHRC24. You can find us there as well.
Awesome. We got some other folks in the van if you want to hear from them.
Yes.
Absolutely.
Yeah. Erica, you want to talk? Yeah, go ahead and unplug it.
Hi guys, my name's Erica, and I'm one of the organizers here with the Richmond Housing and Human Rights Coalition and the Nonviolent Medicaid Army. And I myself have always received state-funded health insurance, as well as my son William here. And these cuts to Medicaid would definitely affect us. You know, I receive, you know, pretty restricted dental care right now. And, you know, just last year, my insurance wouldn't cover certain dental procedures. And I had to go into the hospital and be placed on an IV antibiotic overnight to get the infection in my teeth down. But, you know, I almost lost my life over a dental issue where my insurance wouldn't cover, and no local dentists or local providers were accepting new patients on Medicaid. And when you're in the moment in an abscess and you need emergent care, it's very hard. So, you know, these Medicaid cuts would definitely affect us. So I hope that, you know, that we're out here organizing the way that we are and raising awareness about what's going on, and more people will start to wake up and realize that maybe this big, beautiful bill isn't so beautiful at all. But thank you guys so much for letting me share, and I'll hand it off to a friend back here.
Yeah, thanks for sharing your story. Hello.
Hello, my name is Roz Jeter, and so I'm actually also a Medicaid and SNAP recipient, and so this is wonderful work we're doing, I feel, because for me, from my experience, I haven't been to a dentist in over like 5 years now because it was so hard to, there's absolutely nowhere that I can go to in my county, in Richmond, Indiana, to find a dentist that accepts Medicaid, that accepts my insurance. And a lot of them are not accepting new patients as well. So I have to, whenever I have like a dental problem, I have to kind of just bear it out. I have to kind of stick it out. So that's just one of the many problems. But this is impacting everyone, and I'm just really glad to be here. So.
Well, no, thank you for telling your story. I appreciate it. Only in America, right, is your
That's right.
mouth not part of the rest of your body? Like
That's
where
right.
it's got
Exactly.
where your teeth have to have a separate dental like insurance plan, or your eyes have to have a separate insurance plan.
Right?
You know, how that doesn't make sense. We were talking about how Republicans always go on about like efficiency and smaller government, and like if we covered things like dental care, routine checkups, like they wouldn't like your mouth is part of your body. It can get sick. It turns out it can spread to other parts of your body, right? Like
You're absolutely right, and also not to mention, when somebody lacks teeth, it can affect them socially with being able to find jobs. I know
Exactly.
that because of my dental issues, I know that I've been looked over for jobs because of the way my teeth are.
I just want to
right,
thank you
but they
guys
still
for
want you to
being
pull up by your bootstraps, right?
I just want to thank you guys for being so vulnerable and for normalizing having a social safety net, because so many folks out there aren't brave enough to speak up about it for, embarrassment or shame. When I was on Medicaid, I felt shamed, and I think that we all need to realize that everyone deserves medical care. And this is a perfect example of her teeth hurting her so badly and getting so bad that she ended up in the ER and having that hospital stay when it simply could have been fixed. And trust me, girl, I know I've got dental issues myself. I need a root canal as we speak, so I get it. And, it could have been prevented.
Yeah.
And instead, it's a big bill that, that she had to endure. And it's not fair.
Yeah, no, it's not a very efficient way of doing things, right? Like
It's not efficient at all.
Yeah, it's ridiculous.
And I don't know if anybody knows this or not, but usually if you have dental problems and you're on Medicaid and you have an emergent situation, they typically only offer to pull the tooth anyway. And even if you go to an urgent 24-hour dentist, I think the last time I checked, it was like $250, and that was without the pain medicine, and they would pull your tooth. I mean, there really was no other treatment like that. It's take it or leave it.
I can offer something as far as dental. IU, downtown Indianapolis has, and I know some of you are farther away, but they have the dental school, and they're I can't even say very reasonable. Sometimes they're below reasonable.
Yeah.
For people that have issues, and you can go there. You will be treated by a student, but not one until they're close to being done. And it's all overseen by actual instructors and dentists. I've got my dentist actually graduated from there, and he gave me a lot of information in case I wanted cheaper dental care now.
Oh, we lost him.
Oh, sorry there.
There
I
they
lost
are.
you guys for a second. Anyway, so when are you guys due to roll into Richmond?
Yeah, we're about. They've been asking.
Are we there
Folks in
yet?
Richmond are wondering too. Now we're going to get there in about 15 minutes. We're going through Fountain City, Indiana, which if you've never been there, it's a great underground railroad history. Great struggles here at the Levi Coffin House. And today folks are fighting to be free too. And so but we're going to get to Richmond in about 15. And we'll hear some more testimony from folks there in Richmond. I got to say, just like it's really important folks come out and there's a group I used to work with that said movements begin with the telling of untold stories.
That's right.
And there's a lot of untold suffering. There's a lot of abandonment in our communities going on, and so we got to lift that up. But I also want to say that it's not enough for us just to talk about the plight. We really got to get organized, friends. Like the folks who are profiting off of this system, they don't care. Like if we crawl in a hole and die. I mean, that's the attitude. Whether you're in a rural area or you're in the city, across color lines, like they don't care. And so we need to start building bases and organizing with our communities, and work on that. And so I really appreciate folks, taking action today, and this is a step in terms of starting to identify and develop the leaderships in our communities, and really centering the voices of those who are catching hell first, right? So I appreciate y'all lifting up the voices of the folks that are out here today.
Yeah, you make such a good point. Like, these cuts are happening. People are going to fall through the cracks. We were just talking to Trish Whitcomb down in North Vernon about this sort of thing. Like, so like while we're fighting this, we also have to simultaneously be trying to catch people that fall, and building solidarity and building like mutual aid, so that we can help the people that are falling through while we're working on either repairing it, or maybe even better, like building something newer and better.
Absolutely. And I mean, the group, the Nonviolent Medicaid Army, I'm a co-coordinator here in the state for the chapter here in Indiana, but we've got chapters in different states around the country, and some really strong organization in places like Pennsylvania, and Vermont, and Maryland, and other places. But one of the things that we always say, and Jim, just to reiterate, Jimmy said it earlier, is just like, nobody's coming to save us. Y'all, the sooner we, as poor and dispossessed and working class people, understand that nobody's coming to save us, the better off we're going to be, and to come realize that. And so we have to start to build organization and figure out how to bring folks together. The other thing about this too is we got to tell the truth about this. I mean, we're organizing in East Central Indiana, and this is largely rural. And I'll tell you, I mean, folks voted a certain kind of way. I think it's important for us to also be truthful, though, that like if you're centering it around the needs of those who are being thrown away and dispossessed, right? Like, problems did not start this year. It didn't start with this Congress. It didn't start with this president. In fact, it was a bipartisan agreement in 2023 to do the unwinding and kick people off. So I think it's important for us to organize here in communities like this, that we need to really fight for, the real political independence of folks, and figure out how to unite across these ways that we're kept pitted against each other. So that's perspective. Yeah.
Absolutely. And listen, I'm gonna hand you guys off to Brandy here for a second, who unfortunately we can't see on the camera, but she's there doing a great job, making some excellent points here today. But I'm gonna let you guys talk for a minute, because I've been sitting on my butt here for the last 6 hours.
I'm
gonna get up and stretch and use the restroom, and I will be back shortly. Thank you guys so much.
All right. Hey, I just appreciate what you guys are doing, sincerely. I've been encouraging people to get involved, because doom scrolling and, taking all of the information in and trying to process it without having an outlet for us to do something about it. Like, we know this caravan's not going to fix it. I know that when I go protest, it's not going to fix it. I know that this live is not going to fix it. But all of these things combined, the movement that we're all making, because I bet you that most of you guys weren't involved 5 years ago like this, because I sure as hell wasn't. You know what I mean?
Yeah.
If people could just find whatever organization topic that they're passionate about, whether it's working for the school board, maybe running for a school board position, or being a chair, a county chair, which I just learned what that was like 6 months ago. But It's not that difficult. If you have the heart and the passion, you can figure out the rest, because guess what? Donald Trump has showed us that it doesn't take a smart person to be a politician.
I know that's right.
You know what I mean? Like, if he can do it, are you kidding me? We just need people like us, real people that have real speak, to take over our political positions and get these people that have been doing it for 100 years out of office, and take our party back, and really start to work on things that we can agree on first. Like he was saying, I'm sorry, I don't know I can't remember your name, the driver. You were saying we need to find things that we agree on, and there are a lot of things that we can really agree on and start to move forward on. And then I think that will give us more solidarity and more democracy, and kind of figure out how we can fix our society, because people are not happy. They're not healthy. Right. Nobody's clamoring to move to America anymore from other countries. Like, we're not it, we need to fix it.
Yeah, I'm largely sympathetic to something you mentioned, like just the tendency and urge to just doom scroll away and, just sit back while all these things happen. But, I mean, this is actually quite a momentous opportunity. Like, some of these contradictions, like John was saying, that have been the case for a really, really long time, maybe since this the foundation of this country. Those contradictions are easier to see now more than ever. That we're being put under people's heels, while what would be going to healthcare is going to fund tax cuts for billionaires. These things have been the case in war, and foreign wars, and genocide.
Amen to that.
These things have been the case for a really long time, but now more than ever, we're seeing it today with this coordinated action is an opportunity to build that unity across the division. We're told to hate our neighbors, say our neighbors was the cause of everything. Really? I mean, come on now. Is our neighbors who's booting us off of our health care and leaving us to the wolves? No, they're not.
Exactly.
Right.
Exactly. Well, we were talking about, Scott brought up earlier, where the fraud is really happening in Medicaid, Medicare, both, is the folks that are billing, the providers that are billing us, the insurance companies that are billing. That's where your fraud happens. It's not Tommy down the street or Sarah down the way that's, their extra healthcare checkup is breaking the system. It's the doctor's office that overbills and does shady stuff and orders tests that don't need to be ordered. We need to start, like you said, it's not the right versus the left. It's the top versus the bottom. Like, we need to unite and get moving together in the same direction. And I think you're right. I think that this has given us an opportunity to get fired up, and for everyday average people that don't think that they're capable, or they don't think that they're smart enough, or they don't think that whatever, insert whatever, are finally making moves.
All right, y'all, we're pulling up now. That's really great. I agree with you 100%. We're pulling up now to our next destination, and we'll check back in with you in a little bit. Is that okay?
That sounds great. Thanks for being with us here today. Thanks for joining us from the road. We get to have a little Indiana road trip with you without even getting up off our butts here today. So we will talk to you guys here again shortly.
All right,
keep on keeping on.
That was
all
awesome.
right, man. It's great to get to talk to those guys and their little caravan out in Richmond. Man, they had a good turnout too. It sounds like they had 20 cars just for their little thing there.
That's amazing. I am so inspired by seeing people that look like me, that sound like me, that are actually involved and doing the work. Which, I think some people would say, well, what is this caravan going to do? And like I was telling them when you stepped away, we know it's not going to fix it, but we also know that protests aren't going to fix it. And we know that campaigning isn't going to, but all these things together they can fix it. If everything's happening together in unison, it actually can. It can fix it.
I think a lot of people are getting radicalized right now in their own way, and we really do have an opportunity to build something better. And I remember back in 2016. I'm gonna admit to having a moment. Okay, so bear with me. So I was a angry young man. I wasn't that young, but at the way the Democratic primary went down, and I was a big Bernie Sanders supporter.
Yeah.
I don't. You hear people say it was rigged. No, I mean it wasn't rigged. The rules were the rules from the beginning. But we came up short, and I really thought for a moment there, God, we really need big change in this country. Hillary Clinton doesn't represent big change.
Right.
So, boy, should I vote for Trump to accelerate the collapse so we can, get to building something better?
I've heard
And
that.
I did not vote for that, man. I voted for Hillary. I held my nose and, did the thing you're supposed to do there. Vote for the lesser of two evils. I mean, I do believe in harm reduction, and a Hillary Clinton presidency would have been a hell lot better than Trump won. So,
yeah.
But it's kind of happening without our choice. It's the collapse is happening now, whether we wanted it to or not. And I'm a contractor. I like to do things the right way. I like if you're gonna build something, if you're and transition to the new thing, you want to have like safe steps, a plan for getting from one place to the other place. I like a controlled demolition versus just chaos, right? And so this is not how I would have chosen to transition out of our old, stale, desperately need an update system of government. But it's happening whether we want it to or not.
Yeah. Maybe we could get behind a message of literally, maybe our party needs to be behind the message of Build Back Better. And let's just start working. First of all, we should have started campaigning the day after he won the presidency. And I see a lot of folks that are out there hitting the streets campaigning, starting their work already. But man, we've got a big job ahead of us, Scott.
It really is monstrous. We've all been brought up in this culture of American exceptionalism. It's kind of culty in a way if you think of it. I like the way I left for a little bit, and now I came back and I'm on screen. It's sort of like green screening the wrong way.
The light shifted or something.
I'm gonna have to take care of that here at some point in a second. But like, when, if I may ask, Brandy, how old are you?
I just turned 46 on the 21st.
Okay, bet. We're the same age. When did you first get a computer in your house?
I was 17.
Okay, right. So again, about the same time I did. I think I was 18, so this would have been like 1997, maybe, for me. And what operating system was the whole world using in 1997? Windows 95, right?
Oh yeah, yeah, gosh.
You learned how to use a computer on Windows 95, like probably the whole friggin' world did, right?
Mm-hmm.
And so like it was fine for its day, but you couldn't run anything today on one of those machines. And I feel like the U.S. Constitution and our system of government is like the Windows 95 operating system of liberal democracy.
Oh my gosh, that's such a great comparison.
Like that operating system has needed a lot of updates since, and the way they wrote the operating system, they made it really hard to update. Like, it is incredibly difficult to amend our Constitution. I mean,
and now we have a virus.
Yes. Well, yeah. Well, yeah.
If we're using analogies, it's kind of like we have something that's in the system.
We do. It is. Well, it's just like that white supremacy bug that was always in there, and it just, under the right conditions, it grows out of hand, and you gotta. Yep. So we need to think about what a new operating system would look like. Is this one updatable? You had the big update after the Civil War, right? You got you got 3 amendments. That's like it's like the Windows Millennium Edition of democracy, right? But still, not adequate for today. We've had the 14th Amendment, 13th, 14th, 15th Amendment, major upgrade. 14th Amendment, especially, fixed a major bug in the system. But boy, we've only had a couple minor patches since then, right?
Yeah, we are way overdue, like way overdue. And I think this idea of the Democrats, and again, criticizing my own side here, but of playing it safe and just doing barely what needs to be done instead of doing something radical and trying to change the system, I think has kind of kept us where we're at,
Oh, for sure. We've, on one hand, you don't want to overpromise and underdeliver. And like with anything, any of the big popular programs that we need to implement in this country, the things that are more socialist, right? It's going to take getting over a lot of the anti-democratic hurdles in the system that we have, so they are almost impossible to get done. So, from that perspective, Democrats are like, well, look, I don't want to say we're going to do Medicare for all, because it's going to be friggin' impossible to do Medicare for all. It won't get, we can't get it passed. But like, okay, so Donald Trump claims to be a great negotiator, right?
Yep, he claims.
Okay.
90 deals in 90 days, sir. 90 deals in 90 days.
I'm no Donald Trump. I'm no great negotiator. But you don't start your negotiation from the middle. You don't say, well, we can't do Medicare for all, so we're not going to try. Like, that's not inspiring. You start your negotiations from Medicare for all, and maybe you can get half of it. If you start with half of it, you're going to get Obamacare, which again, nice patch.
Yeah.
Nice patch. Helped clean up a lot of viruses, but inadequate for
Even if we could try preventative care for all, just your doctor's appointments, your checkups. What if we tried preventative care for everyone? Maybe that would keep the extreme costs of insurance for private and public down a little bit. Maybe that could be a compromise, an experiment, if you will, to see if that would, I mean, like you said, there are ways to start moving forward without doing the whole thing.
Yeah, absolutely. I'll tell you what, Brandy, expound upon that for a moment. I'm going to reload myself here.
Okay, sure. No, I think that we really need to consider what we all agree on and start moving on that topic and stop fighting about what we already know we're never going to agree on. Because if this has done nothing, it's shown us that the arguing against the left and the right pushes people further to the left and further to the right. And it's certainly not bringing us closer together. So I'm sure we've grabbed some people from the middle that are now kind of like, whoa, this is not what I thought it was going to be. And maybe that side's not for me. And I think with this Epstein thing, I keep thinking there's going to be something. There's going to be that thing that shifts a portion of the red hats over. And maybe this is that thing. I don't want to get too hopeful, but.
Well, I feel the same way, but I don't know if anything happens like that. It's kind of like you want just like one big thing. You want to rip the Band-Aid off, but I feel like, it's going to be a slow trickle. He's losing a supporter here. He's losing a supporter there. This right-wing influencer is talking bad about him. That right-wing influencer is talking bad about him. And maybe it'll be like drip, 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 and then all at once.
He's making it easier day by day for us. I mean, he's definitely proven some points and helping us with the efforts to try to change some folks. So I appreciate his work that he's put in with that. It's
a real own goal on their part. I mean, but listen, they stoked those stories. They and the thing about the conspiracy, snake, you let it out of the bag and it's going to come back around and bite you at some point.
You're right. They're the ones that were screaming that, why isn't Biden more transparent and why isn't he releasing all of this information? But the thing I'm concerned about, like specifically with the whole Epstein thing is, unfortunately, a lot of people are busy working and they just don't have the time to be as dedicated and as obsessed with politics as a lot of us are or have become. And the thing with releasing, what is it that they're talking about releasing now? It's
some like grand jury testimony or something, but then
it was a very narrowly done situation where they left everything else out and just really narrowly focused on Maxwell or whatever her name is, Ghislaine.
Oh yeah, Ghislaine. Yeah,
pretty much just focused on her and Epstein. So they know that that's a very narrow focused investigation. So if they release that, it's going to be fine because nothing else is in it. So it's like that. But a lot of people don't understand that. They think that if they release that, that's going to answer everything. Nobody else is in it.
But a lot of his diehards are really invested in this story, and yeah, boy, anything. Yeah, I worry that they're going to manufacture something, or I mean, listen, her Trump's personal attorney at one point, Todd Blanche, who is now some deputy in the DOJ, just spent 2 days talking to Ghislaine Maxwell and offering her God knows what.
Well, she was queen for a day.
What kind of story? You know,
They give her that sweetheart deal, the queen for a day thing, where you can just say whatever you want and nothing is going to be held against you during those conversations. That's what was reported yesterday. So she was granted immunity on anything she said over the last 2 days. So I don't think that she's going to have anything else to offer to the story. And certainly it looks suspicious that this whole thing is even taking place. Like, why are they there? You know, why are they there?
Yeah.
She knows where all the bodies are buried.
Yes, she does.
You know,
Yeah, I mean, she was an active partner in that enterprise there that they had.
And she's going to walk free. And that's the party of family values, because we all know the pardon's coming. It's already being cooked up. And by God, if any other Democrat had done this and pardoned somebody that's that evil, they would lose their minds.
Oh yeah, well they've lost their minds over a lot less.
Like a tan suit, yeah, that's happening.
Man, don't you miss the tan suit days?
I do.
When that was like
I
the
miss those.
worst outrage one could manufacture.
Oh, I do.
The halcyon days of, like, I don't know, what was it, like 2014 or something? I mean,
seems like a lifetime ago.
It does, but yet, like, I think a lot of Democrats fall into this trap of reminiscing and getting wistful and, like, our own, like, blue MAGA. Oh, well, like, America was great when Obama was president. Let's go back to that. No, man, we still had our problems. Like, this whole system was still teetering on the brink, and Obama was in there, you know, holding it together with duct tape and pretty words. And that time still gave us Trump. If things were great, Trump would not have followed. Could not have followed. And that's why, we really need to kind of rethink a fundamental system and build something new, such that a demagogue cannot come through again and do these sort of things.
I often wonder if the culture around us being raised to never talk about politics, you never talked about religion and politics, I wonder how much of that contributed to where we're at now. Because had we all been having these conversations and been engaged more, would we have ended up in the same spot? You know what I mean?
If we the little people aren't talking about religion and politics, then the only people talking about religion and politics are the powerful, and I think they very much would like it that way.
It works for them for sure.
Yeah, it absolutely does. Well, you know, you hear some people say, "Oh, I'm not that into politics." You know, you get that sometimes.
Mm-hmm.
Well, whether or not you're into politics is really into you.
Yeah.
And so, you know, you've got a stake in it.
I don't even know how to respond to people like that. I struggle, you know. I don't know. Like Twyla was talking, some of her friends her daughter, like, gets overwhelmed. I can't. My daughter does the same thing. My 26-year-old, she's very liberal and very smart, but she's like, Mom, I just can't handle this right now. And she works in the medical field, and she's going to see a lot of these cuts, a lot of these, you know, Medicaid situations that are going to affect people that are walking, because she works at a med check. She's a x-ray tech.
Yeah.
And, you know, if you've got a broken bone and you can't afford the x-ray for it, what does that look like for people?
It looks like we're going back to the days when, you know, you broke your leg and you had to work through it because, you know, hunger was the other option.
And that's just not sustainable, you know, because, like I was saying earlier, literally a broken leg can cost you everything. If we're off work for a month, there goes our house, there goes our car. And then what? And now they're criminalizing being homeless. Know where that takes us.
Yeah, it's...
I have no idea what my phone is doing.
No, that was me. I hit the wrong button. I'm sorry.
No, you're fine.
But geez. So Democrats, I think we sort of touched on this, need to hit on having a positive vision and talking about what kind of future we want to build, and offering something aspirational. Like, yeah, talk bad about the bad guy because he deserves it, but also, you have to give people something to work for, something to a positive to inspire them as well.
Hey, I'm all for
Especially
playing dirty. At this point, I say we get some folks that maybe run as Republicans that maybe are a little more left of the Republican. Like, what are we going to do? We're going to have, there's a lot of, especially down south here, there's a lot of positions that go totally unopposed.
I mean, there's a potential lane for that. For example, you'll hear the right complain about woke corporations and global capitalism and stuff sometimes. Like, okay, I can work with that. I can criticize the corporations. I'll even criticize them for their wokeness because it was performative and they never really meant it.
Yeah. Seriously, at this point, we need to really strategize. I mean, I told Karen Talion in the town hall, like, they've radicalized their side. We need to do the same to our side. Whatever that looks like, I don't know. I don't know what that looks like, but we need to figure that out.
We already are. And a lot of their people, a lot of the Red Hats, I think, are radicalized in the same way we are, but they think that is the right outlet for it when it is, it is not. That is
yeah,
sheep being led to slaughter. But the system as it was, right, cannot keep on going the same way it was. And they are burn it all down. Let's get on with this new thing. And, some of them want a really dark version of a new thing, but I think a lot of these people are just like, man, everybody's corrupt. Let's get everybody out of there, and maybe things will be better again. Because a lot of folks don't pay attention to everything every day, and it's just vibes, and it's this guy's going to come in and smash some stuff up, and things need smashed up. I mean, yeah, kinda. We talked about that, like. And yeah, they're okay with blowing things up, and they have a dark vision that they're going to want to burn or to build on top of the ashes. I don't think all the people that voted for him are down for that. They just wanted to shake things up.
I think a lot of them are just uninformed because we've been trained to not talk about it. So they weren't brought up in a culture where we talk about it a lot. Schools didn't. I went to a public school, so a lot of us kids were struggling with our home lives. I went to IPS. I mean, it was as public as you get. A lot of us kids had working parents at home. In my case, I didn't really even have a parent at home, but our parents had other issues, and they weren't worried about, what we were doing at school, what we were doing after school. And so I just feel like we were all raised in a culture where we didn't really, there was nobody to show us how to pay attention to politics, let alone be involved. I certainly never seen any role models involved in any of it. And so we just kind of thought that was, and we still have that same mentality that somebody else can do it because they're smarter, they're more capable, they have more money. And I mean, look at the young man that's in New York right now. He is
Mandani, yeah.
Yeah, Mandani is making waves, man. And he's making waves because he's bringing actual problems to the table with solutions. Heaven forbid there be that, I mean,
right. And
it
yeah,
sounds
the
good.
establishment criticizes, oh, that's impossible. Well, you don't know that unless you try. And I think people just want somebody that's going to try and fight for them and try and do something new. And I think when a lot of normie Democrats and, the the two Republicans that are still left in the world who, like, you know, are pro-democracy.
I can work with them. I can work with an
Yeah.
actual Republican all day. That's I can
Oh, I
find
do.
common ground.
And yeah, we get some come by the show sometimes, and it's frankly a much more interesting panel discussion that I host when we've got a Republican in there. You know, it gets you to see things from a different perspective a bit. I disagree almost all the time, but it's good to have those conversations. You know, it's not good to have conversation with somebody who's going to, like, lie to your face and gaslight you about it the whole time.
Sure. I find it like a whole psychological study that needs to be done on what's happening. Like, this is going to be in the history books forever. The change that happened and how it happened, and hopefully how we can reverse it. Hopefully how we, like you said, build from the ashes. I'm hoping that that's there.
Yeah, well, I mean, okay, I'm going to switch metaphors. We're going from the computer operating system to a house now. So,
Okay.
you know, I a couple years ago did a big job down in Mitchell, underneath a house. Okay, had a bunch of standing water in the crawl space for a long time. The house sits in a floodplain. Water got up high under there. Like, you know, a lot of the joists were rotten underneath the house. The center beam was rotting. You know, those aren't good things, and if left untouched, the house will collapse eventually.
Right.
So, you know, we had to go down there and get all the water out and all that stuff. But it was the first time I really understood, you know, spending several months in this crawl space as I did to really see, you know, the underneath of a house and how things are all held together. And this house that is America is built on a foundation of white supremacy. And a lot of people are uncomfortable with that. We all should be uncomfortable with that, but some people don't know how to deal with that discomfort, and the lie is more comfortable. But in order to, so what we had to do in this house, we had to build a temporary beam so we could push the house up with hydraulic jacks.
Yeah.
And lift it up off of the old beam and build a whole new one and then set it back down. And we cannot continue to live in a house built on a foundation of white supremacy.
And what's crazy, what's crazy though is if you tell me something like that the house has all these problems and that, you know, it's going to take all this to fix it, I think it's impossible. That sounds impossible to me. So I think our key is to find people like you that know how to work with that, to tell us that it's not impossible and here's the steps we need to take to start, you know.
Right. But you know, things are very precarious in this way. Had another job out toward Poland, which is off of 46 West, going toward like Brazil and Clay City and whatnot, sort of that way, orienting you in the part of the state you're at. And this guy, very 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 well to do, was building his dream house out there on a chunk of land. Stables next to it for their horses and stuff, big garage for big trucks and all their equipment and whatnot. Well, like the house wasn't even done yet, and the foundation started collapsing. And so we had to go in there and lift this house And this was, a house with a full basement. So we're basically putting the whole thing up on stilts, standing 12 feet off the foundation or whatever. It was pretty good and high down there at the bottom, and so we had to lift the whole house up, and then they knocked the old foundation down. So you literally had a house up on sticks there for a while they poured the new foundation. Then we had to gradually set the house down back on top of it. Things are really precarious when you have a house on sticks. And that's the dangerous part, right? Like, how do we transition from the broken foundation to a new foundation built on something solid? Probably, hopefully something more equal and human, right? You have to be very deliberate, because otherwise you're dealing with, the right wing narrative as well. Set it all on fire.
Yeah.
Submit a fraudulent insurance claim, and then start over again.
When the house could have been saved, right?
And it could have been saved, and they eventually finished, I hope, and got their dream house after sorting out some lawsuits with the original contractor. But
I just wonder how many people how many casualties, and in casualties I truly mean human lives, how many human beings are not going to be able to get to the hospital in time over something minor. My son has allergies. He has food allergies. Thank God he hasn't ever had a reaction where I've had to use an EpiPen, but I have one. And God forbid something happen and I not have a hospital close enough to go to, or, my mom needs to go. We're all one accident away from losing somebody. And it's making it's so inflamed right now because it doesn't have to be this way. How many people are going to lose their lives over political chaos that didn't need to,
Yeah. Well, I don't know if you were here earlier when I was talking about it, but I'm a big modern monetary theory guy, and the federal government can't run out of money. I mean, we are the source of our own spending money. Where does money come from? States can't do that. States are forced to commit to a budget. So we all very much rely on the federal government to provide a lot of support for all the states. They want to shout states' rights and
states' rights, brother.
Yeah, right. All that stuff. But that artificially constrains us. The federal government can run a deficit, and in fact, oftentimes should run a deficit. And the purpose of taxation isn't so much to we raise money so that we can buy things. That's not how it actually works. The government creates money out of thin air. They don't need to collect money to spend it. They spend money and then collect it. They
right
back toward themselves through taxation, right? So what our problem is, a lot of times your libertarian folks will complain about printing money and too much money in the system. It's not that there's too much money in the system. It's that it's all stuck in one place. The billionaire class has all the money and aren't investing. They're just hoarding it, and it's not going back through the system.
There's no trickle down to anything, is there?
No. You ever have a little water fountain in your garden, or even a miniature one in your house?
My neighbor does. He has one in his front yard.
So you know how they work, right? They got a little pump.
Yeah.
And the pump, sits down there in the bottom of the water, and it sucks water in, and then pushes it back up to the top where it gets distributed back down. They shower it back down. I don't know if it's sprinkles or it's a babbling brook, but anyway, the point is it gets back to the bottom.
Yeah.
So, well, there's something stuck in our pump, or our pump is stuck. It's sucking and sucking, and the water isn't getting through to the government that can then distribute it back down to the people where it gets just sucked back up. It's going to get wind up passing into the billionaires' hands again. The people are going to get it. They're going to spend it immediately. They're going to spend it at local businesses. They're going to spend it on purchasing appliances and stuff, and driving things through demand. This is how an economy works best, is people having money to spend.
Yeah, that's what it takes to have the economy keep going,
it can't
right?
work. It can't work if the people at the bottom don't have money to spend. There is no economy. There's just six rich dudes with all of the money.
Exactly. And you've got, how many billions that just expect that they're going to become that rich dude tomorrow, or maybe next week, or maybe next year, and then they'll be part of the club.
Oh, I forget who it was that said, a country of temporarily humiliated millionaires, right?
Yeah.
I don't know if that was a Mark Twain or a P.T. Barnum or something. It's one of those guys. It's always one of those guys.
Absolutely. I don't understand how people think that they're ever going to be, even people who make a lot of money are never going to be closer to the top than they are to us. You know what I mean?
I saw a good meme. It was every one of us is 3 months away from being homeless.
A lot of us are
none
less.
of us are 3 months away from being a billionaire, right?
Right.
We have a hard time comprehending the scale of some of these folks' wealth. The difference between a millionaire and a billionaire is ridiculous. Now, say you had a good job, work your whole life, have some savings, you retire, you got a couple $1 million to last you till the end, right? Did good, investments, right? Portfolio, 401k, right? Yeah. Okay, great. So if you count us 1 second, and if you take a second to count every number and you count up to 1 million, it'll take you something like, I don't know, 2 weeks.
Oh my gosh.
It might be 13 days or something, right?
Yeah.
Okay. So 1 million seconds is 13 days, 2 weeks. I act like I'm not sitting right in front of a computer here.
Hey, I'm still trying to figure out this whole setup, so I get it. It's
okay. Not even. It's 11 days. It's 11 days and a half. 11 and a half days, right?
That's for $1 million?
That's for $1 million. So okay. 2 million would be 23 days, right?
Okay.
That's how long it would take to count to 2 million. $1 billion is 33 years.
You are absolutely right. So many of us do not comprehend. We cannot wrap our brains around, because I heard a meme like that too, and it shocked me. I have no concept, and most people don't, because why would we? It's not real. It's not real life to us.
Right. I mean, this is a legitimate, long-standing part of the human condition, is that we it's a bias that we all have. I had Dr. Emil Torres on the podcast, maybe a couple months ago, maybe 6 weeks, and he's a moral philosopher. It was telling me all about the transhumanism and the long-termism, the Silicon Valley kind of billionaire eugenics worldview, and these people have galaxy brain, and but they can talk this way because like most people just can't comprehend.
Yeah, see, that was tough for me. I was just like trying to figure out, you know what I mean? And I think a lot of people tend to just check out instead of, like you said, using the supercomputer that's in our pocket and looking something up and then finding out that maybe it's not that complicated. It's just a big word for usually a shitty thing, you know?
Once you get to a lot, it's like, oh, okay, that's too much. I can't comprehend it anymore.
Yeah.
And so he was explaining that this, like the Silicon Valley philosophy, that he calls it TESCREAL, which stands for like transhumanism, extropianism, like colonize the stars bullshit, right? So the way they justify this worldview is, okay, well, listen, there's people on Earth now, right? And we want to alleviate human suffering, right? Well, but like theoretically, like a long time from now, there's going to be trillions of humans. And so we have to figure out a way to populate, we have to figure out what way to get off the planet, which is dying, and upload our consciousness into AI and send it forth throughout the universe.
That
So
sounds
mankind
terrifying.
can survive. Right. Yeah. Right. Okay. Look, it's all gobbledygook. But the point is, they can say, like, listen, we would be doing the most good for humanity by like ensuring the survival of humanity into the stars trillions of years from now. And so we need all the money and resources on Earth so we can build rocket ships and shit and AI, right? That's what it all comes down to. It's a really elaborate justification for why like they should have all the resources and
because
their children should populate the stars while like we leave real people suffering now. Because look, that's just a few billion people now. Think of the trillions of people in the stars, man.
Because we're doing such a great job here, we're ready to send people off to other places to do, like, maybe we should get it right here first, I mean, call me crazy. Maybe we should stop trying to send, rockets out into space. I'm talking like Elon Musk projects, and let's focus on, I don't know, world hunger. I mean,
exactly.
If they're thinking that big, then if they have enough money to sit around and philosophically ask all of these questions, because, not many of us working people have a whole lot of time to really get that deep into it. But maybe we should focus on here first before we go and start killing off other places. If that was even possible, because my brain won't even think like that.
Yeah.
But
well, I mean, that's their justification for why they should rule right here, right now, and kind of decide who gets resources or whatnot. I mean, they're just going to eugenics all of us pores so they can populate the stars, right?
Aren't there places now where they're actually trying this philosophy out, like here in not, I don't even think it's necessarily the United States, it's other countries. Haven't Americans tried to do, I know you know what I'm talking about, I can't think of the...
Well, it's like the network state sort of idea. I know like your Peter Thiel kind of billionaire, Curtis Yarvin, these guys like
Scary,
want to...
yeah.
It's
exactly what I was talking about. I knew you knew what I was talking about. I'm not smart enough to recall it that easily, but I have the idea in my head from listening to different podcasts and kind of learning about their mentality and kind of what they're talking about doing, and it's terrifying.
They basically want to eliminate nation states as a concept, and like honestly, nation states are kind of a problematic concept, especially like when you get into ethno-nationalism.
Yeah.
I mean,
Yeah.
look no further than like the Middle East right now and see some of the inherent problems of nation states. But, you know, they do serve certain purposes and provide frameworks for people to exercise democracy within them. These guys are not fans of democracy, so they want things to be people can be citizens of like digital communities, and
Yeah.
really it's like you're just picking your fiefdom, and you know, like you're mining Bitcoin for Mark Zuckerberg all day or something, and that's like
It's
I don't know
crazy.
what people do in that city. I really think like Roblox is kind of going to turn into real life if
That's
that network
terrifying.
state goes through. It's like we'll all just be like twiddling our thumbs, and, you know, earning or mining cryptocurrency, which is real currency at that point.
It's a scam currency. I mean, it's a good way to pay off somebody. Like, I don't know, the president, to be able to, you know, get him to do things for your country. I think that's kind of a shady aspect of it.
Yeah. Well, it's even shadier if, like, you know, these folks, again, a lot of these folks overlap with the same. Well, you got your weirdo libertarian billionaire types, right? Well, they come from a long line of weirdo, like insanely wealthy billionaire types, going back to, like, you know, the 1900s and the Gilded Age, and, you know, the people who revolted over the New Deal and are still upset that the United States went off the gold standard, right? And they want to get back to that because, you know, these people own the thing. They will have control of the money supply. And
Convenient.
so they want to, some of these folks are probably really intent on collapsing the dollar as the world's reserve currency, and making whatever their shitty meme coin is into the actual currency of the world. I wish I was joking.
I've had plenty of people that have absolutely shared that viewpoint, that is, it seems like that may be what our government is doing, because, you know, anytime that there's a big boom, a big bust, there's a big boom, you know, the people that have the capital. And I wish I knew of an easier way to talk about this so that people could truly understand and grasp it. I've listened to people way smarter than me that have explained it to a way that I understand, but I have a really hard time, you know, saying it to where it makes sense. But I know back in the housing collapse, I had just built a brand new CP Morgan house, and we were literally, we hadn't moved in, but 9/11 happened and we were about to move in right after that. And I remember being terrified because everything was so up in the air. I know in our situation, they had moved us in on, a lot of us, on ARM rates, the adjustable loans, where you would move in at 1%. They sold it to us. Like, luckily we didn't, we were smart enough not to do that, but they were like, well, you know, this year you'll be fine paying this, and then next year you'll get a raise, and the year after that you'll get a raise, and it'll be fine. It'll make sense. You know, we moved in with no down payment because we had the down payment assistance for first time home buyer. So a lot of people got moved in on that ARM. And then we had built on land, you know, the housing addition. So our house wasn't, it wasn't taxed appropriately because they were still just taxing the tiny lot and not the house.
Oh,
and I knew that was going to happen. So I was one of the smarter ones. I thought, well, I'm ahead of the game because I prepared. So I made sure that we were paying property taxes in advance, because it took them 2.5, 3 years before they got out to assess the property. And then they assessed it for what they assessed it for. And then suddenly you owed 3 years worth of property taxes, like now. And we were not prepared. It was like a $2,500 bill. And that was 20 years ago. That's a lot of money.
Yeah. Yes.
we seen people just drop like flies in our neighborhood because that adjustable rate had hit right at the same time that the property taxes hit. And people don't realize that private equity, people with a lot of money, a lot of cash on hand, bought up those houses and sat on them and waited until the value went back up and waited until the economy went back up and people were in the business of buying again. And then they made a ton of money off of people suffering. People got foreclosed on. And then guess what? Once you're foreclosed on, you can't buy a house again. You're stuck being a renter. And guess who's there ready to rent to you? The same folks
people
that,
bought your house.
Yeah.
Came in and scooped it up.
Dark, dirty, game. And you say, oh, well, that was just, they were smart with their money and they had it on hand. No, this is the game. This is what's always happened. They're okay with the fall of the market because they have capital and they're okay. They have cash in the bank. We don't,
Yeah. Think of it like they're okay. Like we're all in this big car, right? In the market, right? And it's gonna crash. But the billionaires, they are like super padded, buckled in, surrounded by airbags. Like they have protection for the crash, and will survive the crash and can pick up all the pieces that come jarred loose from everybody else.
Yep.
Because they survive and no one else does.
Yep. It's a good way of explaining it. And people don't realize, why, like people like me are like, why aren't people panicking more? And it's because we're stuck in the same cycle. There's nothing we can do different. A lot of us don't have a lot of capital in the bank. We have to go to work tomorrow. There's really no option. I think it's pretty impressive that a ton of us have just become part-time activists. It's sad that this is what it took, but I mean, this is like being an activist can be very passive. You can just show up to a few things here and there, or it can be like a whole part-time job or a whole other full-time job, depending on how involved you get, And I think that that's amazing that people have dedicated so much time and so many resources, just energy, to pushing back. I think that's a hopeful story in all of this to me, is that I've met so many amazing people that are totally brave enough to speak their mind and put themselves out there in front of the train that's coming down the tracks, that have kind of you're bracing everybody else for what's coming. I don't know.
No, you're absolutely right, and I guess in a long-winded way, that's sort of what I was driving at, telling my like Bernie Sanders, Hillary Clinton story, and talking about houses on sticks and things collapsing because we are in that moment where things are gonna crash, and we have an opportunity to rebuild the right way. And I almost thought we had Richmond back on the line. I think they're going to be back soon, though.
Yeah, because they have a press conference at 4, don't they?
I believe they have something at 4, and Salem has something at 4. So yeah, thanks for scheduling those at the same time, guys. We appreciate it. But so I guess, what kind of system would you like to see us build when we get out of this? What do we need to do to prevent a demagogue like Trump coming through again? What's the foundation for this new society that we're going to build if we're lifting the house up off the white supremacy foundation? Or, well, I guess it's too late to lift it off of it. That house is collapsing, I guess. What kind of foundation are we building our new house on?
I think like Michelle Higgs comes to mind because she's always saying, where are the guardrails? Like whatever we do next, where are the guardrails to make sure that we don't fall off too. We have a margin of error that we can operate within before you go too far left or too far right, or we just need to figure out what that looks like before we start something and get hasty with it and it ends up being crap. Like, we don't want a CP Morgan house. We want a custom built, we want something that's done properly. And I think the first step is getting the right people in politics, like the right people in office that have the heart and the moral foundation to make those decisions, and folks that aren't too full of themselves to source the right people that have those answers. Like, if we're talking about healthcare, let's get the people in there that work with the system every single day. I'm not talking about the healthcare executives. I'm talking about the people that work with patients, that work with billing. Let's get those people in and let's figure out because they have lots of ideas. I mean, they do it every day. They have lots of suggestions. And then let's work backwards. Right. We wish that we could have this. Okay, well, let's work backwards and see what that looks like. Get the right experts in the right spot. It's not impossible. We're just choosing to not do it because it looks too hard.
Yeah, well, we choose not to do certain things because they're not profitable, right? I think we have to build on a foundation of care, going forward like that. We need to build a care economy. We can't build our society on white supremacy, and we can't build our economy on exploitation, upon environmental degradation. And so I don't know what it looks like, but we've got so many people in this country. We desperately need childcare. We desperately need elder care. We talked about this earlier. Like, these are the things we actually need, but those aren't profitable to the market. It's more profitable for the market to, leave people hanging. And we wind up with this patchwork system where there's not enough childcare and not enough elder care. And we got people sitting in offices saying no, right? Coming back to that.
Well, I mean, just what comes to mind. Sorry, I didn't mean to interrupt you.
What
comes to mind immediately is thinking about all of these athletes that make so much money. Okay. And yes, we need sports. It's a big morale. It's a big outlet. It's a big, it's something that relieves us and takes us out of our, Monday through Friday work grind. So it's an asset. We need that entertainment, but we need childcare more. We need to respect teachers more. There are states that actually pay teachers and treat them like the professionals that they actually are. I think, is it Minnesota that does it? That they actually pay the teachers really well, and it's improved outcomes drastically. Because if you're only paying, I've worked in childcare, if you're only paying minimum wage, you're not going to get the best of the best as far as employees. I mean, sure, you're going to get some people that have the heart of gold and they're willing to, live in basic poverty to be able to do what they love to do. But it shouldn't be like that. It should be more balanced. Oh, I can't hear you.
There we go. Better.
Okay.
Sorry about that. So I had brought up modern monetary theory, and in conjunction with the care economy, I think it's really important to have a federal jobs guarantee, right? And the jobs that would be there for people, when you need a job, would be things that we need as a society. Things like childcare and elder care, and just the various things around your community, beautification, climate resilience, stuff like that. And those would be good paying jobs, and the market would have to compete with that, instead of the pitiful middle wage excuse me, the pitiful minimum wage that we have now. That was a tongue twister.
It's crazy. It's insane.
And that would spur, number one, it'd be putting good money in people's pockets. Unemployment would cease to exist. You want a job. There's your job. The job's guaranteed. Here's what we need in our town right now. Right. Pass a background check. You can play like Candyland with a kid. I mean, seriously, right?
Mm-hmm.
But like we need more human connection and more human, a more human economy. And right now it's dependent almost entirely on exploitation.
Absolutely.
And what's happening, I think, is people in our country are beginning to feel, especially like when all these Medicaid cuts, which is the reason we're here today, when these cuts start to hit, we're gonna feel the exploitation that until now that happened over there. That happened in the other countries, right? That happened in Chinese sweatshops. That happened in Bangladesh, where they're making your clothes, or someplace where they're screwing your iPhone together, or kids working diamond mines in Africa, coffee and cocoa and every other goddamn thing in our economy that we like completely depend on. A lot of it is built on exploitation.
Absolutely.
Been out of sight, just out of sight, like, it's there.
Choose not to think about it.
But you can look away from it. You can, choose not to focus on it. It's over there in the periphery. Well, these cuts hit, that pain starts to hit. It's not in the periphery anymore. It's there. It's all around us. And, we've sort of see it slowly take hold, over the last several decades from the rural areas and the underinvested urban areas first, and then, spreading out from there.
There was somebody in Trump's regime that said, and I wish I had recalled that I could tell you who it was, but who made a statement that basically equated having more people have work requirements on Medicaid, that they could balance out the farmers in the field, and they could balance out, like, somehow those people would take the jobs of immigrants. Like, it would work out because they're making people get off their butts that are sitting around on Medicaid. So they're going to be forced to go out there and take the jobs that the immigrants left. They're not going to have a choice.
Yeah. And they'll find that those people just aren't there. Yeah.
Sounds a little slave laborish too. It's like, I see your plan.
Well, then, you have that concern. Like, what are they going to do with these people in these detention centers? That they're rounding up on farms. They're rounding up at Home Depots. They're rounding up at 7-Elevens and stuff. They're taking them to these camps. What are they going to do with them? You worry that they're going to like sell them back to where they worked before for pennies on the dollar and pocket the difference for themselves, right?
Yeah.
It really becomes a slave labor economy. I mean, boy, here's a loophole you could drive a truck through with the 13th Amendment, right? When they said, all right, listen, no more slavery unless
you're incarcerated.
For a crime.
Yeah.
And then slavery is okay. And they're going to say, look, they're illegal. They're in the country illegal. That's a crime. It's not. It's a civil offense.
Right.
But, they're criminals. Therefore, we can legally enslave them. Constitution says so. Originalism.
They've already desensitized people enough that enough people are okay with that. They've spent the last several years desensitizing people to think that brown people aren't equal, aren't worthy, aren't, capable, and they're illegal, On stolen land, it's ironic, but
Yeah. White people were the original illegal immigrants in this country. And, well, you know what? Well, you start letting them in, They take over the place eventually, right?
I don't know where they learned that lesson from.
Yeah. You know what? You make a good point. A lot of this is all projection, right? Like the worst people are like, well, listen, we have to build giant walls and exploit these people because if we didn't do it, they'd do it to us. Like, no, you're just a psychopath and you're projecting your own psychopathy on everybody else.
That's definitely everything that Trump accuses everybody else of. It turns out a couple months later, he's, there's news in the newspaper that he's actually the one doing it. Or not too long after, there's people coming forward that says, no, that's actually you. Like how they were saying that the Democrats were pedophiles and, all of these crazy things. And it turns out maybe that was the wrong accusation to place on the wrong person.
Oh man, you know what? After all this time, they hit the old Trump with "I'm rubber, you're glue."
Yeah. Yep. Every accusation is a confession. With this current administration, I just hope that people start to really, really feel these cuts. And they start to really wake up and say, wait a minute, this is starting to get a little scary and a little uncomfortable. And maybe I should just start looking into things. Because, here in Indiana, I was looking this up. 39% of children make up the Medicaid coverage here in Indiana.
Yeah. This
is according to ChatGPT. So I know they're not always super accurate, but they're typically really close in the ballpark. There's stats that 17% are seniors, 65 and older, or individuals with disabilities. Well, guess what? It's really hard for those folks to go out and get a job. Like our friend Twyla was talking about, it's really difficult to work when you can't stand for long and you can't sit for long. It's when you get older and you put your body through hell because this, like you said, this economy, this country has forced us to work our lives away to the point where we're broken down when we get older from not taking care of ourselves. Because guess what? We didn't really have great health care. So we certainly didn't get the checkups and the health care that we needed along the way. So of course we're going to be broken down when we get older. And then our government expects them to somehow figure it out. Like, what?
And man, I want to come back to the efficiency thing.
Yeah, no,
because again, it's for the people who go on and on and on about waste, fraud, and abuse and how government's bloated and inefficient. They design the most inefficient system possible. And our health system is it, right? Like you would focus on preventative care. You'd want to make sure people do that all the time and make it as easy as possible and free as possible for people to go get their checkups and stuff. So you don't have to deal with all the expensive crap on the back end.
Yeah.
But it's what's efficient versus what's profitable. And it's profitable for our system for people to forgo care and like not take care of themselves. We talked about RFK earlier and his disgusting thoughts about autism.
I might have missed part of that, but yeah, he's scary.
But like he's got like this appeal because there's a kernel of truth in the things he says about like our food and drug systems,
which we all agree with.
But yeah, because they are very much not run for human health; they're run for profit. But without changing that incentive in all sectors, can we do anything? And he's just offering fluff and pseudoscience, not any actual solutions. Like I don't see any dietitians in there. It's just like, listen, Big Macs and ivermectin for everybody.
It's a perfect example of where we could take a first step that I think all parties could agree that yes, like dyes in food. Yes, we all agree that that's not necessary and it's dangerous. Let's start there, but instead they're going to, crazy steps like making lists of people with autism. Like, why do we need to do that?
Yeah, right. And there is such that in, you look at a guy like Kennedy, his appeal was on like the wacko, like crunchy, new age left, right?
Yeah.
But
Absolutely.
wound up flipping around and being a MAGA guy because of the dissatisfaction with the center, with the big capitalist glob that actually runs things. And so like that's why he has appeal both to the left and the right, because we see the problems with the system and the way things are run. But when you're a guy like this and you come flip around on the other end, you're in bed with the people who are like pumping all of the environmental toxins into the air. Like this guy is in the same administration talking about making America healthy again. That's like repealing a shit ton of environmental regulations. Like, how's that good for people? If you take dye out of foods, but you put like benzene in the air, I don't know. I think
poison the water. Yeah. You're taking regulations away so that companies can make more money quickly without going through the proper checks and the proper, there's a reason. It's just like, I'm going to dumb it down real quick, but let's take all of the warning tags off of everything. You know what I mean?
Yeah.
Like, they're there for a reason. Somebody did that and got hurt, So maybe we should just look at that a little closer. He could do good. RFK could do good in this area if he did something that everybody agreed with, if there was actual science behind, and he took a step. They did do something, and I haven't looked into it, and I wanted to, and it just kind of spaced my brain until just now. But he and Dr. Oz, I believe, which is still bizarre. It's still super bizarre, but they did something to where a bunch of the healthcare companies came on board voluntarily, but it kind of felt like they were kind of threatening them, and maybe that's why they came on board.
I mean, that is how the Trump administration does business, like a mob boss. Yeah.
It felt very like I listened to the press conference, and it felt very unsaid but said in the press conference that they were having. I have a small residential cleaning business, and I always have my earbud in, and I'm always listening to whatever latest politics or news or whatever in my ear instead of music while I clean now. And so
I hear that HoosLeft guy has a good podcast. You should check it out.
I knew exactly who you were. I've been on Sarah's show before. So yeah, I knew all about you guys. But yeah, I watch things like this constantly so that I can learn. And so I was listening to that thing live, and they were bringing on insurance companies to voluntarily quit some of the, stop some of the what is it? Prior approval. What am I saying?
Prior authorization.
Prior authorization. Yeah. Thank you. On some things. So I'm like, I don't know. Like, I feel like what's motivating that? I'm like, what's behind the curtain? Because it sounds great. It sounds reasonable, because it is a pain in the butt. And it takes up a lot of people's time, especially the medical staff. It takes up a ton of their time trying to do paperwork and get a hold of people. And in some cases, it can be life-threatening if you need something in the middle of surgery and you can't get the prior authorization while the patient's on the table. So it sounds great. I need to look into it more. But if that's true, things like that would be for the good of everyone. So let's keep doing that.
Yeah. Listen, if we get any good, I'll take it where we can get it, and hopefully that's something. But inevitably, it's funny you bring up Dr. Oz, and just really a lot of the folks in this Trump administration who really are completely unqualified for their jobs, but they're playing a role, right? And you had mentioned earlier talking about, having experts in their right places. And I agree with that. But at the top of these agencies and stuff, or even on top of tickets, I think one thing Trump understands is that the figurehead,
Yep.
right? The explainer, the communicator part is what's important there. Like, I mean, like, listen, yeah, you want a guy like Anthony Fauci as your head of, like, the CDC, the Centers for Disease Control, infectious medicine, all that stuff, right? Okay. You want a really smart doctor. Sometimes really smart doctors aren't the best communicators, right? And it turns out a lot of times politicians, maybe they're effective communicators, but they're not so good at governing. And I think the left needs to sort of appreciate this. And you don't always need like the smartest, nerdiest person for all these jobs. You need the most effective communicator who's going to put the right people in place, like you said.
Absolutely.
And Trump has figureheads, people who look good on TV, who are slick, who can communicate their twisted message to their base about what they're doing. We need good communicators, I think, up and down, and like let the policy wonks like work behind the scenes. They don't need to be our candidates.
Absolutely. And it needs to be somebody that has very common language, just like Trump, like very, like, I think that they have analyzed his way of speaking and put it through, different AI programs and learned that it's not very high education. And we need to make sure that we're not talking over people's heads and that, like you said, let the professionals work in the background, but find somebody that can convey what successes we are having, because we have done a crappy job at doing that. Because, like the Chips and Science Act, that's really hard to understand if you don't do a deep dive and really, look into it. What does that really mean? We should have had the better messaging on that. And now Trump has taken credit for, the jobs that it's bringing. And it's like, what?
Yeah, whatever of it they didn't kill off.
Right.
Here's a question along those lines. I've heard some people suggest that like Jon Stewart should run for president, and I'll tell you, not a fan of the celebrity presidents we've had so far.
Right.
In my lifetime, Reagan, Trump.
Yeah.
Not fan. But if we're doing this thing, and I think America is right on that wavelength. I don't think there's been anybody more effective at communicating like a left message than him. Like when he's talking to somebody like Bernie Sanders or Lena Khan, like, yes, this, and he can explain things in a way that makes sense to people in common language, with a well-placed expletive. Which I think maybe necessary at this point anymore.
Yeah, absolutely.
And
I'm not against it at all. I think it's somebody that looks familiar that people can kind of trust. I mean, if they're gonna do this and this is gonna be their MO and it's working for them, then we need to beat them at their own game and find somebody that's like that. If not him, somebody that's like that can take that role. And I don't think it's a terrible idea.
He's got, obviously the stage presence of an entertainer like Trump does. He's charismatic and captivating. You got to have that. Like that's first things first. Like you can't. You can be the best candidate in the world and have no personality and still lose, right, Al Gore? But right, John Kerry.
And he's a white male. He's got that going for him.
Yeah. But, he gets the thing that we were talking about, like making it a wrestling promo. You sort of have to be over the top. Comedians have been the best truth tellers of this era.
Absolutely.
Far more accurately than like the regular news, certainly more accurate than cable news. And it's sad in a way that that we have to get our truth from jokes now. And hey, look at that. That's Sarah Blessing.
Hey.
Hey,
how are
there's
you
Sarah
guys?
Blessing on the live stream. How are you, Sarah?
I'm good. I have two parties today. One party for my husband. That's where I'm at right now with our friends. And then in a couple hours, I'll be at the Harrison County pool party for the Harrison County Democrats at 6:30. So I thought I'd stop in here and there when I get a chance. How's it going?
So good to see you. We've had a lot of good conversation. I'm glad that Brandy has been here hanging out with me today. Because let me tell you, I could
thank
not
you.
be carrying this thing on my
No.
own.
How long
I
have you been
struggle
doing
with that.
this?
I
How long
struggle
is
with that part.
Is this 7 hours? Is this true?
I have
This
been
live
on for
hours?
7 hours. Yeah.
Yeah.
Do you
Let me tell
do
you.
you want
I
to
haven't
take
been
a
on that
break
long.
while I talk? I'll talk to Brandy if you want a break.
It's not a bad idea.
Honestly, I took a potty break a little bit ago, like so.
So you're okay?
I'm okay there, but like my voice is shot, so I would appreciate you just talking for a while.
Keep go
an
get
eye
a
out.
like warm drink with honey or
Yeah,
something, and I'll talk to Brandy if you want.
Just keep
I'm
an
proud
eye
of
out.
you.
Chamomile
Just keep
tea.
an eye out to see if they go on the if they have the
Chamomile
press
tea
conference
with honey. Put honey in it, Scott, and make it nice and hot and sip it. Okay, Brandy, girl. Okay, so explain to me. I'm going to tell you what I think is happening today based on the little bouts of communication I've read, and you tell me what I'm missing. So, Indiana Rules Summit, Michelle Higgs and Scott Aaron Rogers, HoosLeft, motorcade for Medicaid. And it's a group of people going to rural hospitals in District 9 to spread awareness of what just happened with this big, beautiful bill that was passed that Erin Houchin, our congresswoman from District 9, also said yes to, and that it might end up closing these rural hospitals, including the one in my county, in Harrison County. Is that what's going on? What am I missing?
No, I think you pretty much nailed it. This is in coordination with Indiana Rural Summit and Organizing Indiana. It's a partnership with Hoosier Action for Families First Day of Action, which is a whole mouthful. But yeah, we've had some really good conversations with some folks that have been on the route, because there was 2 starting points and they converged and kind of came together and did the motorcade. I don't have my camera on because I've had technical issues all day. So
oh, that
this
stinks.
is the
I want to
best
see
I
a
could
beautiful
do.
face, girl.
This is the best I could do. But yeah, we've had some good conversations with some folks on the way. We've heard some good stories about, I haven't been here as long as Scott has, bless his heart. But I've talked about you a couple times today, but it's all been good.
Oh, thanks. You can always talk about me great if it's good. Yeah.
Aw,
Okay.
great.
So I did an episode with Tim Peck, who is running against Erin Houchin for Congress, District 9. He's running as a Democrat. He's also one of my closest friends, and he's my co-founder at Project Next. And we did a show where last Monday, where's Dr. Tim show on Project Next, y'all can watch it, where we discussed this bill. So if you want to know the truth without political spin, what is this bill going to do to your lives? Go back and watch that episode on podcasts, Project Next, YouTube, Facebook, Instagram. And then I've also been doing a lot of little short clips about it that you might have seen on your social media feeds. But I'm going to sum up what Tim taught me, Brandy, and let me know if it makes sense or if I'm being clear or not, because he teaches me a lot of stuff because I don't know. So he actually reads the bill, reads the law, reads lawyers' interpretation of it. He spends hours researching, and he summed it up, because the big question is, why is it going to close rural hospitals, right? It's like, okay, we're hearing that this is probably going to close, and it has to do with Medicaid and rural hospitals. So a lot of rural hospitals in Indiana get their money to stay open from Medicaid. A lot of the people that come into their ER, that go in through their doors of the hospital, are on Medicaid, and Medicaid pays the hospital bills, or most of it. And this bill that just was passed is going to make it harder for people to be on Medicaid in several ways. There's some type of work requirement. You got to work like like 20 hours a week, 80 hours a month to stay on it. That's one section. Another section is you're going to have to register in December for Medicaid instead of January. And most people that sign up every year for Medicaid remember to do it in January, and they're going to have to know that it's in December, which I am not hearing the
I've not
right
heard
shout
that.
that out. Yeah,
I've
so
not
I'm not
heard that
hearing
at
people
all.
say that. Okay, so that's one change.
Okay,
And then
I'm
the
gonna write
work
that one
requirement, that's
down.
the second change. And then the third change is you're going to have to sign up for Medicaid twice a year instead of once. So you're going to have to sign up for it in December. And then I guess 6 months after that would be my guess, but I don't know for sure. And then these changes are not going to happen until after the next election, after the
Absolutely.
November 26th election. So people are going to start to forget about this. And then slowly these hospitals are going to close because less people are on Medicaid. And when they go to the hospital, there's a law that says you have to serve them. You have to try to save their lives or whatever. And then nobody's paying the bill. They can't afford the $100,000 ER bill or whatever it's going to be. And so then the hospitals have to suck up that thing. And there's only so many times the hospitals can pay for that. So less Medicaid, fewer people on Medicaid. When they go to the hospital for emergencies, they can't afford it. And it's going to cause hospitals, especially rural hospitals, to close. And I reached out to the people in Harrison County Hospital, and I'm going to try to talk with them because my goal, what I want to do is to try to save our hospital in Harrison County. And I was thinking a way to do that would be a campaign where you let everybody know that comes to that hospital that if they have Medicaid, they need to sign up in December and not January, and the website of how to sign up. Like, I think that would be one thing. Then fewer people would be confused, and then tell them that they have to sign up twice, like when they're going to have to do it again. So like an education thing might save it. But you know what I've realized? If the hospital CEOs, if the hospital people running it are not getting this information, they think their hospital's okay, and they're not going to help people stay on Medicaid. So it's really the community's job to get a hold of the local hospitals and make sure they're aware. Because I don't think all of the hospital people that run, all the CEOs and stuff that run it, know. And you would think they would know, but like, you didn't know this stuff that Tim told me. I didn't know it until Tim told me,
Well, and we're
so we
super
got
engaged too. We got to remember that we're not the average, you know what I mean? Like, we're kind of obsessed with politics in the current news.
Yes.
Not a lot of people are, especially the working poor. They're usually too busy working and struggling because they're poor. It's difficult. Everyday situations and everyday life is a lot harder for somebody that doesn't have the extra money to, take goes flat, or like there's so many things that are a lot different. The only other thing I would add to that is that for people that don't get Medicaid who are going to the hospital are now going to be, that burden of those extra bills is going to be offset by us folks that pay private insurance. Those folks are going to be charged more to cover the shortfall of what the hospital's not making. So say, Johnny comes in for $100,000 surgery. Well, now they're stuck with that. The hospital's stuck with that debt. So they're going to charge everybody else for that surgery a little bit more to cover for that. So it's going to raise prices all across the board.
Oh,
yeah,
hey
and it's
guys,
so much
check it
more,
out.
Hey, it's so much more red tape and paperwork, which supposedly the right is against. They want more businesses running because businesses are better than government, but they're making more government, more paperwork, more expenses, cutting from people who really need it. So it doesn't seem to be the conservative, smart way to run a business. It seems to be a way to hurt people that need Medicaid, that need medical care. And the other point Tim was making is it's
Sarah,
cheaper.
I'm sorry to interrupt you.
Sorry, you can interrupt me.
We got a couple people also here waiting again. I wanted to check in here. I think we got Michelle Higgs in Salem. Michelle, you there?
Oh, yay!
It's probably the press conference.
This is
And then, hey, I got another friend over here I haven't met yet. Logan, hey, how are you?
Hey, I haven't met Logan either. We're just Facebook friends. Hey, Logan.
I was actually going to do what Michelle Higgs did. I was informed to tell you how to get to the event? I know there was some confusion. And, are you wanting to join in? Okay, yeah, you can join
just
in.
got here.
Okay, yeah. So, yeah, I think Michelle Higgs has got it. This is awesome. So.
Oh yeah, we talked about that
I'm gonna
earlier.
leave.
All right.
I'm gonna leave, and I'll join back on in a couple hours. Okay.
All right.
Bye, you
Thank you,
guys.
Sarah.
Logan, I'll need to talk to you sometime and meet you.
Okay.
Nice to see you.
Yep.
Thanks,
Yep.
you guys. Bye.
All right.
All right. Well, we just got here from Sullivan, so the gang's all here.
All right. I think we've got. Oh, I've got 2 Michelle Higgs streams. I think that one is a Frozen. All right.
Hey, Scott, I'm going to go outside if that's all right.
Absolutely.
Okay. See you in a bit.
All right. We will see you back again here shortly. All right. So, Michelle, can you hear me?
Yes, I can hear you.
All right. You are in. Say, hey, that's Thomas Horrocks. Hey, bud.
Who am I talking to?
You were talking to Scott. Let me turn
Scott.
it around here, and then you can see. Da, 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 There we go. There we go.
Hey, there we are.
Hey, Scott, how are you?
Doing good. Thomas, good to see you.
Good to see you too.
Hey, thank you for getting on down there to Salem and marching with these folks. I know that's a little bit of a trip for you. Were you on the motorcade with everybody?
I'm having trouble hearing you, Scott, but we got a good crowd out here making lots of noise. People ready to stand up for Medicaid. So I'm sure you're doing good things, but I can't hear you very well.
All right, thanks, Thomas.
So I will let you get back to your other things, but just wanted to say we made it all the way to Salem.
Well, hey,
and got a crowd here and people honking, so it's great.
Can we stay with you there a little bit?
So,
I'd like to hear from some of the folks there.
Anybody want to talk to Scott Aaron Rogers and HoosLeft while you're here?
I'm here because I'm a home health aide. My lady is scared to lose her Medicaid too.
Yeah.
So hands off of Medicaid.
Right. Thank you. That is such an important job, such important work there.
Maria, do you want to say why you're here?
People to stay in their homes.
I have a lot of disabled friends, and Medicaid saved my life in a hard time. And I would literally probably be dead without it. So everyone deserves basic human rights.
Right. Do you want to share why you're here?
Amen to that.
I'm here because I have Medicare, which makes my son have Medicaid, who is also on the autism spectrum. So his life is being attacked from multiple directions just for being who he is. As well, my mother's life is in danger if she loses her Medicaid because she wouldn't be able to have her medicines or any of the procedures she needs to stay alive.
The same for my best friend.
Yes.
I'm here because I was a case manager in an ER and back in the days before Obamacare, and the big lie then was that people had access to care because the hospitals couldn't turn them away because there was a law in place that they had to at least screen them and treat them for emergency if they're in active labor. They couldn't turn them away. Couldn't even ask about insurance. So that was the big lie. Oh, there's so many uninsured, but they can have care. Well, that wasn't true because we would send them away with prescriptions or you need to follow up with this doctor or that doctor. Well, they didn't have insurance. They didn't have medication coverage. So then what would happen is they had to get bad enough that when they presented to the hospital, they were dying. They were critical. They needed emergency surgery, and then the hospitals would have to accept them. That is not health care. And so I was in the front lines trying to help people get follow-up care. It was very hard. I ended up leaving that job eventually because I felt like I was swimming upstream, a fish swimming upstream. I volunteered for a free clinic, which that would fill in the gaps there. There were free clinics here and there. There was a really good one in my hometown, or my town where I lived. I volunteered every Saturday. I was there to see the day when we didn't need that free clinic anymore because Obamacare went through in spite of the efforts to sabotage it at the time by the Republicans. Yeah. And I can't hear you either because there's so many excited people about this. But anyway, I saw the day when the free clinic wasn't needed anymore. And I don't want to go back to that time. I was up close and personal trying to work with these people that were uninsured and not taken care of and allowed to just try to make it one day at a time.
Hey,
Thank
oh,
you.
I just okay. Oh, and then a couple more people here.
Yeah, please.
Logan, why are you here?
Hey, I know that guy. I see that guy.
All right, we're all meeting up here. Okay, I'll let you go, Scott.
Yeah. Hey, Michelle, when does the press conference start? You hear me? Well, I think we lost.
Oh no.
Well, we lost Michelle down there in Salem. I wonder what's going on with the Richmond folks. We haven't heard from them in a while.
No, we haven't.
But that what is good turnout down there in Salem. I wonder how the rest of the caravans did down there, all meeting up. I know we talked to Trish earlier. She was in North Vernon, and they were converging on Salem. And then there was another group coming from I want to say like Boonville and then Corridon, and that was coming up to Salem. And they're all sort of getting together. We had a couple failed attempts to get some people from elsewhere in the state in, where we just couldn't make the connection work. Had folks up in Northwest Indiana. They there have been not just these this motorcade in southern Indiana today. We also talked to folks out in Terre Haute earlier. And, I talked to somebody up in Maryville, the Northwest Indiana Interfaith Action, and the SEIU up there.
Yeah.
We're doing an event together, and we couldn't quite make the connection work, but they had some rain. So they weren't able to march to the hospital there, but held a rally at their own place in a press conference. I'm interested to see how that went up there. We did have our folks from Richmond in the car with us telling their stories, and that was super neat. Get to be on the road with them, accompany them on their road trip.
I love to hear these stories and put actual faces with actual stories, so that that these people are real. They're not just a number. That they're actual people's lives at risk. Just one simple fall from an elderly person who doesn't have a caretaker to help them go to the restroom. I don't know if you know the statistics from an elderly person dying from a hip fracture, but it is astronomical because they typically just don't have the opportunity to recover. Their body just doesn't heal, and it just causes everything else to kind of go down pretty quickly. So, when you think about access to caregivers, and that's huge to these elderly folks.
Yeah, and listen, a lot of folks have family that step in and help cover that gap, take on that extra caregiver role. And I mean, that's great. And, we should do that where we can, but not everybody can. Not everybody has family. Not everybody that does can keep up with that workload. And even if you can't, like, sometimes you just need a break. It is a lot to bear, and everybody deserves that help. If you don't have family, you still deserve to be taken care of, right? Because you're a person, because you're a human, and you have value, right? That's the pro-life thing to do. One would think.
Amen. Well, you know, and a lot of folks, like in my situation with my grandmother, when I happened to be pregnant with my son at the time, and she really needed a higher level of care at the moment. My mom kind of sort of helped, but she wasn't super dependable. And unfortunately, you know, you don't really have a choice. Like, you got to show up. But SOCOA, I'm sure a lot of folks have probably heard of it, and a lot of folks haven't. SOCOA is an agency that helps provide both caretakers in the home. So like, you know, your respiratory therapists that do home visits, your just regular nurses that come in and do home visits, your PTs, all of that. But they also have a branch that offers to pay a family member to help caregive. And of course, some people are going to roll their eyes and say, well, your family, you should just do it anyway. Well, of course you should. And you're probably going to anyway, just like I was doing. But when you're a full-time caregiver, you can't exactly work. So
Right.
SOCOA offers a supplemental income for one family member that caregives for the patient to help lighten their load, and it just makes more sense. You know, it enables the caregiver to be home with the loved one. And trust me, nobody's making bank off of this. I think what I was paid monthly was $500 ish, give or take a few dollars, which
Right.
certainly
Not enough to live on.
No, not at all. But it's enough to help with gas money. It's enough to help with a little bit of groceries. You know, you have to have a spouse or something else going on to be able to make it, obviously. But that is also funded by Medicaid. You know, Medicare will cover part of it too, but it just depends on what coverage you have. And so things like that, it's a solution to a problem. And so it just is something that makes sense. And it's something that we should all get behind. We should get behind things that actually help people and that actually are worth the investment. Because if you can keep that person out of the hospital, that $500 a month you're paying to that loved one is a hell of a lot cheaper than housing someone in a skilled nursing facility. Because let me tell you, it's outrageous.
Yeah. Yes. Yeah. Absolutely. Absolutely. Again, back to the efficiency. It's like, oh well, you know, we don't want to give people free things. It's like, no, actually, this government is getting a well below market rate caregiver. Like,
Yeah.
instead of paying a professional to do it.
Exactly. We need to start thinking of things in a more rational, common sense way instead of the knee-jerk reaction to think that everybody who's receiving anything from the government is somehow abusing or lazy, or you know what I mean? It's our knee-jerk reaction to be like, well, you should be working. You should be, instead of sleeping at night, maybe you should be working and then caregiving during the day. It's like, what?
Yeah. Sleep. Who needs it, right?
Who needs it? Yeah.
Yeah, boy. You know, no, it's funny that, I mean, none of it's funny. Just the way we have set up this system and the way so many folks defend it as like the pinnacle. Like
The
this is
gold
like
standard.
this is the best. Like, we've got the best healthcare. Like, yeah, we may have the most innovation, I guess, maybe like at the high end. Okay, perhaps, but like, what good is that to us who can't afford it, or if it sends us to bankruptcy if we use it? You know, if we can squeeze a couple more months out of our miserable lives and then leave our family with hundreds of thousands of dollars in bills. It's ludicrous. It's ludicrous, and it's just such a drain on the system and all of the resources that we could be putting into things, taking care of people. We just
Well,
we dump things into band-aids, you know.
But we don't want to be. We want to be careful not to become Canada, Scott, because you know they have the longest wait times for any sort of doctor's appointment. We come in second, so we don't want to be first. You know.
Yeah.
People don't realize when they say that we are literally second in line behind Canada, and at least they're getting their health care and they can actually go and get the help.
Yeah, like I've people use that one on me. I've heard it before. Like, oh yeah, universal healthcare. Yeah, try getting a doctor. You're gonna die waiting in line. Like, that's what we have now. We have
Right.
that now. You have to wait 6 months to see a primary care provider now.
Yep.
You know, you want to see a specialist? I mean, like, my God, they're taking appointments for next year at this point. Like,
They highlighted.
that's now. That's with capitalism, that and it's not serving us well.
Yeah, those folks that were in the car that we spoke with, you know, they were highlighting a really good fact about a lot of providers don't accept Medicaid because they actually, I actually go to one doctor who doesn't accept Medicaid. And he said, it's not that I don't accept Medicaid, it's that Medicaid doesn't accept me. And it's such a billing issue. It's such a fight to get the approvals for things and to negotiate prices for things that a lot of doctors just don't want to deal with it. It's just easier to not. And this is private doctors, so don't get it confused with hospitals, because hospitals is a completely different story. You know, it would be, I think taking away Medicaid is kind of, for hospitals, it's kind of like having a marketing company and Google is one of your clients, and Google decides that they're pulling back and they're not going to use your marketing firm anymore. That's going to kill your business. I'm sure Google was a huge portion of your marketing funds that came in. It's kind of, it feels like that to me. You're taking away their biggest clients. So what are they going to be left with? They're going to have to consolidate, which means close hospitals and consolidate people.
We, you know, all of this, we're talking about these hospitals potentially shutting down, right? And it's not because they're doing a bad job. It's not because, hey, there's Richmond again. Hey, welcome back.
You.
Hey, y'all. Do that. There you go. What's good, y'all?
How'd things go there?
Man, it's one of those things where it's starting to disperse now, but we had a really great turnout. It was probably another about 50 folks again down here in Richmond. But
wow,
we had our rallies and our speechifying. We'll get our stuff together in the future here and maybe have folks broadcast the testimonies.
Hey, listen, we're all figuring this out as we go. I've never done anything like this before. Growing pains, but I'm just glad we've had a chance to hear some folks tell their stories and, you know, allow them to share those with folks. And that's been the highlight of the day for me. You know, like real people telling their stories of how these things affect them. Because that's what this is really all about.
Yeah, that's right. We had some real powerful testimony here. I mean, it being the anniversary of the passage of the ADA, and you know, I was really particularly proud of our folks, the way we laid out, just kind of the hidden ways that, or on one hand, folks, to the extent anybody knows anything about like the work requirements stuff and the recertification issues, like, and that gets pushed out like it's common sense or it's reasonable or whatever. And so, like, I think we did a really good job today as a community, sort of dig into some of that, of actually like this, of how that's going to lead to the churn, how that's going to lead to just like an complete, you know, bureaucratic nightmare. And we actually had a guy show up here, and he actually deals with Medicaid cases from a legal, you know, he's a lawyer. But he was telling us about how just like absolute, you know, the already existing infrastructure for like dealing with recertifications and documents, you know, whatever, are, you know, as we all know, is a mess. And so, you know, he hears cases all the time that are already, you know, show how dysfunctional the system is. And they have he said this, and we know this true. FSSA has no plans really to actually, like, you know, implement this. So I don't know if that makes sense. That was a big takeaway.
Oh, yeah, no, they're totally swamped at FSSA. I mean, like every other state agency in Indiana, they took a 5% cut. So basically, it sounds like they're getting their workload doubled with less resources. Am I reading that right?
That's a pretty good way to put it.
Yeah, I think so. And their workload gets doubled, and they don't have the people to do all that. So what happens? They give money to private contractors to start doing all of that paperwork and bureaucracy. So this money that's being taken from what could be healthcare for people, and now is being given to these private contractors. I mean, it's churn. It's kicking people off. It's taking money that could be providing care for people and putting it in the hands of private interests. I mean, like part of my whole stick with this is like, what for? Like, why? Because we talked about how these work requirements, the waste, fraud, and abuse they're predicated on is complete and utter nonsense. But I mean, once you read between the lines and see where that money is going, it's clear.
That's the why.
Yeah. The work requirements are the waste, right? I mean, that's
precise. That makes sense,
no.
Precise.
Yeah.
The only person that benefits is going to be these private contracts that make the money, which ironically happen to be very rich business people. It's weird.
Right. And inevitably, this came up earlier. Inevitably, those same people who get the contracts to do this work that the government can't keep up on. Oh, wouldn't you know, these are the same people donating to your legislators, donating to your governor, donating to the attorney general and secretary of state. And wouldn't you know that if you establish this relationship with these folks and give them sweet government contracts, that some of that money then winds up finding its way back into your campaign coffers too. It's a really nice circuitous system they've got going on there, huh?
Scott, it's just a coincidence.
Or it goes to Governor Braun's helicopter pad. I mean, like I said before, the rabbit hole goes real deep. But I think people are becoming more and more aware of these things, and more and more wanting to get involved in, not only community organizing and other things, but also they're starting to recognize that it's not our neighbors who's the problem. I mean, with what I just discussed, it becomes pretty obvious at some point. I think we're on the right track, and I hope we can use this opportunity, all of us who are meeting today, to continue to build relationship, build community, that kind of thing.
I look forward to finding out when that young man is going to run for office and which position he's going to run for.
Jimmy, what do you think?
Yes.
Sorry, what was that?
They're wondering when you're going to run for office.
Yes, that's a great question. I'm actually running for president in 2040.
No, you should be a little
Robert
sooner.
Freiberger II, although I go by Jimmy.
You should start now and do something at a smaller level so that you can build up to that, because you're ready.
Thank you. I appreciate it. I'll be working on it.
Yeah, no, thank you. That's so many good points there. I think as the corruption, as the theft, as the overt reverse Robin Hood stealing from you and your neighbors and taking that money to build Mike Braun's helipad, or pay for Jeff Bezos's wedding, or pay for another one of Elon Musk's rockets to blow up. We're seeing what our money's going to instead of helping us while the suffering's being turned up. And it sucks that it comes to that, but it is really, people are starting to wake up from it.
It's true. Part of the issue is inequality, the scale of inequality. Folks I can't wrap my heads around it. You know what I'm saying? Like, you start getting into talking about billions, folks don't, right? It's hard for people to conceive of it. And the other thing is that they're not here, right? And so it's a lot of it is kind of the man behind the curtain, right? Ultimately, the folks who are ultimately benefiting from this. And we can't lose sight of the fact of how much then what we're left with is, like, we're left to be pitted against each other, and to be turned against our neighbor, and to hate, to be taught to hate or say that person over there. Again, I've said this before, but like that I have so much in common with. They're the ones who are the reason why I'm suffering, right? And we got to break through that as well, right? The part of the thing is, like, if you live in Wayne County or Randolph County, or there's some folks who've got a little bit of money around here, but it's not. We don't even know. Like all the roads lead to Wall Street, right?
Yes, they do.
Yeah, I mean, we got a handful of billionaires here in the state of Indiana. I don't think it's a mistake that is it Cook? I mean, Cook is medical device, right? One of
Lilly, yeah.
Right. And one of the things about it is the healthcare industry, right, is from the point of view, the folks, the powers that be, the wealthy, the ruling class, they they're in their own crisis of like figuring out how to accumulate and continue to accumulate profits. And part of why they really focus so much on sucking us dry on the healthcare is it's a safe investment. They can like really get in there because folks need healthcare, right? And so that's a big thing. And so I want to suggest that it's really important for folks. We need to study that economic aspect, not just be like whatever to be show off that we're smarty pants or something, but it's actually a real vulnerability of the folks who actually have so much power in this country, right? Because they only can get that wealth through making profits off of this, right? And bleeding us dry. Housing's another one, and we organize around the housing question around here too. So we got to find those issues. There's strategic issues. There's a lot of ways that people are catching hell, but those are strategic issues, and we need to get in and really dig in there and organize people around them. So yeah.
How do we communicate this to average folks? I think because so many people, they flip on the TV and Fox is on. So many folks. If you turn on the radio for news, basically anywhere in the state, you're getting a right-wing slop.
Yeah.
So how do we break through with a unifying, positive, progressive message?
Well, the first thing, and I know it's not satisfying, but like you're not just going to win this over a good conversation, right? And it's a little bit of a liberal tendency to think, and I'm not saying that's what you're saying. I'm just saying there's a little bit of a thing where it's like, if we just we got our facts straight and our correct argument or whatever, we're going to prevail. And that's not right. It's going to take organizing. I come out of a history with it's getting ready to rain here. National Welfare Rights and the National Union of the Homeless were some folks that inspire a lot of the work I'm a part of. And they had a saying. They said, you only get what you're organized to take. You only get what you're organized to take. And so we need to build bases of folks in our communities. And that's hard. That's not sexy work, y'all. It's not. Right. We need good rap. We need folks like you making good podcasts, getting the word out, all that. That's really vital. But without us we call ourselves the Nonviolent Medicaid Army, right? Like we're serious about that. We're going to take an army, right? It's going to have to take, and you have to identify folks who are getting hurt, right? Who are on the front end of catching hell. And then you got to unite them together. And then they can provide leadership to folks in the middle who are falling into crisis, right? So that's not going to get funded largely by foundations. We got to figure out real creative ways to start building those organizations of the poor and dispossessed. And unless we're doing that, I don't know what we're doing. Like we're screaming we're pissing in the wind. And so that's my humble point of view.
No, you're 100% right, and I really appreciate you guys, what you're out there doing. Spending your lovely July Saturday out here doing this and organizing people instead of like going out on the lake or like firing up the barbecue. These are the things you could be doing, and you're here giving up your day on behalf of other people just because they're people and they deserve it. So much I think of the last 40, 50 years of Reaganism, trickle down neoliberalism, whatever you want to call it, has been making us feel like we don't deserve it. Like we don't deserve healthcare. We don't deserve these things. They're abusing us, not just in withholding services, but also like psychologically.
Right. And one thing I was going to say too is like with the healthcare issue, for example, once you really dig in deep, you find there's this whole world that encompasses the issue of American poverty, and really, what's a healthcare issue is a housing issue. What's a housing issue is a human rights issue, and you can't start off like with that with folks like everything is everything. So what we're doing is, I mean, that this healthcare issue is a single issue that's a very I like to call it a point of departure, a strategic point of departure, right? Because I think where that work begins is you bring folks together across different lines here to talk about hey, there's this thing coming up. We or someone we know or love is insured by Medicaid. They're at risk, and we start talking. We start sharing stories, and then somebody says, I'm not on Medicaid, but I have a community health center with 100,000 patients. Or somebody says, I'm an audiologist, I have patients who are going to lose their hearing. Then you have somebody say, I live in a slum, and there's still lead pipes and lead paint, and I have a health issue because of that, but I'm not insured by Medicaid. Then you're like, wait, this is actually also a housing issue. You bring folks together, they exchange and listen to stories, and you stay consistent. You keep in touch with folks, and you continue to demonstrate that you care about them, not just yourself, but about the village, the community. And I mean, I think that's where you start with an issue that's important to people, and then you expand it in a way that's not overbearing or is going to confuse people, right? I mean, actually, I started on the housing front here. It was only after meeting, like I said, those people with like lead paint and pipes, and how most of the people we were talking to, these tenants, had a healthcare issue, that expanded my worldview to that this isn't just a housing issue, it's a healthcare issue, it's a human rights issue. So I mean, that's just a little thought on that.
These things are all related, right? Like it's intersectionality is what you're talking about, that all of these issues are in fact it's a healthcare issue, it's a housing issue, it's a quality of life issue, education. If you look at this one, for example, we talk about how our educational attainment in the state is not great. Well, and the Indianapolis schools are underperforming. Well, yeah, man, schools are underperforming wherever there's poverty. Like, it's a poverty issue, and it turns out all of these issues are capitalism issues.
Yeah, no, absolutely. And I mean, it's like I say, I mean, we got to get to a certain point. You start something simple, and then you expand it, and you all come to understand that maybe there's a certain kind of system or whatever political economy in place, right? I mean, we had someone today talk about the national parks that are going to be at risk because of this bill, right?
Absolutely.
Residents today talk about this crazy company or something. What's it called? APEC or something? What?
Alec.
Yeah, sorry. Yeah. Alec, like these people who are actually writing a lot of these bills and just sending them, which might be why when you ask these Congress people, what's the deal with this? Like, well, I don't know.
I have no idea.
But you're the sponsor.
Yeah, you're the sponsor, right?
Did you read it?
Like the Indiana, the state legislature here is notorious for this. We're horrible about it. I mean, look, y'all know some of our Republican state legislators are not the sharpest tools in the shed. Like, I don't think they're writing these laws. No, man, this stuff is coming out of Wichita, straight out of Koch Industries. A lot of this stuff, or the Heritage Foundation or whatever. And yeah, this bill mill, they tweak it this way, they tweak it that way, they introduce it in a bunch of different states to see where the weak point is, to see which argument sticks, and then they use that as a wedge to get in everywhere. We are an experimental testing ground, like David Pepper calls it, a laboratory of autocracy.
Yeah, that's well said.
The Republican dream state.
Yeah.
Tell folks how they can get involved and about the organizations that you guys are with. I know it's Nonviolent Medicaid Army, right? That's one of them.
Yeah, we're on Facebook and Instagram. Just look us up, Nonviolent Medicaid Army.
And it's not Indiana specific, is it, or is it?
No, so we're in about there's about 13 states that have, in some varying state of development of coordinating committees. But yeah, you can check us out. And then the local organizing group here around the housing is the Richmond Housing and Human Rights Coalition. And again, we're on Facebook there, and there's a website. So Yeah, what were you gonna say?
There we go. There's
Yeah.
the
Awesome.
Nonviolent
Thank
Medicaid
you.
Okay.
Army website there on the screen. I got that there for you, and I think we had your other one up there, the Richmond Human Rights Coalition. If
Housing
that
and
was the
human
one
rights.
I'm
Yeah.
thinking of. Thank you.
Yeah, housing.
Yeah.
One quick thing too. So for the Richmond Housing and Human Rights Coalition, we are a locally based group, but we value very heavily connecting with other points of struggle in places not only all across the country, but even beyond our country as well. For example, a couple of us actually went with the LA Tenants Union a couple of months ago and learned and exchanged with them. We're thinking about visiting Put People's First Pennsylvania here in the upcoming months. So even if, say you're not in Richmond, so you can't formally organize with us in that way, if you're engaged in your own point of struggle, we would love to exchange notes and talk and, find out what we can learn from each other.
Yeah.
And here, and I've got the Richmond Housing and Human Rights Coalition Facebook up there on the screen, so that's where you can find them.
Yeah. Speaking of other things we could be doing, I gotta get to my kids' marching band competition. So we're gonna wrap it up here.
Well, hey, thank you so much for all your work there out in Richmond and Eastern Indiana. Appreciate both you guys. Hope we get a chance to talk to you more. Work together and see what y'all are up to there. Really interested. Keep up the good work. Thanks for sharing your stories with us today.
Absolutely.
Thanks, y'all.
I think
Thank
guys
you.
are both going places. I look forward to seeing what becomes of it.
Okay, beautiful. Be well. Take care.
You
Bye-bye.
too.
Thanks, guys. Well, that was awesome. We got a chance to meet those guys today. Really good stuff out there in Richmond, and Eastern Indiana kind of gets lost in the shuffle. I feel like people
That's
forget
true.
they're there.
That's true. I'm excited. All we need is some active people to start getting involved in organizations like that, to be able to get the word out that, hey, this is not that scary. It's not as unattainable as it seems. You just have to make that first step. Go see that first organization and just check it out. And if you don't like it, try a different one and find out where you fit in your community. Big shout out to the Indiana Rural Summit and Organizing Indiana. They did a lot with Hoosier Action and Families First National Day of Action today. There was a lot of folks that was mobilized, and I think a lot of good connections came from it. And I certainly enjoyed talking to all those people today. It's definitely needed. It's needed. I think this was really cool because I know you went out on a limb and tried this, and I think it's amazing because people are going to be able to have this as a resource to look back on as well if they want to watch the replay and kind of fast forward and see who popped in and see who all's checked in today.
It was, and I thank you so much, Brandy, for just being here and helping me eat up time. And just
thank you for letting me. I truly, I didn't want to take over your show, but I do appreciate you letting me hang out. I wasn't able to make it to the caravan today. I have a couple of vehicles that have issues, but this was kind of a way that I thought I could. I really thought my camera was going to work, but I was all set up and ready to go. But
well, hey, we'll try this again, and we'll get your face on the screen sometime. But thank you for helping me fill this time in between, people's stories, which I think was really the point of the day, the highlight of the day, and I'm glad that we've had a chance to just offer up whatever little platform we have to these folks to tell their stories and to get them out there, and we can clip them and send them around the world and see what catches, because everybody's got a story like this.
Absolutely.
About some way, except for the very most fortunate among us, and let's not go off on a rant on how much they're actually dependent on government when it comes down to it. But
they're the biggest the biggest takers of all of the government handouts, but you know.
Exactly. And yet, like most of us, we've had a time where we've fallen on hard times, and maybe we've needed government assistance or assistance from our community in some way, and really just like people are generous and they want to help each other. And I think when we poll people on this across the country, yeah, we do want to help our neighbors and have strong social safety nets. It really, it just depends on the way you frame it, the way you talk about it. And yeah, geez, you know, a good, well-run society would make sure we all have our basic necessities met. And hey, back to economics. It's the most efficient way to do things, just to pool all the resources
Yeah.
together, right?
Yeah, because a healthy person is going to be able to work effectively, and it's going to be able to pay their rent, pay their mortgage, and actually have a home to lay their head down at night. You know, all of it, like the young gentleman Jimmy was saying, you know, it really does all connect. And anytime that one of those legs of the connection fall off, then it affects everything else. You know, you break a leg, you lose your job, you lose your house. Like, it is all connected. And we're not, none of us are far off from having something implode on one side of that, you know? And like you said, everybody knows somebody that's going to be affected by this, whether it's an elderly person that depends on Medicaid for their supplemental insurance, or somebody that, you know, even folks tend to forget that foster kids, they actually have Medicaid. So, you know, they're a big part of it as well. I used to be a foster mom, and I would not have been able to do that had I had to provide medical care. You know, it's because if you don't adopt a child, you can't, they're not valid on your insurance. So while you're fostering them, you know, Medicaid comes into play. And a lot of times, even after adoption, those kids still qualify, no matter what the income of the family is. A lot of times, because they're adopted, they still qualify for Medicaid. So, you know, it's just,
I was not aware of that.
Yeah, it depends on the situation, but yeah. And because think about it, you know, a lot of folks wouldn't be able to, even with all the love in their heart, that doesn't cover the food bill and the extra, you know, clothing and bedding and all that stuff that you got to consider when you're talking about adoption. And these kids would otherwise be in the system somewhere, being bounced around to different foster homes. So again, it's easier, cheaper to actually provide the medical coverage and get them a forever home than it is to keep bouncing them. And they're going to, you know, while they're being bounced around, they're going to have medical coverage anyway. So we might as well go ahead and make it a permanent home, and they get that care that they need and deserve, like all of us do.
And it again, it's the economically efficient thing to do. You're investing in your people. I think what I forget what stat I pulled up earlier, and exactly what the context was, but it was like something like every Medicaid dollar invested in children is like, you know, repaid over 62 times over the course of their lifetime or something. It's when we invest in our people, when we make our people safe, healthy, sheltered, fed, you know, like, even if you look at it from the most cynical standpoint, if you're an evil mustache twirling billionaire and you look at people as nothing more than cogs and sources of profit, you want to take care of your shit.
Yeah.
Like if your stuff isn't in good order, it doesn't work right. And all of our, we're a far more productive society if all of our people are well taken care of. Like, we don't even know the things we're potentially missing out on.
Absolutely. I was going to say that. People don't dream when their bellies are hungry, when they're worried about how they're going to get to work tomorrow because their tire blew. Those are not your dreamers and your innovators and your politicians who are able to step forward and be able to actually dedicate any type of thought to being of service to their community. They're more worried about how am I going to make this work for tomorrow. And trust me, I've been there. Like when you're in a situation like that, you're not dreaming. That's for sure.
Yeah, no, and it puts you in a constant state of anxiety, of fight or flight, a heightened state, where you're only worried about your own survival at any given time, and you can't make good decisions. You can't plan ahead. You set people up to fail when you leave them in precarious situations.
Especially our young, especially, giving them a solid foundation to be able to be healthy and grow up, that takes away from their potential when they become an adult, because, kids that don't have their needs met are always anxious and worried about the next, whatever, because guess what? If mom and dad can't pay the rent and you have to move again because you've been evicted again, as a little kid, that creates a nervous system that is not able to be regulated. And as you get older, you are going to take it from somebody who knows, who's been through it. You are going to have a very anxious system. And it's just, it's innate and it's in you, and there's nothing you can do to get rid of it. You just have to learn how to manage it, because when you don't know when the other shoe's going to drop as you're growing up every day, even when you're an adult and you know that you're solid and you're okay, your nervous system's still built that way. It still was wired that way. And it's very difficult. I'm not saying it's impossible, but it's very difficult to change your nervous system. So I just think that if I had, as I was younger, if I had more resources, if I had been offered counseling, if I just wonder what type of person I would have been able to, to do more things and to be able to dream bigger and to be able, I just wonder. And I think of the little kids today, and I just hope that they have that opportunity to be able to be more than what we were.
Yeah, you think of the kid like in a tiny like Unionville school district or something, or in a big school district like Indianapolis.
Yeah.
Worlds apart,
Yep.
Yet both underserved, disinvested communities. How many kids are going to school hungry, are going to school worried and anxious, that they're going to have to move again, that they're going to have to change schools, that they're going to have to make new friends. God, we have homeless children all throughout the state. I've got a kid in school still. You have to fill out the form every year.
Yeah.
Are you homeless? They wouldn't ask if it wasn't a problem.
Yep.
And you just wonder, right? Like, if these kids had full bellies and stable living environments, if we had good investment in communities and like quality public housing and healthcare available to everybody, and we didn't send people into debt spirals for falling ill, what could some of these kids become, right? What are we leaving on the table? Did the cure for cancer, did the inventor of that instead fall into a cycle of substance abuse because they weren't properly diagnosed with a behavioral disorder as a child or something? Did we fail to properly, did we put a kid on the graduation to incarceration pipeline?
Yeah.
instead of like the college track, just because I don't know they have a certain zip code. What could some of these kids have become if we had properly invested into them? What is that 62
Seriously.
times worth of
Seriously.
return
Yeah.
investment? What could that have been? Who discovers nuclear fusion? Who discovers a way to like pull carbon out of the atmosphere? Maybe we could have had these things by now if we had been taking care of
Our people.
our people, our best investment.
Yeah, our
Take care of your
future.
shit.
Yeah, our future are our children, and it's really difficult when it's hard when you're a little kid. If mommy and daddy are struggling to keep a roof over your head, mommy and daddy might fight a little bit more, and they might argue a little bit more. They might turn to substances to deal with the stress that they're under. And guess what? Even if you try to pull yourself up from your bootstraps, sometimes those bad boys break, and you really need somebody to fall back on. And like you said, sometimes there's not that person to fall back on. Sometimes these people are from a family that went through the exact same things that they are, and their whole family's struggling. And you brought up a good point. It's these kids are going to go from sliding their tray down their elementary and middle school and high school lunch lines to sliding those same trays down their incarceration facility. It's not much different. It's just a different setting. And God forbid those kids fall into trouble very early, because there's not many systems in place to keep them on the right track, let alone to get them back on the right track once they've fallen off. It's very easy for them to go into any type of juvenile hall or even jail and just learn how to be a better criminal. That's a good place for education for them, unfortunately, on how to do all the wrong things. So although I do believe in, law and justice, putting these things on these kids' records at such early ages with no real way to turn them around just pretty much guarantees them a future of in and out of the facilities, unfortunately. So we need to stop that. We need to get these kids early to where they're well adjusted. They can regulate their systems. They don't need to turn to substance. They don't need to, react and physically harm somebody over, just getting their emotional system all out of whack and doing something stupid that they're going to regret 2 seconds later. It can be done. It's certainly there are other countries that don't even have prison systems like us, and certainly not as many people incarcerated. So there are ways to do this. We just need to look outside of this country and take what works for others, pick and pull of what works, and compile it here and try. Because what do we have to lose at this point?
Yeah, I mean, we're on the verge of losing everything, and God, I hate to keep coming back to it because, like, I sound like a broken record, but with like government efficiency and spending and economics and getting the most bang for the buck, like, you talk about incarceration. How much it costs to police and lock up and release and re-lock up and re-police and everything people, and how much that costs versus like what little it would have cost to invest in them up front. I think of the young woman in that motorcade was telling us about her teeth, right?
Yeah.
And a lot of the way we think about it in this country is, I don't want to pay $100 of taxpayer money to fix her teeth. She should get her own $100 and fix her teeth. And she's like, well, okay, can't afford it. And, goes without and goes without and goes without until it becomes infected. You can't take it anymore. You go to the emergency room, and now you got a $5,000 bill. And,
taxpayers going to pay that time because
you can't
they're
afford
going to be
that.
forced
So, yeah.
to do it.
Exactly. Now the taxpayer's on the hook for the 5,000 instead of the 100. Like, it's dumb. It's just dumb. It's bad economics. All these Republicans, genius businessmen, should know better, right?
Well, the thing is, they profit from it. You know what I mean? Ultimately, they have something to gain from it, so they have really no motivation to do anything different because their pockets are getting fat. They don't really see the problem. They think, well, that person gets what's coming. They should have done better. They should have tried harder. They should have, shoulda, coulda, woulda.
Right. And it's selfishness, it's greed, it's probably the deadliest of the sins, and it is the root of all the evil, that we just not wanting to share.
Yeah. I think that idea of us thinking that, the American exceptionalism, thinking that we are the gold standard. Obviously, most of us realize we've been knocked off that pedestal, and we realize that, that maybe that was a lot of hype that our government told us that wasn't necessarily true. Maybe it will open some people's eyes to think, well, maybe we could try something different. Maybe it's time to just think outside of the box. I hope.
Yeah. Just a little bit of socialism. We don't even need to think that far outside the box, right?
Right.
After in the 30s, 40s, 50s, 60s, like when we actually built the world's largest middle class, we had things like higher taxes on the wealthy, strong unions, a relatively high minimum wage. Things were not perfect by any stretch back then, especially for any racial or gender minority, but things were on the way up. And it's precisely because we were investing in people, and the reason World War II happened and we found ourselves kind of on top of the world with, all of Europe and Japan basically destroyed, right? And it was rampant greed. It was uncontrolled greed by capital in this country, the Roaring 20s, the Gilded Age. In other countries, it kind of manifested itself as colonialism, right? It wasn't the capitalist class; it was the king, I guess the head of the capitalist class there, right? It was empires going and racing to extract the most from the most places, and getting into fights over these resources. And after that war, I feel like we learned that lesson for a good long time. And then after 40 years or so, it was like you start to forget that lesson. And now, some 80 years later, it's almost completely forgotten. So, 40 years after, you open up that greed can of worms just a little bit, the economy, right? And just a little bit of exploitation as a treat, and here you are, 40 years after that, and we've fallen back into the same pit with wealth disparities worse now than they were during the Gilded Age, worse now than they were right before the French Revolution. You get to that point and something's got to give.
What are people so afraid of, though? I want to know what the average person is afraid of by taxing the rich their fair share. How could any common person see that as bad? I can't wrap my head around it. The only thing I can think is that they've been told the lie that all of these companies and corporations will close down because they won't afford to be able to stay open, which, sorry, I laughed because it's laughable.
Well, it's more like we're not even talking about that. Democrats don't want to go to bat against big corporations either. In far too many cases, they don't want to take on the wealth class because they think they need that billionaire money to compete. And they're kind of caught between a rock and a hard place, where well, okay, we want to compete, so you need that money. then you maybe have to abandon your values some or a lot, or and so we're not having that conversation. We're fighting about other things. We're fighting about like where a trans person can take a leak, or you know, who's on your 5th grade intramural soccer team, or you know, who's allowed to marry who, or what have you, right? Pick
It's
your
the silliest thing.
pick your culture war issue. There's always another one, right?
Mm-hmm.
Abortion. You know, let's fight over these things, all you people, while all of us, rich types, Democrat and Republican alike, make off with all the money. Now, you know, I don't think that's everybody. I think that applies to the entire Republican Party and at least half the Democratic Party. So there are still lots of good people out there who I think are not captured in that way, but you know, it's just sort of the way the game is played, and it's really hard to fight against that. You're not allowed to talk about that. We can't talk about money. We can't talk about wealth disparity. That's commie shit.
I don't understand it. I think that it's so bizarre how people go to bat and protect people that they're never met, never going to know, never going to benefit from. Like you know, for instance, this is a perfect example. So in New York, oh, I just lost his name. It just slipped my brain. But the gentleman that's running in New York, he's proposing that they have government ran grocery stores, and some people are outraged because why? Are you afraid that some CEO somewhere is not going to make off with a profit from the grocery store? Like, huh? Like, think about it. If they really thought about it and was like, this is a zero profit grocery store, and guess what? We're going to pay the cashiers because it's going to be a government job. So they're going to be getting all the benefits that the government employees get, and nobody's going to profit anything. It's just going to be, you know, a net positive sort of thing where every diamond goes back into it, and your groceries are a decent price.
Well, right. And it's just like a lot of places in New York, and a lot of places throughout the world, we experience this problem a lot in rural Indiana, but also like again in Indianapolis, in the core of the city, you'll find food deserts where you know you can't access fresh food. We were talking to was it Bobby Lee down in Nineveh, and you know there's like a couple restaurants and a Dollar General, right?
Yeah, not much.
So many towns like food. You know, if you don't have a working vehicle, if you can't drive the next town over to get groceries, like it's Dollar General. It's you know, prepackaged, processed stuff, fresh food. The irony of being like surrounded by farmland and unable to buy fresh food is astonishing. But then, yeah, in New York, you know, you'll find communities where there's poverty, and the market is like, well, you know, a grocery store is not going to be profitable in this neighborhood, or not enough, not to justify the, you know, overhead or whatever their calculation is, and so these markets go without. Like, people there want food. They need food. They want fresh food. We tell people to like make America healthy again and eat fresh things, right? Well, you got to give them some place to do that, and you know, your local dollar store is not that place.
I think that our worldview, though, around just the amount of capitalism and the push to have these big grocery stores and this big Walmart situation, I think a lot of us, like myself, haven't really left this country. I've only left the country once, but a lot of us aren't well traveled, and we don't see other cultures and how they do it. And I know for me, like when the TikTok ban happened and everybody was going to Red Note, I don't know if you're familiar with all that, but a lot of people kind of put the middle finger up at our government and joined Red Note, which is the actual Chinese version, or not version. It's kind of something like it, but.
I had someone on the podcast just a couple weeks ago. Anna Keebler, local Hoosier author, just published her debut. It's a memoir about the time she spent in China. She not ran away. She, her parents knew where she was going, but she, left home for China when she was like 19 years old and lived several years there. And she maintains a Red Note account to this day.
I think the idea that when we were able to be actually exposed, and I'm not pretending like all of China is great and that's all that we've seen, but to see people literally giving us tours of their apartments, of their hometowns, of their processes to go to the doctor, their processes to go to the hospital, like we've seen it firsthand, and it was wild. They walked outside and 2 blocks down and they were at a fresh market. That's where I was going with this. They literally, the rainbow of produce that was available, and they actually tallied everything up and showed us what it would be in US dollars for their grocery haul. And so it's like, they don't get paid much. So their annual salaries aren't much, but my God, their expenses are so small. It was mind blowing. I mean, just literally, a lot of us were like, wait, what?
Yeah.
And it's like, can't we take some good aspects of that style of living and actually benefit from it? It's because, here our people can't afford to get fresh fruit because it's cheaper to get the processed foods. So yeah, it's going to cause health issues because people can't afford to get fresh salmon and fresh fish, and we buy the fish sticks instead. So it's like,
let's make
it work for people. Figure out a way to make it happen.
Right, and it's like we want to take the easy way, I think, as a society. Naturally, it's like we're going to let the market, right? And if you go back to your Adam Smith, like the invisible hand of the market, and obviously that kind of implies it's the hand of God moving things. And well, if this is what the market wants, it must be what's right. No, not necessarily. I mean, left to itself. Again with the wild horse metaphor. No, left to itself, it's going to stomp you. And
it's crazy to me how much we make sure that everybody's profiting from, like wildly profiting, instead of having some sort of common sense. I'm not saying regulate everything, but I mean, just some, like you said, the basic fundamental things like housing and food. I mean, that stuff should public transportation is another huge one. We are really left in the dust on that from it's our own fault. We just haven't made it a priority.
It's investment, right? It's one of those things that's a short-term investment. We're overlooking the long-term gain, man. Like just imagine the economic stimulus you'd get from building high-speed rail infrastructure, right? I mean, number one, just building the stuff is going to it's going to require a lot of construction jobs. It's going to involve manpower. It's going to involve communities all across the country, are going to need to be in on this thing, miles and miles and miles, thousands of miles of track, stations, I'm just thinking like a massive infrastructure project like that. Maybe that's the one you want to talk about. Maybe it's some sort of climate resilience. I don't know. I'm still a 5-year-old boy at heart. I like choo-choos, but
something that's accessible for people, because in order to have in order to be able to afford a car, there's so much stuff that goes into it. You have to afford the insurance, you have to afford the maintenance. And in a lot of countries, this is a crazy idea to them, that the fact that we all have our own cars. It's just insane. They don't understand it. It's just they literally don't see a need for it, because I wouldn't say every, some of the countries I've been looking at lately have this community where they can walk to everything. It's accessible, or they can hop on public transit and get there right away. And
oh man, they're all gonna herd us into the 15-minute cities.
Right? But a lot of these are
Sounds
literally
awesome. I'm for it. Yeah.
You just walk downstairs, you walk outside, and you go down the street, and there's a market, and you just buy what you need every day, and you take, you have fresh produce every day because you just walk down there and grab it. It's like, if we allowed for Walmarts to not take over, and if we allowed for places to be able to afford to do that, we would have them instead of running them out of town,
And right with and boy, the whole Walmart thing, when you talk about Walmart coming in and taking over a town and moving in and pushing out local jobs, mom and pop, like that little hardware store she was talking about down there. We got a couple of those here in Bloomington that are like that, and I'll be like devastated if they ever go out of business. But those things are like the backbones of our communities. And when Walmart comes in and they undercut all of the local businesses by beating them on price, by selling things cheap, that price difference is in the exploitation. It's they're importing all their stuff. They're making all their stuff in China or Pakistan or wherever they're making their stuff. And we obviously, people are motivated by price. You want to pay lower prices, but the real cost is like the soul of our communities, that we sold to the Walton family, and somehow like we blame the exploited people on the other side of the world in a sweatshop or in a right. They took our job, right? And it's their fault. And like we overlook the people who are profiting off of that exploitation. And I don't know, man, like we worship these people here.
All whilst Walmart actually training people, bringing it back to the Medicaid, they train their employees on how to apply for Medicaid because they know they don't pay them enough. And most of their employees, or I wouldn't say most, a large chunk of their employees qualify for Medicaid. So a corporation like that makes that much money knowingly pays their employees so little that they actually have to apply for government assistance. So they're robbing the mom and pop stores of a position to even try to succeed. And they're taking off, running away with the proceeds and leaving folks here to try to figure out the social safety net programs that are, getting ready to get chopped. It just doesn't make sense. And if everybody had a moment to stop and take a breath and actually think about it, we would revolt because it doesn't make sense.
You're absolutely right, and really, I'm glad you brought it back to the Medicaid, which again is the reason we're here today for this Families First Day of Action across Indiana and across the country. From down here in southern Indiana with the motorcade for Medicaid to events in Maryville and South Bend and Fort Wayne and Terre Haute and Richmond and, points in between. It is because here in Indiana, the Braun administration and nationally the Trump regime are, just slashing our social safety nets and leaving people behind, leaving people our own, kind of selling off our collective healthcare system for parts to people like, the Walmart owners and all the other of the ownership class who continue to make out like bandits while we're just, suffering more and more. And really that's I think should be the theme of the day. These people that we've met today, who I appreciate telling their stories, being vulnerable with us, and sharing their stories. They're real people who are good people, just trying to do their best in the world. And no one deserves to go bankrupt because they don't have health care. No one should go without health care because they can't afford it. And we've seen how heartbreaking it is throughout the day. And yet the way we do things is just like, it's silly. It's silly that it's ridiculous that these folks have to come out here and pour their hearts out to us, because it doesn't make sense to run any sane country like this.
No. I mean, if they really want a solid workforce, they would take care of folks. If you really want a really successful country, you want that country to be healthy.
Yeah, 100%. So listen, Brandy, I've been on here for going on 8.5 hours now.
I was waiting to see when you were going to fold, because I was getting close.
I think, yeah. Well, I think the dog's, scratching at the door, like, "Hey, come on, Dad, come on, can we go outside? We've been cooped up all day long, man." And I really wanted to reiterate, before we get going, that a lot of Hoosiers are going to be affected by this. Good, decent people that don't deserve to have their health care held hostage. This is not a sane way to run a country. It is silly. There are so many unnecessary steps, each at which each one has extracted a toll. And if we just wanted to make a more humane system, yeah, man, just a dash of socialism will do you.
Yeah, absolutely. It wouldn't be that difficult. People would just let go of the ideas that they're stuck on that aren't working for folks.
Brandy, what did you want to close with today? Do you have some closing words of wisdom? What are your kind of overall thoughts here for this afternoon?
I really appreciate everything that you folks do on Project Next, and connecting with everyday people like myself, and giving people a platform to be able to speak and share, their stories. And I'm so proud of the 50501 Indiana folks, and so proud of Michelle Higgs for running a second time to be state rep. Because running as a Democrat in Indiana is a valiant thing. She deserves all the credit for doing this, and she's super smart and capable. So proud to be part of her team.
Michelle.
Yeah, she's good people. And all of the folks that came together today, that, like you said, it's hard to be vulnerable, and they really did show up and tell us some of their personal stories. Indiana Rural Summit's doing fantastic things, Organizing Indiana, Hoosier Action, all of these days of action, they really do all come together and give us momentum to keep going and keep fighting for what we see that can be. We don't have to accept what we have. We can get some young, energized folks like Jimmy involved and get those folks running for office. All you need is a heart, You need to have a good heart and a good, moral compass, and everything else you can learn. You can't learn those things. Those things you either have or you don't.
It's true. You can, it's not that you're born with it or not, because I do think a lot of that is nurture. And I think the people who were not nurtured and suffer, their own kind of traumas, perpetuate those traumas. and we just have to be kind to one another, really, because everybody can. I think everybody can get there. You know, if it's not, but if that kindness isn't nurtured, it will wither. It will wither. You look at a guy like Trump, man. Like,
Right.
worst person you can think of. Like, terrible person. Deep down in there, as a sad little boy whose dad did not love him, or didn't show him that he
Absolutely.
loved him,
Trauma for
you know.
sure. The
And
reason I
and
laughed
now,
at the be kind thing was because that is my handle across most social media. My YouTube is be kind to all. My TikTok is _ the letter B, kind to all. So when you said just be kind, that's kind of my motto. It's just keep it simple, stupid. You know, just be kind, just be nice. It doesn't have to be any more difficult than that.
absolutely, yes, we have to love each other, and that's my yours is be kind, mine is love each other, and really, if you know, we love each other at a societal level, we love the people who are, you know, quote unquote lower than us, that we you know, we think they're lower than us, we think they're lesser than us, we think these people are other and don't deserve things. Well, listen, if you treat people with love, and you invest that love when they're young, you don't wind up with grown-ass people like Donald Trump.
That's right.
And that's how we avoid this ever happening again.
That's right. I'm looking forward to seeing what positive can come out of all this and see what we can build. I know I am not going anywhere. I'm in the fight. I'm pretty deep in it right now.
Yeah, so I thank you for all the work you're doing. You know, it has a way of taking over, right? You're like, oh, I
Yeah.
can do that, and you say yes, and then you say yes again, and then that's your whole life.
I love it
know
though. I
but
get so much
yes.
reward from it. So it's really hard to not, you know, I've pretty much told everybody that I'll be there as much as I can and provide, you know, what I can. And that's all anybody expects of anybody. We can all give each other grace and know that not everybody's going to be able to do everything. And that's the beauty about community organizations, is that, you know, when I can't show up, somebody else is going to show up in my place and vice versa. So it really does take the village in the movements, you know, to be able to pull it all off, because burnout is real and we don't want that either. So all you young folks that have more energy, feel free to come join us, because we need you desperately.
Step up. There's a place for everybody. Yeah, there's a role for everyone in the resistance. Actually, this coming week on the podcast, I've got a great conversation about that. There's a couple of indivisible activist fairs taking place. There's an activist fair taking place in Indianapolis, and then up in Northwest Indiana, they've got an educational event going on. And I'm talking to a couple of folks from Indivisible this coming week on the podcast, and they can help you find your way into this thing. Like I said, there's a role for everybody. Be a Brandy, you know, in a world full of Trumps. Be a Brandy.
I appreciate that.
Love your community. Help your community. You know, be kind to each other, and love each other. And I think that's where I want to close this today. Thank you, Brandy.
Hey, yeah, if anybody's interested, on 8/2, so I believe it's next weekend, we have a big protest, and Indivisible might be part of it even. I'm not sure if they usually join us on these big occasions, but we'll be downtown Indianapolis on August 2nd, and we're doing a protest, but we're doing it a little differently, and it's going to have a little nod towards Gen Con, I believe, because I think that it's going on at the same time. So
yes,
everybody should come check it out.
Awesome. I will have information about that. I will try and get out, share that.
You rock. I appreciate it.
Absolutely. And thank you. You rock. Thanks again for being here with me today and helping me
no problem. It's
carry
been fun.
this thing. I could not have done it alone. Brandy, appreciate you. We will talk again soon. But until next time, for now, I'm Scott Rogers. This has been Who's Left special coverage of the family's first day of action. Love each other, Indiana.